Today. Michelle.
Good morning. Thank you, Keith. I'm Michelle Davis, and I serve as the Executive Director for the Washington State Board of Health. The board is holding today's meeting virtually in response to the Governor's Healthy Washington Roadmap to Recovery order. All materials for today's meeting are available on our website, and they are on the meeting materials webpage. And so you can follow along as we proceed with our meeting today. Before we begin today's meeting, I'd like to share some instructions to help with our virtual meeting, and hopefully we can have this go as smoothly as possible. TVW is live streaming today's meeting, and you can watch the meeting on TVW. If you have difficulty accessing the webinar, TVW provides that space for you to watch the meeting. Public attendees can participate today by logging into the Zoom webinar link on the agenda and website, or logging in on the Zoom webinar app on their device or phone, or by calling in on your phone using the number provided to you after you pre-register for the meeting, or by using the number that is posted on our agenda. There are two main in-session features for our attendees. They include mute, unmute, and the Q&A box that are monitored by staff. Our board members do not have access to the Q&A box. Attendees who are viewing the meeting online are muted when they join. If the organizer unmutes you, you must click the mic icon to unmute yourself. With regard to the Q&A box, staff will post some instructions and information in the Q&A box, but please know that we have limited staff capacity to respond. Again, our board members cannot see the Q&A box, only the staff organizers can. We encourage attendees, if they wish to provide written public comment, to email those comments to the board at wsboh@sboh.wa.gov. For those individuals who have signed in to provide public comment today, the board accepts verbal public comments during the public comment section on our agenda. Now, due to the high volume of interest on certain agenda items today, we want to encourage you to submit your written public comment to the board's inbox at wsboh@sboh.wa.gov. And the chair and the staff who are assisting, we're going to try to give as many people the opportunity to speak as possible. However, we likely will not be able to, not everyone will have the chance to provide verbal testimony today. So again, we welcome you to submit your public comments via the board's inbox. So instructions on providing public comment are posted in the Q&A box. And for individuals who are only joining us by phone, you can submit written comments to the board's inbox today, and we will be providing those comments to board members. We are also holding a rules hearing today. The board will take public testimony specific to the proposed communicable and other diseases rule during the hearing, and that will begin at 1:30. I just want to remind our viewers that the hearing is really focused on implementing a gross substitute House Bill 1551, that's Chapter 76, Laws of 2020. That was legislation that passed during the 2020 legislative session. It updates the language in the rule and changes references in the control and treatment of sexually transmitted diseases. It does not include changes to isolation and quarantine policies. Again, please submit any written comments to wsboh@sboh.law.gov. This meeting and all materials, including public comment, are subject to public disclosure law. Thank you for your continued patience as we continue to navigate the virtual environment. Keith, that concludes my comments for now.
All right, thank you, Michelle. Okay, board members, our first matter of business this morning is approval of the agenda.
Pendergrass, so moved.
This is Fran, I'll second.
Thank you, Tom and Fran. We have a motion and a second to approve the agenda. Any further discussion? Members in favor of approving the agenda, please say aye.
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 Aye. Members opposed, please say nay. Abstentions? Agenda approved. Next up is approval of the November 10, 2021 meeting minutes.
Pendergrass, I've reviewed the minutes. I see no corrections, deletions, or additions. I move approval.
Dave Put, second.
Thank you, Tom and Steve. We have a motion and a second for approval of the agenda, or the November 10th meeting minutes. Any further discussion? All right, hearing none. All those in favor of approving the November 10, 2021 meeting minutes, please say aye.
Aye.
Aye. Opposed?
Chair Grellner,
Yes.
it is the November 11th, 2021 minutes. You said
Stand
November.
corrected.
Yeah, thank you.
November 11, 2021 meeting minutes. Tom and Steve, is it okay if we amend your motion to include that correction?
Yes.
Yes.
All right, thank you. We have approval. We have the ayes. Anyone voting not to approve the November 11, 2021 meeting minutes, please say nay. Abstentions? All right, thank you. November 11, 2021 meeting minutes approved. Next, we will go to agenda item number 3, which is announcements and board business with Michelle Davis.
You're muted.
Thank you, Member Pendergrass. So I have a few announcements for board members today. Some of the materials that I'll be referring to are located under tab 3 of the board meeting materials packet. So first of all, Member Crockwell and Member Crawford send their regrets. They'll be unable to join us today. However, Member Lentz will be joining us for the afternoon portion of today's meeting. I wanted to give board members an update regarding staffing. We're currently recruiting for the position of manager of the Governor's Interagency Council on Health Disparities. Christy has served as a manager of the council for the last 15 years. She's been incredibly impactful in her time as council manager, and we're very sorry to see her go. She is taking a position at the Washington State Department of Health. Board packet materials include notes from the December Policy Committee meetings. Those meetings were focused on preparing for today's board meeting. The packet also includes the CR 103, that's an order of adoption that extends the notifiable conditions of permanent rule effective date, as well as the emergency rule related to laboratory reporting of COVID-19, and an order of adoption regarding PFAS and drinking water rules. Legislative session started on Monday, and we'll talk about our work in that regard later today, but I wanted to just share a little bit about current health impact review work. The health impact review team completed a health impact review on Monday regarding second substitute House Bill 1412 concerning legal financial obligations that was requested by Representative Simmons. The team testified on the findings to the legislature on the HIR on Tuesday. Our HIR team is now working on a health impact review at the request of Senator Randall for Senate Bill 5551 concerning Medicaid coverage of HIV antiviral drugs. The completion date for that health impact review request is Monday, January 17th. As with past sessions, board members will receive notification when the team receives a health impact review request and when they complete the health impact review. Please feel free to reach out to the team directly with any questions you may have. I want to now acknowledge the large volume of public comments that the board has received. Our team is still sorting and posting these comments to the website, so I want to encourage our board members to continuously connect with those comments in the coming days. For our viewing audience, the board is not considering amending the isolation and quarantine rules. There is no proposed change or update to the isolation and quarantine rules. And the board has not discussed and has no plans of requiring isolation and quarantine of people who are unvaccinated. The board is updating communicable disease rules to align with engrossed substitute House Bill 1551. Again, that law passed in 2020, and it made a lot of changes focused on communicable disease laws, namely those focused on HIV/AIDS. So when the legislature took that action to change the law, the board has an obligation to update the rules to reflect those changes in law. This is actually the second hearing. Today's meeting will be the second hearing on those rules. The board held its first rules hearing on this issue in November. And if you review our minutes, you can see the type of comments that we received from the public at that meeting. And based on the public comment that we received that requested some technical changes to the rule, we're continuing the discussion and the final decision on those rules to today. Again, that discussion is focused on what is required by state law. Board members, as you've reviewed many of the comments that we'll see that we've received, you'll see a high degree of concern and opposition to COVID-19 vaccines, mask mandates, and the technical advisory group that you've asked to begin reviewing research and literature about COVID-19 immunizations. For our viewing audience, we'll hear about the work that's been done so far and what we can anticipate as next steps. The board is not making a decision or voting on this work today. The exemption allowances that are listed in the state's immunization laws remain available for families and their children who choose not to get vaccinated against COVID-19. These exemptions include medical, religious, philosophical, or personal exemptions. And that completes my update. Board members, do you have any questions?
Right, looks like there are no questions. Thank you, Michelle. Again, for our viewing audience, I just want to be crystal clear on a couple of the comments that Michelle just made on the board's behalf. We are aware of two pieces of misinformation that have been circulating on social media And I just want to be very clear so we can be respectful of all of your time. The board is not considering isolation and quarantine camps for people that test positive for COVID or unvaccinated people. That is a false rumor, and we will not be discussing that today. Two, the second rumor was that the board was making a decision today regarding inclusion of the COVID or a COVID vaccine as a requirement for school entry for K through 12 age children. And again, that is a false rumor. We are not considering that today, although we will get a briefing from our technical advisory group. So again, one last time, no consideration of isolation and quarantine camps. That is a false rumor. No action on mandating vaccines for school-age children. Again, false rumor. We're sorry if you were led to believe otherwise, but those items are not on the agenda today, so thank you. Next up, we'll go to agenda item number 4, which is a Department of Health novel coronavirus update and other updates. Dr. Shaw or Dr. Quanget?
Keith, this is Mike Ellsworth. There's a slight delay with getting the PowerPoint on online, and so it's just going to take us about 3 to 5 minutes, if that's okay. I'm so sorry for the inconvenience. We just had a tech issue.
Okay, well, we'll stand by. We do see the cover slide that is up on the screen.
Yes, sir. There's just yes.
Okay, thank you, Mike. So audience members, if you could please stand by for just a minute while we work through the presentation materials. Thank you.
All right, guys. So while we're waiting, so Kate speaks. She's actually going to be speaking there today. That's she asked me. She brought this up and mentioned it to me. And I was like, "Holy shit! Yeah, heck yeah! I'll film this live stream this for you." Let me know, Kate, if you want to come in here. I just opened up I put private on my Discord chat, and I'm going to invite you right now. That way you can come on in, and if you want to speak. Well, because I have to go out, folks. My stepdad needs to go take a big, huge machine back, and I have to go help him load it real quick. So, if you guys want to come on in and listen to Kate while I'm outside, she'll be a great moderator for you guys. But like Kate's saying, it's funny. These people are saying, oh, no, we're not going to lock people up who aren't vaccinated. Like Kate says, that's BS. It's written right there in their agenda. It's pretty awful what they're trying to do here. And if anybody doesn't know about law and how it works, so if if Washington State were to do this and put this in and start arresting people and putting them in a prison because they're not vaccinated, then guess what? Kate has a lot more information on this than I do. So what she's explained, what's going to happen is, she said, I think there's one coming up in New York next week. There's one coming up in Oregon. There's
Keith or Kelly, I no longer hear anything.
Tom, there's nothing going on right now. We're waiting for the Department of Health and the technology to get the presentation up. So we're standing by for the moment.
No, Kate, do you want to come into my voice?
Thank you. I just had my camera quit, and I was trying to rejoin, and I want to make sure things are working on my end.
Okay, these guys aren't
We
talking.
hear you loud and clear. Thank you.
So anyway, so what we're trying to tell everybody, and everybody needs to understand this. What they're doing now is, if they approve this in Washington State, when they go to New York in a couple weeks and say, hey, guess what? We want to put people in jail, and we want to put them in jail for not having a vaccine. Well, guess what? You know what they're gonna say? Well, Washington State's doing it already, so guess what? That's a precedent. You are? I don't hear you. Do I have to unlock it? Hold on. Sorry, Kate. Do I have to unlock it? Oh, no. Oh, I see. I want to put you in here with me. There you go. I'll let Kate speak now. She knows more about this than anybody. So here you guys go. Kate's in the room now. Sorry, Kate. I wasn't understanding what you were saying.
Hi.
Here you go.
Can you hear me?
Yes, I can. Can everybody else hear Kate? Let me look at my live. Can you guys hear Kate? Can you say something, Kate, for me?
Hello.
Yep, they can hear you. Awesome. All right, so everybody can hear you.
So first I want to make some clarifications of what they are trying to do this runaround about. They are discussing today the COVID-19 vaccinations for K through 12. The advisory board consists of 25 members. I'm actually on the advisory board on behalf of homeschooling students. So they are going to be going over everything that we discussed in the advisory board and advising whether or not the Board of Health should make a rule, which is why people are up in arms, because they don't want COVID-19 to be mandated for K through 12. And today's the first day that the Board of Health is actually going to be discussing it. Does it mean that the rule is going to be made today for that? No, but this is the opportunity for public comment to be made to tell the Board of Health, hey, no, we don't want K through 12 to have COVID-19 vaccination mandated. And you are discussing it. And it is something that you are going over in this meeting. In fact, it's like agenda number 4. So they are doing this dance around of, we're not making decisions today. Yeah, we know you're not making decisions, dumb fuck. That's not what the social media post said. Social media post said that the Health Advisory Board was going to be discussing forcing children K through 12, that's children as young as 5, to get the COVID-19 vaccination. Now,
well, it looks like they're back. Let me turn the volume back up.
Okay, I am just trying to pull
I'm
up my
going to
slides
be
here.
speaking on
All right,
that
thank you.
specifically
Thank
on
you,
behalf
Sarah.
of the homeschooling students. So if you don't know this, they're trying to force homeschooling students to receive the same vaccinations public school students. And that is something that they are discussing as well today in this meeting. And then the second point that I wanted to make is they say, oh, we're not talking about, internment camps for unvaccinated, but the law that they are discussing and the rules that they are discussing includes internment camps. So maybe you're not going to openly discuss the fact that that law and those rules that you're discussing to potentially implement it at the Board of Health, specifically that portion, but because you are talking about these rules and these specific laws that include those clauses, you are discussing it. And so I love how they're like, we're not talking about this, but really we're talking about this. We're just not going to let you know we're talking about this. And that's what's going on right now.
Right on. All right, I'm going to turn them back up because it looks like they're speaking again. And
Legislation
I'll let you run the
directed
show.
the
All right, I
board
got to go help my
to
stepdad. So
adopt
thank you,
rules
Kate.
pertaining to the selection
Okay,
and
I'll be
appointment
around.
process for those
Stay
non-elected
in here
members
so that way you can
of
talk
local
over
boards
me.
of
Or
health.
your audio will be available the whole time through.
Oh, okay.
And I'm
Sounds
wondering,
cool. Thank you.
Kelly, if you are able
You're
to.
the person that
Oh, there we
knows
go.
more about this than anybody else.
Those are the slides. Okay.
Well, I mean, it is my
Kelly,
state and I have to stay informed, right?
Sorry, I'm not sure
Yeah.
who's sharing their
All right, guys,
screen
I'll
at
be
the
back in
moment.
like 20 minutes. I got to
But
go help my
if we
stepdad.
could move down to slide 3, that would be great. Thanks. So among the other items that you see on this slide, the board is engaging in rulemaking to define these selection and appointment process for non-elected members of local boards of health. As just a note, a local board of health that is comprised of elected officials only currently may retain their composition if they had a local public health advisory committee or board established by January 1st of last year. Next slide, please. So the board's rulemaking is scoped very narrowly to adopt rules regarding the appointment and selection process for those non-elected officials. And the legislation was very prescriptive in terms of who could serve in these non-elected positions. The bill defined 3 categories of people. The first category being public health, healthcare facilities, and providers. So individuals such as physicians, epidemiologists, or others practicing or employed in a local health jurisdiction. The second category is consumers of public health, residents of a local health jurisdiction who have self-identified as having faced significant health inequities or lived experience with public health programs. And the last category is other community stakeholders, individuals who represent community organizations within their jurisdiction, such as those working with populations experiencing health inequities.
So these rules that they're
business
talking about
community,
are
or
those
environmental
rules
health
that
organizations
include
regulated
the
by
internment
public health.
camp.
The board's rules must
So I
identify
just wanted to kind of let
a
you guys know
process
that
is
that's
fair,
what
unbiased, and
she is
ensure to the
discussing
extent
right now,
practicable
and those
that
are
membership
based off
of
of
local
the
boards of health
laws,
has
and those
balanced
laws
representation of
are
elected and non-elected folks
in
with
Washington
a
State.
diversity of expertise and lived experience. The
Tell
board's
you
rules
which
must
laws
go
they
into
are.
effect by July
They are
25th, 2022.
Washington Code
And as I noted, this bill passed last
246-100-040,
legislative session, so this
246-100-070,
timeline
and
is a bit faster than our typical rulemaking
246-100-045.
process. Just a note, that's why we've been to you all so many times in the last couple of months on this work. Can we go to the next slide, please? So the board filed the CR 101, the pre-proposal statement of inquiry, in June of 2021. And that's the point where the staff really began to work on a first kind of initial informal draft of this work. We began engaging with members of the Washington State Association of Local Public Health Officials, the Washington State Association of Counties, and community members who expressed an interest in serving on their local Board of Health. Staff developed a first informal draft that was distributed in October 2021 for comment. And we collected those comments and held a listening session to engage our interested parties in discussion and receive feedback on that first draft. A second informal draft was distributed in late December of 2021, and I'm going to go into more detail on that later in the presentation, but I'm going to turn it over to my colleague Hannah now to talk a little bit more about the community outreach and engagement work that's been going on. So if we could go to the next slide, please, and I see Hannah is here, so I will mute.
Good morning, all. Thank you for your time today. And yeah, if we could go to slide 7. Thank you. So yeah, I just wanted to talk a little bit about the community engagement that we have been doing for our rulemaking. So for our community engagement strategy, we have kind of taken a 3-pronged approach. So we have held strategic individual conversations. We have had a community input survey, and we held a listening session as well. And as a result of all those things, we were able to report back to the community on the changes that have been made and are continuing that conversational process. Next slide, please. There we go. Great. Thank you. So we've had lots of questions and conversation, but I wanted to share a few of the main questions that we asked the community as we were working through getting feedback. So we asked about what would motivate them to apply to be on a local Board of Health, what structures or norms they see as barriers for non-elected members to be able to serve, what can be done to encourage more people and people with more diverse experiences to apply, and if they could write the rules, what requirements would they make for people who want to apply to be on a local Board of Health. Next slide, please. So here are just a few samples of things that we heard back, and ones that these represent ones that were on common themes. So talking about a stipend or other type of payment for time spent working on local Board of Health matters would be a major incentive. Also limited terms so that power can't be consolidated or abused, and so that time commitment is not a deterrent. Having other people who are from my community, i.e. more BIPOC representation, would make some feel more comfortable. To have influence in the decisions that are made by the local Board of Health. The meetings need to be held at a time and places where community members can participate, and needing healthy change, less politics on health boards and more people with public health experience who are champions of working people. Next slide, please. And just so you can see a better overview of what we heard, you can see that the question about barriers was received the most comments on that one. And then on the feedback themes, you can see that training needed for new members and accessibility of meetings were the top 2 themes that we received comments on. So just to be able to see kind of the spread there. Next slide, please. And just as follow-up, we have been able to report out our changes, our proposed changes via email and strategic individual conversations. And we continue to work with the community board members and other interested parties to create guidance for local boards of health on how to implement this rule. And yeah, we just continue to have conversations with community members about these rules. Thank you.
Thanks, Hannah. If we could go to the next slide, please. So as I noted, we did distribute a second informal draft on December 23rd, 2021, and we are in the midst of an informal comment period that will end on Friday of this week. That informal draft is available on the board's rulemaking page for this work if folks are interested in taking a look. So based on the feedback that Hannah heard and that we received during the first informal comment period, we did make a number of changes in this updated draft. We did hear that there was a need to clearly define who the rules apply to. So in the first section of the draft, we've made clarification of who the chapter rule applies to, which is non-elected members of local boards of health. So this would not apply to the elected members, the tribal representative, or other members. We also heard feedback that it was not clear how the process for local board of health apparently successful applicants would be sent to the Board of County Commissioners or other legislative authority for approval. So we've included language requiring any ordinance or resolution that expands the local Board of Health to also define how that process looks. We also heard from our community members that there is a need to work with those folks who are on the ground in the community. And one of those approaches could be to have folks work to distribute vacancy notices. So when there are openings for non-elected member positions on the local Board of Health, we've included new language that would require a local Board of Health to work with local community organizations to distribute those vacancy notices. We also heard from some of our smaller communities that they anticipate challenges filling these non-elected positions and having folks apply for one of the 3 categories that I previously mentioned, but not having any applicants for another category. So we did clarify that any applicant can be considered for any of the non-elected positions for which they're qualified. For example, if an individual has applied for the first category, and which includes healthcare providers, but they also work with a local community organization serving folks experiencing health inequities, they could be considered to be eligible and qualified for either of those positions. We also heard that it's really important that members of a local Board of Health have a commitment to public health. So in the first draft, we did include some factors that the local Board of Health must consider when assessing an applicant's qualifications for the position. And we did include a new factor or criteria that a local Board of Health should assess an individual's commitment to public health as part of that review process. We also heard that there was a need for clarification around conflict of interest. So we have revised the conflict of interest language to ensure that non-elected members would be obligated to recuse themselves as other members would if they have a conflict of interest on a particular item before that local board of health. Next slide, please. Okay. We also made editorial clarifications around the tribal representative. So 1152 also includes requirement that a local board of health in a jurisdiction with reservation, usual, custom, or a 501c3 serving tribal populations has a tribal representative on their local board of health. And we just made some editorial clarifications that those folks would be selected through the process prescribed by the American Indian Health Commission as required by the legislation. We also heard a need to prohibit certain information from being asked on applications for local boards of health. So just to be clear, we did include language that a non-elected member may not be asked for their political affiliation or voting history as part of the application process.
I want to let you guys know that the agenda for the Board of Health, the main point that we want to really look at is the fourth item on the agenda. Right now we're on the second item of the agenda. So if you don't want to sit around and hear about random things that the Board of Health is doing in Washington State, and you want to specifically listen in to when they start talking about these rules changes, and then also the vaccination for children, that is going to be closer to 10:45 Pacific Standard Time.
Review applicants, and
so
one of those
if you're
in the initial draft
wanting to kind of bounce in and out, but really be here for where the important stuff is going to start, that's going to be closer to 10:45. Just kind of want to update you guys, so you're not sitting in the chat if you don't have the time to or whatever, of when it's really going to start to show their true colors.
We also clarified that newspaper is only required as a distribution mechanism for vacancies if there is a local paper, in which that makes sense. We know many of our smaller communities no longer have a direct local paper, so we want to make sure that makes sense for all communities across the state. And lastly, we clarified that any ordinance or resolution expanding the size of a local board of health to newly include non-elected members, it can differentiate between the initial term and future term length. We know that when boards and commissions add new members, those folks tend to all come on at once, and we want to ensure that the local board of health has the flexibility to ensure they don't all leave at once as well. Next slide, please. And that kind of concludes the update and the amendments to the second informal draft. I do just want to note, and I apologize, I kind of skipped over it earlier, but for our timeline for this work, as I noted, the informal draft is out for comment through this Friday, January 14th, and staff hope to kind of take that comment back, finalize our draft, and we anticipate filing the CR 102 or the proposed rule in March of 2022. In anticipation of an April rules hearing. And I'm happy to answer any questions that board members may have.
All right, thank you, Sam and Hannah. Appreciate that update. Board members, questions about Chapter 24690 WAC development? All right, well, thank you very much. Looks like we're all good to go, and look forward to probably another briefing at a future meeting regarding the second round of comments. All right. Well, thank you very much. Appreciate it. All right. Let's circle back for agenda item number 4. Mike, are we ready to go with the Department of Health presentation?
Hi, Keith. This is Umair Shah again. Sorry about that technical snafu. We were able to figure out what was going on, but it took longer than 3 to 5 minutes. It actually took us 7 minutes, so apologies for that. But I'm glad that you were able to swatch the agenda a bit. If it's okay, I can just start, and I apologize again for the confusion there, and we can go ahead and get started whenever you're ready. I'm going to be tag teaming this along with Dr. Quangette and Michelle Roberts. So just to give you a little bit of a course of what's ahead for the next several minutes here.
All right, thank you, Dr. Shaw. Go ahead.
Great. So good morning, everyone. And I want to, again, start by thanking all of you, our fellow board members, and all the staff for the Board of Health. I want to really just recognize what a challenging time this has been for everyone. And I know information oftentimes is absolutely the most important thing, good information, accurate information, but oftentimes information can get misconstrued. And so we want to do our best at the Board of Health to make sure that we are updating on the most current information related to COVID-19. And so from a Department of Health perspective, and as you know, there are two different entities here. We have the Board of Health, and the Secretary of Health has an ex officio position on the Board of Health, but there is also a separate Department of Health, and we oftentimes give an update on what's happening across the system. And in this case, we've been the last several board meetings giving updates, providing updates on COVID-19. And Chair Grellner, the reason I wanted to just share that is because of some of the other comments that have been out there and the confusion in the global space here on social media, et cetera. We wanted to make sure that there was an understanding of the relationship and the difference between the Board of Health and the Department of Health. That said, there is also a tremendous amount of gratitude that I wanted to give to all Washingtonians for where we are as a state. We know that there has been a long winter. As you can see in this image here, we've gone through some very challenging times with both weather related, but also with this pandemic. And this pandemic is now 22 plus months in. We continue to fight this pandemic, and this pandemic reminds us of the absolute importance of everyone working together. And I just want to say thank you to all Washingtonians who have continued to do that. And we have been really doing everything we can from a state perspective to be able to support Washingtonians, but in turn, we cannot do it without all of our community members. So with that, if we could, I don't know who's advancing slides, but I'll just say next, if that's okay. So here are the three speakers. I will be speaking, as well as Dr. Quangette. For those who may not know, he is our new Chief Science Officer. He's going to talk about COVID-19 and more in depth. And then Michelle Roberts will be speaking about vaccines and boosters, in particular pediatric vaccines and boosters. And Michelle is our acting Assistant Secretary for Prevention and Community Health, but she is all things COVID-19 vaccines. And I want to really thank the two of them for joining this morning. Next slide. So as you know, and I've spoken about this before, that we at the Department of Health see health as this intersection of equity, innovation, and engagement, and it is really these cornerstone values of EIE that we put forth in everything that we do. We have championed equity throughout this pandemic. We have championed creativity and working together with innovation throughout this pandemic, and certainly the engagement aspects of not being able to do this alone, but working with partners and again, all Washington community members is really how we look at health and the true concept of health, and not just healthcare delivery and not just public health, but true health and where we all come together. Next slide. I want to start with talking about Omicron across the globe and really maybe nationally to give this perspective on where we are with Omicron. As you know, we have had previous waves throughout the state of Washington and throughout the country and throughout the globe. And Delta wave was the wave that we were fighting and the wave that we had come through and felt like we were making progress. We had decrease in cases, decreases in hospitalizations. And then right around Thanksgiving, we learned the news that there was a finding of Omicron in South Africa, was where it was first characterized, in Botswana, but also recognizing that it was going to quickly, because it was thought to be more easily transmissible, quickly move across the globe, and that's what we have seen. Next slide. And so as you see this next slide, really, again, as I mentioned, right around Thanksgiving is when the designation occurred, both the World Health Organization and then a few days later with the Centers for Disease Control and Prevention, the CDC. And really the key message is that there was increased transmissibility. There was a significant reduction in neutralization by antibodies generated during previous infection or vaccination. And certainly there were real questions about the diagnostic tools that were necessary to be able to detect this variant. And so the transmissibility is what got most people's attention. And you've seen in the popular media and throughout, and even in many of the scientific work that's out there, is that the real concern is that while it does not appear to be more virulent or more lethal, it does appear to be more easily transmissible. And Dr. Kwan-Get and I can go into that in more detail, but we do believe that it's because it's higher up in the upper airways rather than being in the lower airways, lower respiratory tract. And because of that, you have the ability to transmit this more easily, or it's more infectious to people around you. Next slide. And this is that real transmission map that just shows you how it's spread and how it has spread very quickly. And this is not by cities, it's really, or communities, or in the US, in the case of states, this is really by countries. And so you see how very quickly you saw this spread throughout. It went, from what was first characterized, again, we do not believe that it was from South Africa. It was first characterized in South Africa, but then you started to see cases in the EU, the European Union. You started to see cases across other parts of Asia, and certainly in other parts of Africa. And then you really also recognize that there was movement across the Americas, and that's where we started to see things in the US as well. And then, as you know, that very quickly, and I want to give a lot of credit to our genotyping, genosequencing work at Department of Health, and also University of Washington Virology, and all of our partners on the ground, because we were able to very much increase our surveillance system to detect Omicron very early in the process in the state of Washington. And I cannot say enough about that surveillance system from a lab standpoint that really allowed us to be able to characterize what was happening in our state, and also then launch into what the actions were we were going to take to address them. Next slide. This reminds us of the fact that this Omicron is so transmissible that you have essentially across the US, Omicron has taken over. So that orange represents Delta and the purple represents Omicron. And you can see that by and large throughout the US, we have Omicron that has now overtaken Delta as the predominant variant. And that is no different than what we're seeing in Region 10, which includes the state of Washington, but also other states like Oregon and Idaho, et cetera. And so it's a really important piece for us to be thinking and really working everything that we can to work against this new variant that has now found itself. And now that we've addressed it, or are addressing it here in the US. Next slide. This shows it a little bit more. That you can see in purple is Omicron, and you can see where it was predominance of Delta pre-Thanksgiving, and then in orange, and now you start to see purple and the Omicron variant being the predominant variant in the 90+% in the US. And so that just shows you how easily transmissible it is, and that this wave
so I just want to let you guys know that I am
to,
here in the background, but today the Washington State Legislature is also discussing 3 gun laws.
And so
that hearing is starting right now, and there's a public comment section that I've signed up to speak in as well.
But I will tell
I'll be
you
bouncing
that,
between the 2 hearings,
a wave that's
just because they like to pack everything in on the same day.
First, you were seeing
if I could recommend anything to you guys, please sign up for public comment sections and do your research in your individual states, because it's so important that we're aware of what's going on in our country, and that's exactly what I'm doing today. But I will be speaking at the Public Health Board meeting as well around 12:15. It did start a little bit late, so I probably will be speaking a little bit later than 12:15 for that hearing. But the public comment for the gun laws is at the beginning of the hearing,
minutes.
So
Next slide.
I'm going to bounce into that hearing, but I'll be in the background of this one as well.
I'm going to show a couple of these slides on data, and then I'm going to, in just a bit, move over to Dr. Quan Get, who's going to provide some additional information about what's happening here in the state of Washington. But as you can see across the country, you've had an increase, a market increase over what you've seen in previous waves. There are a lot more cases that have been identified, and unfortunately, although we're seeing not as many proportionate hospitalizations with the number of cases, we are seeing increases in hospitalizations as well, which is very much overwhelming healthcare systems across the country, in addition to what we're seeing in the community. Next slide. And that really reminds us, and here's the hospitalization trends that you're seeing across the U.S. Again, pretty much across all age groups, you're seeing an increase, more so in certain age groups than others. But for the most part, we are really concerned about having throughout our population, no matter if you're young or if you're older, we're concerned about this increase in hospitalizations, in addition to, again, not as much proportionality, but in addition to the increases in community transmission that we're seeing across the country. Next slide. So the federal government has taken a number of steps, and I know a lot of you have seen this federal action that includes updating guidance on COVID-19 isolation and quarantine, information related to both the community members, healthcare workers, K-12 schools, also authorizing 2 oral antiviral treatments for COVID-19, the FDA and the Committee for Infection Control Practices, as well as CDC, have really come together and said, look, what are the kinds of things that we need to do to really fight this pandemic, especially this Omicron wave? And really it's centered around boosters. And so that is a key message about boosters and the importance of boosters and expanding the eligibility of boosters, which I know Michelle will be referring to as well. And then certainly the US is also fighting that global piece about how do we get vaccines and testing to global environments, but also how to get tests across the U.S. And we're hearing more and more, learning more and more about this plan of 500 million COVID-19 tests to the public starting in January of this year. And as you know, Governor Inslee announced I guess a couple of weeks back that we are also going to, no, it was last week, it's gone pretty fast, that we're also going to be having 5.5 million tests that Washington State is in the process of procuring, so we can make available also to our community members, in addition to another 1 million tests that would be available for schools and another 1 million tests that would be available for local and community partners. So a lot that's happening in the state of Washington. It's really following what's happening in the federal perspective, but also taking some very assertive steps so we can continue to make resources available to our communities. Next slide. So I believe I'm going to turn this one over to Dr. Quan Get. As he comes on, I'll just say that the big thing is that what you're seeing across the U.S. is what we're concerned about here in Washington, a wave that's markedly bigger than what we have seen previously. And while that, the good news is that we have tools like vaccines and boosters and masks. The not so good news is that those tools are only as good as people availing themselves of that. And so we are seeing an increase in both cases and the concern of what's happening in our healthcare system. So with that, let me turn it over to you, Tal.
Thank you, Dr. Shaw. Next slide. So I'll be talking about Omicron, focusing on what's happening here in Washington. Next slide. So as Dr. Shaw mentioned, Omicron quickly became the dominant variant in Washington. When it first appeared, we were focusing on cases that had a PCR result that had a slightly different pattern than previous variants, and selecting those for genetic sequencing. And by doing that, we were able to track the number of Omicron cases as the variant made its foothold in the state. When it became clear that the Omicron variant was going to quickly become the dominant variant, We then switched our surveillance strategy back to what we were doing before, where we were collecting a representative sample of samples in order to and just sequencing those so that we could get a better idea of what the proportion of variants in Washington State was from Omicron. And as Dr. Shah mentioned, it's more than 95%. This slide is from a little bit older data, but the patterns in Washington echo those seen in the rest of the country. Next slide, please. So as you can see, Omicron has caused a very steep increase, a faster rise in case counts than in previous waves. And as Dr. Shah mentioned, this may be due to a difference in how the Omicron variant attacks the body. So there have been some intriguing laboratory experiments and animal experiments showing that the Omicron variant, compared to earlier variants, has a little bit more of a predilection for the upper respiratory tract than for cells in the lower respiratory tract, in the lungs. And on the one hand, that could be good news because when the virus has a predilection to infect and reproduce more in the lungs, that can definitely cause more severe disease. On the other hand, a virus that multiplies more in the upper respiratory tract may become much more transmissible. So what we've seen with Omicron is that it almost seems to behave like a virus that's aerosolized. So some respiratory viruses like influenza are spread through droplets. So when you cough and sneeze, the virus comes out sort of encased in droplets of mucus and fluid. And those droplets then fall to the ground within an average 3-foot radius from a person. But when a virus becomes aerosolized, perhaps it gets spread through coughing, sneezing, even just talking or exhaling. It comes out in smaller droplets that are able to suspend in the air for longer periods of time, and therefore make it much more infectious than a virus that spreads in the lower airway. Next slide. And in Washington, as with the rest of the country, we are seeing an increase in hospitalizations. Next slide. But fortunately, we are not seeing, at least not yet seeing, a rise in deaths in our state. Now, we have to take this with caution because sometimes death counts and trends in deaths can lag behind trends in case counts by sometimes a month or more. So this is something that we'll have to watch very carefully. Next slide. But fortunately, even though Omicron is more transmissible and does seem to have a greater capacity to evade past immunity, whether that past immunity is from infection or from vaccine, we do know that vaccination and boosting continues to be very highly protective against the outcomes that we care most about, which is hospitalization and death. So even though case counts have increased, perhaps because of vaccination and boosting, we are seeing not the same. We are not seeing the same rise in death rates. Next slide. And so this slide just illustrates how effective vaccination is against hospitalization. And you'll notice the graph in the lower left showing hospitalization rates amongst 65-year-olds. And the lower lines that are in blue and yellow represent those who are vaccinated or partially vaccinated. And the red line represents the rates in unvaccinated individuals 65 years and older. So as you can see, unvaccinated people 65 years and older have a hospitalization rate that's 11 times higher than those who are vaccinated. We also see this in other age groups as well, because the y-axis is the same in each of these graphs, and other age groups have lower rates of hospitalization. That's why the lines are much smaller, but still you can see that amongst 35 to 64-year-olds, rates among unvaccinated individuals is 8 times higher than those who are vaccinated. And for those who are 12 to 34 years old, vaccination is also highly protective against hospitalization, where those who are unvaccinated have a rate that's 8 times higher than those who are vaccinated. Next slide. And as I mentioned, vaccination continues to be highly effective at preventing death. So amongst those who are 65 years and older, those who are unvaccinated have a death rate of that's 15 times higher than those who are vaccinated. Next slide. But even though the virus may not be as lethal, it can still cause a tremendous stress on our hospital system, and that's currently one of the things we're most concerned about. The winter time is typically a time when we see increased hospital use from influenza and other respiratory viruses, particularly where we see increased admissions for those who are older and those with chronic conditions that place them at higher risk for severe disease. So even without a highly transmissible variant like Omicron, our hospitals every winter see quite a strain from these seasonal respiratory viruses. And so adding in the Omicron variant, we're seeing really major stress on our hospitals. And it's exacerbated by a few different things. One is that staffing becomes more difficult when you have people who are infected, when you have healthcare workers who are infected, and then either have to isolate, or if they have contact with a family member who's infected, then they have to quarantine, and that's reducing staffing that's available for hospitals. We're also seeing that because staffing in long-term care facilities and nursing homes has been low, as well as due to other factors, long-term care facilities and nursing homes aren't able to accept many patients who are ready for discharge. And so many of our acute care hospitals have a high proportion of beds occupied by people who really don't need to be in the hospital, but that there really isn't a way to discharge them. And so this graph from the Institutes of Health Metrics and Evaluation tries to project what we might see in terms of hospital resource use over the coming weeks. And so the purple line represents all beds, while the green line represents ICU beds. And as you can see, over the coming weeks, we expect or we project a peak in hospital resource use. And next slide, please. And looking at the same model from IHME for Washington, we see the same pattern, an anticipated peak over the coming 3 to 4 weeks. And this is very concerning because already right now we are hearing from our healthcare partners that they are more stressed than they've ever been before in this pandemic because of the staffing issues and because of difficult patients who are difficult to discharge, as well as many who are coming to the healthcare system who don't really need to be there. So there are some people who are coming to emergency departments, even though they might have a mild illness and don't require emergency care, because they are so concerned about COVID-19 and wanting to get access to a test, which is not nearly as plentiful as we wish it were. Next slide. So what we're trying to do is work with our healthcare system partners, with DSHS, with the Healthcare Authority, with the Governor's Office, to try to look at all the different measures that we might do to decompress our healthcare system. Because what we really want to do is do everything to avoid moving into what we call crisis standards of care, where we have to, where we are forced to ration life-saving interventions. So, so this is something that we're watching very closely and taking very seriously, and hopefully all the work that we're doing will be able to avert crisis standards of care. And what we can do to help that is, if you don't need to go to the emergency room, don't go. If you are mildly ill, don't go to the emergency room for testing. Rather, get tested at home, or and isolate and have your close contacts quarantined. If you have difficulty accessing testing, then don't go to the emergency department. If you have symptoms of a respiratory virus infection, just assume that you have the Omicron variant and act accordingly. So next slide. Okay, so I think that's the end of my section. I'll turn things over to Michelle.
Well, good morning, everybody. Good to be with you. I'm Michelle Roberts. I am the Acting Assistant Secretary for our Prevention and Community Health Division at the Department of Health, which, and in that role, I'm the executive sponsor and leader for our COVID vaccine work. Next slide. So here today to give you an update on where we're at with the COVID vaccine response and some of the work we're doing, especially around our work to reduce equity gaps in vaccination. So good news overall is vaccination rates continue to increase. As of January 3rd, 77% of the population who's eligible for vaccine, so people 5 and up, have received at least 1 dose, and 70% are fully vaccinated. Next slide. One of the challenges, though, is vaccine rates are not uniform across the state or in different communities and groups. So this is a map looking at initiation of vaccine by county, and you can see there is a range, and actually the range in our state is about 50% from the lowest county with vaccination rates to the highest county. You can also see differences in rates when you look at race, ethnicity, or look by age are a couple other examples. And it does concern us with communities and areas that have lower rates of vaccination because there's potential for more disease to be spreading. Next slide. The good news is I'm going to go through a few more other stats here about some good news about the vaccines and where we're at, breaking it down a little bit more. So as of January 9th, total number is more than 12 million doses of COVID vaccine have been given to more than 5.5 million people across our state. That's really incredible, just to think about the volume of work that's happened in the last 12, 13 months now since COVID vaccines came out. We do run, as which we've shared with the board before, the state runs a childhood vaccine program that provides all recommended vaccines for kids from birth through age 18. And in that program, we give out about 3 million doses of vaccine a year. So in 1 year, and that's a pretty robust public-private partnership to get that work done. And we have more than done 4 times the amount of work in a 1 year period. Was also a recent report looking nationally at the impact of the first year of the COVID vaccine program, and that showed that more than 1.1 million deaths across the U.S. have been averted, and more than 10.3 million cases of disease have been averted by COVID vaccine and the work that we have done together. Next slide. And Again, I'm going to talk some about booster dose recommendations. Both Dr. Shaw and Dr. Kwanget mentioned that many different groups of people are now recommended to get a booster dose to help prevent against waning immunity and especially continue the high level of protection, especially against severe side effects of the disease. So we can say as of January 9th, over 2 million people across Washington state have gotten an additional dose of vaccine. Next slide. And to talk about who is recommended to get a booster, because there is a change in recommendations as we learn more, as the science tells us more information. So right now, the recommendations have changed that for Pfizer vaccines, you should get your booster dose 5 months after your primary vaccination series is completed. Same thing with Moderna vaccine. Those are our 2 mRNA vaccines. So both are recommended to get a booster dose 5 months after your primary series is finished. The recommendations for Johnson & Johnson are a little bit different, and you should get your booster dose 2 months after your primary vaccination series. You can mix and match vaccine types, and there's limited evidence right now about which combination is best for the strongest immune response. So really, we continue to say that the best booster dose to get is the one that is recommended, or the one that you are able to get and that is available in your kind of in your neighborhood and in your community. Next slide. And my slides are changing a little bit slowly, so sorry about any delay. Kids became eligible, pediatric vaccination, age 5 to 11 became eligible in late November. And so as of January 9th, we have had nearly 200,000 kids have received their first dose of vaccine, and 150,000 are fully vaccinated. That is getting close to about a third of that population in our state. So really excited about the potential for both protection for those kids, but to just increase immunity levels in our school settings to help and keep our schools open. That is really important as well. Next slide. And we have lots of resources for anyone who needs help making a vaccine appointment. So there's a number of options you have. You can go to our vaccine locator at vaccinelocator.doh.wa.gov. It is on our homepage as well. The federal government also has a site, vaccines.gov. And for anybody who needs help scheduling an appointment or is not finding what they need on either of those sites, you can call our hotline, 833-VAX-HELP, and they can help you schedule an appointment. There's also texting options, so you can text your zip code and get locations of vaccine available near you, and links to where you can go to schedule appointments. Next slide. And really, when we talk about vaccines, no vaccine is 100%, works 100% about protecting against all cases of disease. These vaccines, when they were initially released and authorized by the Food and Drug Administration, they did have incredibly high rates of protecting against both infection and severe disease. Over time, protection against infection has seemed to be waning, and especially with the Omicron variant, we're seeing some decreases there. The booster dose does help with protection, increasing protection both against infection and severe side effects. But the really incredible news about these vaccines is that they do have very high rates of protecting against severe side effects of the disease. So you can see here information on hospitalization rates for people who are unvaccinated comparing to people who are vaccinated. And this is data from our own state data of people who are in the hospital here in Washington. And you can see much higher rates of hospitalization for people who are unvaccinated. One of the other critical things about this is really Dr. Kwanget was just talking about the potential or the incredible impact on our healthcare system. And one of the benefits of vaccines is really helping reduce those severe side effects to keep people out of the hospital system and maintaining that capacity for both people who really need it for COVID, but also for any other reason why any of us might need to go to the hospital. So vaccines are definitely really a critical part about individual protection, but also protecting our health system capacity. Next slide. I want to talk a little bit about how we're measuring vaccine equity, and I'm going to talk a little bit about what we're doing around some equity outreach. So we've been looking at who's vaccinated and who isn't vaccinated in many different ways to help understand what community questions there are and what community-driven strategies may look like. So one of the ways we've been doing that is looking at something called the Social Vulnerability Index, or SVI on the slide. And that is an index that both the state and the federal government is using. And it really looks at different measures of social determinants of health, including transportation, housing, access to care. And it rates kind of those risks from kind of 1 through 10, with higher areas having more risks and more risks that have tracked to higher rates of COVID disease as well. So what we've been doing is looking at vaccination rates and what the gap is between lower and higher rates of SVI. And so this is showing the gap. And what ideally we would get this gap down to 0, but knowing there are a lot of structural factors that influence health are some of the biggest barriers, like transportation, like systemic racism and other pieces. So these are one way we're looking at this data to help us identify where we need to be focusing our efforts and what we can do to close that gap. You see the gap has been increasing since the late fall. That is, there's more people who were recommended to be vaccinated starting in the fall with both booster dose expansion and expansion to pediatric populations, but it's a really good indicator we need to get back to some of our community-driven strategies and understand what barriers are so we can continue to address those. Next slide. I'm just going to talk about a couple of the different things we have been doing. So we have 8 different strategies we're using to address vaccine equity and work on these gaps. They are all centered in working with communities, helping understand what specific community needs, questions and concerns, and barriers are, and centering community and identifying solutions that the public health system and other partners can support communities in doing. So that's what is at the heart of all this work. A lot more information about each of these strategies is on our website, but for the interest of time, I'm going to move to showing how a couple of these are being implemented in our state. So next slide, please. And all of these strategies are about building vaccine confidence. It is totally normal, and we understand why people have questions and concerns about vaccine. We're asking people to take a health behavior, and there's a lot of information out there, a lot of different things that people want to understand to make a decision for themselves or for their child about being vaccinated. So some of the work we do to continue to build vaccine confidence is lead with transparent, consistent, and frequent messaging. We are ensuring that our materials are culturally and linguistically appropriate. So we're working with these community partners to create materials into 40 different languages, and thinking about outreach strategies that are specific to different communities. We're also investing in community organizations. So not just asking them to partner with us, but funding and working with them to have community partners lead messaging and initiatives. So next slide. One of the new areas of I think that was my last slide, kind of summarizing some of that work. I thought I had a slide on the caravans, but which are our state mobile teams. But I think I'm handing it back off now, either to Dr. Kwangett or Dr. Shaw.
Thanks, Michelle. Actually, if we could just go one slide back, it's important information I do believe wanted to just remind everybody. So one of the things that we did at our Department of Health briefing this past week was really recognizing the importance of making sure people have good information and really helping empower people to make good decisions. And especially knowing what to do if they test positive. And as Dr. Kwangett mentioned earlier, that if you don't have access to a test, and we're doing everything we can to increase the availability of tests throughout the state of Washington, that there are things that you can do. One is to, if you have symptoms especially, is to say, hey, I need to stay away from others because I've got to make sure I don't expose someone else, even if it turns out that it's not COVID-19. But on the other hand, if you do have access to tests and the tests do test positive, this is some information on what we want to have people know about what they can do to empower themselves to do the right things and be able to protect themselves and those around them. We go to the next slide, which is I think where Michelle was heading. The caravan, and I was going to bring this up at the very end, but the caravan has been a really important change and shift over the last several months for the Department of Health. And it's really been moving from, as you remember earlier, more the mass vaccination, high throughput sites. We did recognize the importance of being able to go community to community and being nimble in our locations. And that's where the caravans came in. And so we have 4 of these across the state of Washington, working with our partners, and our teams and partners as well as us have done a fantastic job of being able to work together to be able to provide vaccines and other health information to community members. Next slide. And these are some of the metrics. I won't go into these, but just to say that it's really been incredibly important to be able to get into communities that oftentimes may not have access to information or vaccines, and we want to make sure we can do whatever we can to support across the system. Next slide. So where have we been and the road ahead? And this is a challenging piece for everyone. And this is not just here in the state of Washington, but across the country and across the globe. And the reason why I hesitate is that, at the end of the day, the road is not clear for any of us. I did pen an op-ed in the Seattle Times last week. I hope you've had a chance to look at it. We do recognize how challenging this has been for all of us. And, almost 2 years into this pandemic, we know that there's a lot of frustration, there's a lot of concern, and we also recognize that there's a lot of hope and optimism. And the unfortunate news is that every time we feel like we're about to make progress towards that brighter road ahead, we have a new variant or a new change or something happens that allows us the moment to pause and say, oh my gosh, we've got to continue on this road. So if I can go ahead a couple of slides, or if you could just go to the next slide. It's just the reminder of going back in time back to January of 2020. So we're closing in on 2 years on the first reported case in the continental United States with COVID-19 here in Washington. If you all remember, in Snohomish County, then we had the first outbreak, the first death, and here we are with now 10,000 Washingtonians who have lost their lives because of COVID-19, and countless hundreds of thousands across the country. It really has been a difficult road for everybody, and we know the mental health and the behavioral health and the toll on all of who have been impacted, which means everyone, all of us, has been just tremendous. We've also had a number of activities that we have done throughout the last 2 years, and in 2020 it was really public health interventions, masks, isolation, getting people away from others if they were infected, because we did not have vaccines, we did not have therapeutics. And then last year was really focusing on vaccines and the therapeutics as well. And I did want to make a comment about therapeutics, that antivirals and monoclonal antibodies absolutely are very much a part of our plan moving forward. The biggest challenge we've had is we just do not have enough of these therapeutics. That every time we have thought and tried to strategize a good plan moving forward, we find out that the therapeutics are now limited further to the state of Washington. We just don't have enough to go around. That said, we've been working with our healthcare partners for monoclonal antibodies and even moving forward with antivirals, but really it's been a challenge of supply, just like it was previously with vaccines, just like it was previously with our testing, just like it was for all the other supplies that we've required throughout this pandemic. And then certainly moving forward is really all the different things that we need to be doing, working together. Next slide. So, a lot of those shared successes, and again, credit goes to all Washingtonians of really working together. We've had a number of programs that have been recognized across the country. The Caravan we talked about, the Power Providers Initiative, it's really working with our healthcare providers as they help champion vaccines. Our Vax Center, the second bullet there, our VIX, the Vaccine Implementation Collaborative. The VAC Center was really public-private partnership. The VIX was really about working with communities that oftentimes are left behind or don't have voices at the table. We wanted to make sure that the voice of those communities were also part of what we were doing moving forward to incorporate those voices. The WA Notify app, again, if someone is exposed, the ability for them, from an app on their phone, their smartphone, to be able to really identify who that they were exposed or somebody around them was exposed, and trying to get that information into the hands of Washingtonians has been a tremendous challenge, but also been successful. And then WA Verify, which was in the latter parts of 2021, which is the optional way that people could opt in to be able to have a QR code, so that if they had been vaccinated, they could show that they had proof of vaccination. So these have been a tremendous amount of work that's been going into how do we work together, and what are the things that the Department of Health can do to help support the initiatives across the state. Next slide. But as we get into this new battle with Omicron, as you know that, and I mentioned this earlier with Governor's announcement around expanding at-home testing availability, and we're in the process of getting these tests to be able to provide them to both Washingtonians and also many of our partners. We do recognize the importance of both community testing, mobile testing, where you drive-through test, versus at-home tests, and then also the importance of vaccines and the vaccine work. And it's so critical that while we recognize that you can get infected with COVID-19, and you can say, okay, I've been infected with COVID-19, and so therefore I'm now protected. We know that it's a shorter-lived protection, it's a more narrow protection, and it's a more unpredictable protection, whereas the vaccine protection is a broader perspective, a broader protection, and it's also protection that's more longer term. And so that's been the biggest challenge that we've had, is to try to get that message out to community members, when again there's been a lot of angst and concern with a lot of things that have been going on related to this pandemic. And then certainly increasing our vaccination availability, as was announced last week, all the efforts to go back to adding a mass or high throughput vaccination capabilities, in addition to supporting what's happening with our Caravan and other partner activities, and then certainly masks to make those available for schools and communities as well. Next slide. I'm going to close with the last couple of slides here. This is just a reminder again of the messaging, and this is back to the message that was in the end of Michelle's slide deck, which is really empowering people. So what to do if you get a test, if you've been exposed, right? So if you've been exposed and you don't have symptoms, whether vaccinated or unvaccinated, we want you to take a test. Wait to take a test. We think 5 days is the right time frame for that. If you're vaccinated or unvaccinated but have symptoms, we want you to take the test immediately. Regardless, we want if you go out of that isolation quarantine period, we want you to wear a good quality, good fitting mask, because that's so critical to preventing people from exposing others. And then the next slide is really about the focus areas as we get into this year. It's, again, the focus on vaccinations and boosters, the focus on communications and engagement activities, the focus on our community mitigation policies and efforts, the things that we're doing that allow us to really help prevent people from getting sick in the first place or getting infected in the first place. And that includes masks, that includes policies related to schools, that includes policies related to businesses, that includes policies related to what's happening in community events, et cetera. And then certainly the healthcare system support. That includes the therapeutics that I spoke about, but it also includes the real support that our healthcare system is right now really challenged by, which includes this overwhelming demand for healthcare system support, but also at the same time not having as much of either the people, or because some of our staff members in the hospitals are getting sick or have to isolate or quarantine, as well as the real concern that we've had throughout the system. This is across the country, which is that there has been a burnout in our healthcare system with our healthcare providers related to what they have been facing for 2 years. And Dr. Kwan-Get and I, both as healthcare providers, will say that is a real big challenge that we're hearing from our healthcare partners, is what is really happening when they have had for 2 years to respond to this pandemic. Certainly, we want to also continue to emphasize community and individual empowerment. And that means that we want to empower people with good tools and good information, and putting things on our website and pushing it out through social media so people know what they can do to be able to protect themselves. Again, it starts with vaccinations, and it also starts with boosters, but it doesn't stop there. It really is, what are the things that we need to do to be able to help each other through this very difficult time, which includes a mental and behavioral health and a real look at how we can continue to have everything that we can do to be as healthy as we can be, which means exercise, which means getting sleep, which means making sure we're taking vitamins, which means that we're, as healthy as we can be, as well as taking a break from this overwhelming pandemic and not always just focusing on that at the same time, because we know that it can be overwhelming for many community members. And then finally, our focus on equity, as Michelle discussed earlier, is really the making sure that we're working in those communities that oftentimes are disproportionately been impacted, whether it's by age or whether it's by geography or whether it's by race, ethnicity, just making sure that we're working together to focus on those groups so that we can continue to.
Sorry, I had to leave the chat for a minute there. I had a double obligation this morning.
I just want to close with that.
Finished speaking at the
Washington. Turn him down real quick. Let me turn him down real quick.
Presentation slide, and just say that Department of Health is continuing.
You know more information than these idiots do anyway. So
we know.
Yeah, well, I just finished speaking at the Washington State Legislature, where they were discussing expanding the gun laws in Washington State, specifically making it so you pretty much cannot carry a gun in public, concealed or unconcealed, on government grounds.
Really?
So at all.
Wow.
They banned it for protests last year. And now they're trying to take that same legislation that they utilized to ban it for protest to make it so that if it is a government ground, whether that be a courthouse to, even just standing on the Capitol grounds, you cannot have a gun on you or in your vehicle.
Wow.
And that's what they're trying to push through right now. And that's just one of 3 of them that they're trying to push through. So I just spoke on that one. And then at 1:45, I'll have to speak on another one. And so today is just a day full of legislation.
Wow.
But
So if you guys don't know, this is Kate. She has a Twitch channel called Kate Speaks. She today is speaking here at this meeting. She speaks at 12:10. She's going to give a 20-minute presentation. And then she's also going to speak in the 3-minute public comment section. So this morning she also spoke, like you just said, at a gun rights thing. And so Kate is your advocate for Washington State, folks. So you got to go check her out at Kate Speaks. Join her, Kate, the Irish lady, at well, put your Discord chat in my chat room if you want. And yeah.
Yeah. But I mainly wanted to pop in and tell you guys, like, it's not that difficult to speak and testify in these hearings. You can sign up for them, and it takes 15 minutes of your time. But it's so important that we start to get our voices out there, and we start to elect people who truly represent us, because the agendas, especially in Washington, that they're trying to shove down our throats are going to literally take away all of your constitutional rights. Like, I don't think people even realize. And once one state does it, the rest of the crazy states that are liberals start to pick up those same policies. And
pretty soon you're going to be like where I live here in California.
Yeah, it's bad.
Right? So yeah, everybody, I paused this, so don't worry. We're not talking over them. I know some people maybe want to hear what they're saying, but I also thought what Kate's about to tell you was important too. So we paused it. Don't worry. It's not going to shut down. You can continue watching. We'll go right back to it. So
yeah. So I just wanted to apologize for popping out of the chat, but I had to go pop into that hearing, and I only have my phone and iPad functioning right now. So I had to stay in both of them at the same time.
Right on. And also, just so you guys know, I am leaving. Tomorrow's Thursday, right? I'm leaving tomorrow for Arizona. I'm gonna meet Sheriff Mark Lamb. We're gonna interview Sheriff Mark Lamb. Hopefully, we're going to the Trump rally. We're gonna go to Nogales, Arizona. We're gonna go to Tombstone. We're gonna show you what's happening at the border live. I mean, it's not gonna be, nobody's gonna be able to say, "Hey, Eddie, you edited that." No, I'm gonna be live. I have a whole bunch of nice modems that are, the live view. Kate knows she has one. We're going to take our live views down there and just show you everything live, folks. So nobody can say, they edited it. This is not true. No, we're going to be live. So pray for us, I have my sexy steed, Donald J. Trump, my service dog, so I don't think they'll mess with me too much. But, yeah, folks. So anyways, anything else, Kate, before we go back to this stupid hearing?
Nope. I just wanted to apologize for popping out of your guys' chat for a while there. I had to go deal with another one, but
right on.
For some reason, I like to pack really a lot of the good ones, the ones that you really want to participate in, all on the same day.
They do that so you can't go to every single one, and they get to slide stuff through, under the sheets. That's why they do it.
Well, people like me go to every single one of them when we make a priority to make sure we're there.
Right. So that's why you guys got to watch people like Kate. Kate, I don't do this stuff normally. Kate told me she needed somebody to stream for her, and I was like, hey, I'll do it. I like this stuff. So here you go. So God bless you. And by the way, Kate's really into this because she has 6 babies, and she does not want her babies to have to go through all this drama. Right.
Exactly. Well, we will continue to listen in. I'm going to be popping back and forth between all these different hearings today, but, I'm excited to speak at about 12:10. They started a little late, so I might be speaking a little bit later here, but.
Right on. And also, it's good that we're pausing and talking right now because you know what? I'm sure they're going to take a break for, potty break and lunch break or whatever. So guess what? We can fast forward through it because we just took up some of their time. So, and yeah, DC Services says, thank you, Kate. And I too want to say thank you for doing this for all your Washingtonians. Because like I was saying earlier, folks, and Kate was saying too, just because you say, well, that's Washington, I don't have to worry about that. I live in Texas. Well, no, you do. Because once it starts that precedent, then all of a sudden they can say, well, Washington does it and it's a law. So guess what? We can do it too. Right? Oh, did I lose Kate? Oh, she's muted. All right, guys, so we're going to go back to this trial for you guys, or hearing, whatever you want to call it, shit show, idiot speaking, anything you want to say. Here we go. Let me hit play again on it. Here you guys go. Sorry. What? Now it's refreshing? Come on, don't do that to me. Oh, maybe I'm wrong. They won't let you pause it, will they? I'm sorry, folks. I messed up then. These guys are awful. Are you going to do the Let's Go Brandon? I don't have a Let's Go Brandon. How about this one?
He was only a good vice president because he understood
100% in medicine, but these are pretty good vaccines from that standpoint. We're talking in the 90s, 95% that they prevent you from having severe illness. So it starts off with saying, do you get infected? And the second is, if you get infected, is it severe enough to cause you a hospitalization? And the third is, if you get hospitalized or not even hospitalized, but do you have a severe illness such that it's gonna require maybe a ventilator support, or it's gonna even lead to, unfortunately, death? And vaccines have been really good at those last two, to prevent people from getting hospitalized or prevent people from having a serious adverse outcome. But what we have been seeing, especially with Omicron, is that if you have gone way past your time frame for your eligibility for boosters, you are now at a point where you are at potential risk for an infection. And that's what we are so focused on. If you're beyond those 5 months, as Michelle showed, or 2 months beyond J&J, get your booster now. It is so critical to what we need to be doing, so we can remind people that they have not just a protection because they got a vaccine 10 months ago, but they've got to have a recent vaccination that's going to really help them be protected against this variant or whatever is going to be coming down the road. That messaging is so critical, and that's what we've been trying to champion. Again, it's only as good as people are going to be able to help us champion those messages and partner with us to get that message out to the community. So thank you, Tom. Thank you, Dr. Pendergrass, for everything you've done over the years, but also for bringing those comments up.
Thank you, Dr. Shaw. And it's good news that there's increasing testing supplies coming into our state. Those are desperately needed. So we appreciate the department's help to try and round those up and get them into our community. And we're looking forward to moving those out into the public. So with that, we're going to go ahead and get ready to take a brief break before we move into public comment. I just want to very quickly remind our audience, and we had some notes up on our website, we have 50 minutes set aside for public comment today. We've had over 7,500 people request to make comment. Even if we gave every one of those people 1 minute to speak, which is what we plan to do, that would take over 125 hours. And we just don't have time to do that, obviously. So what I'm going to ask our audience, please, is as we take a brief 15-minute break, we'll come back and we'll go right into public comment.
They just recessed.
Registered to make a public comment, we're going to go through as many people on our list as we can.
Well, I guess what I could do is just do a quick rundown with you if you want on some of the things that are happening here in Washington as well as federally. Don't know how much you guys have been paying attention to what's going on federally, but I can give you a rundown of some of that stuff too if you want.
Sure, let's do it. Let me put it in Discord mode so they can see you. Well, not see you, but I guess see me.
So please note that.
And then yeah, let's go over it. You're the woman when it comes to this stuff, so I'll let you take it away.
Okay, well, federally, like one of the biggest things is they're trying to kill the filibuster in the Senate, and supposedly they're going to be doing a vote on Friday. Now, I don't know if you know much about how that works when they do the votes, but when they say they're going to do a vote on Friday, the majority whip is going to confirm that he has all of the votes. Now, there are 6 Democrat senators who have said they don't want to kill the filibuster. So when I say supposedly, it's because there's a possibility that Schumer will get up on the Senate floor and push the vote back to kill the filibuster to another day because they have to vote on the change of the rules. Now, he only needs a simple majority to change the Senate rules. And he can get rid of it by simply having 51 votes. Now, he'll have his 50 votes of his Democrats, and then Harris will come in to do the final vote if it's divided. But he really just needs a simple majority to change the rules. And so the rules that they're looking at changing is the filibuster, which would make it so that the Democrats could literally shove anything and everything down our throats, and there's nothing stopping them. There's nothing keeping them from being honest. Yeah. So that's kind of a scary thing. If you haven't called your senator about that yet, go ahead and call them.
Yeah, I got a real
make
quick
sure that
question
they
before
know.
I forget, if you don't mind. So
Of
they
course.
just said that because they've had so many people want to come and speak, that they are lowering your 3 minutes to 1 minute. Isn't that against law? Isn't that against the law? Isn't the Brown or not the Brown Act, but they if they say, you know, everywhere you go, it's a 3 minute, you know, open forum speaking. You have 3 minutes of your time you're allowed to speak. By forcing them to go down to 1 minute just because they've had too many people come in, I think that's BS, don't you?
It is, and here's like he said, it's a lot of time that it would take for everybody to comment on this particular hearing. Technically speaking, because you're allowed to petition your government per your First Amendment, they are supposed to allow for you to speak during any and all of their hearings. In fact, if there's a Senate hearing in Washington, D.C. that you want to go speak about and make a public comment about, they're required to allow for that to happen, with the exception of intel meetings and anything that is classified. So you can't go and sit in a classified meeting if you don't have the proper, you know, security clearance or whatever.
Like at my city, I go to my city council meeting all the time, and once it gets to the part where, okay, we got to speak about employees and who we're going to discipline, fire, you know, I understand stuff like that needs to stay out of the loop, but
well, disciplinary actions of city and state employees, per at least in Washington State and in many states actually, are required to be part of the public disclosure. So, you know, that part is a little bit strange that maybe they close that off, but as long as they publicly disclose it later on, they're still following their laws.
Sure.
You know, it's frustrating because when you research,
please do your research. If you don't do your research, you know, you could be voting. Just because they say they're Republican doesn't mean they're Republican. Just because they say they're conservative or libertarian or even Democrat, whatever you're voting for, doesn't mean they are. Right?
Exactly. And if you guys ever have questions about a candidate, I am more than happy to answer any questions that you have. I research candidates in all of the states. I may not know all of your local candidates, but I'd be happy to put in a little bit of elbow grease and read about it and let you know what I think if there's a specific candidate that you are on the edge about. But if it's a federal candidate, you know, one running for the federal House or the Senate, I probably will know pretty much all the information you need to know about that person, specifically because what their belief systems will impact me eventually. You know, if a Democrat is elected into a Republican position, or a person who says they're a Republican is elected, but then they're really a Democrat, like, it does impact me on the federal level because they vote for things that are going to eventually trickle down to laws that I have to follow. So
sure. Oh, wait a minute.
It's not just about being informed locally. You have to know what's going on federally as well.
I was looking earlier. Okay, they are there. So I looked earlier. I couldn't
Years
find.
ago, was Antifa armed with guns as well, or is that just a new radical thing? No, that's a new thing.
So Robert,
John Brown
buddy,
Gun
a
Club,
good friend of ours, is outside the courthouse right now, or outside the hearing right now.
Same thing
in Tumwater?
Yeah, let me see if I can put it in.
But they never showed up too much.
No, let me turn him down. I don't want him loud. That way you can still talk, but at least people can see what Robert's doing. Now, when I did this earlier, this is what messed us up. So how about this? Well, they don't need to look at us. I'll go right here. Here you go. This is Robert. This is his stream outside in front of the. Where is this at? This is not at a court. This is just at the city hall or the state legislature building, right?
It is at the Board of Health.
The Board of Health. Okay.
Yeah.
So, yeah, we can talk over Robert. I'm showing everybody what Robert's doing out there. And only Mr. Bill, I think, is there too, isn't he?
He said he was going to try to go. I don't know if he made it up there or not. But
yeah, it's a long drive.
Yeah.
3 hours, 4 hours?
Roughly, depending on. Is he coming? He's coming from like Vancouver area, Portland, right?
Yeah, that's from what I guess. I don't know. I don't know exactly where he is, and I'm not going to say. Even if I did, I wouldn't say. So, yeah.
Yeah.
But he's always filming in Portland area, so he's somewhere in that area, yeah.
Yeah. I would be up there at the Tumwater, outside the front protesting, but I actually am going to be speaking on behalf of homeschoolers. And so I felt like that was more important than me going out and standing in front of the building.
Sure. Yeah,
But
I wasn't homeschooled, but my mom would never let us go to public school. My brother, my sister, and I, we all went to Catholic school, parochial school. And I don't know. Do you know anything about what they're doing right now with stuff like this?
Well, Washington State mandates the same vaccinations for private schools as it does for public schools. So ultimately, if you don't qualify for religious exemption or you don't qualify for a medical exemption, then you're required to have a vaccination to go to in-person learning outside of the home.
I got you.
And it's actually very difficult to get a medical exemption. And this is something that I've kind of touched on previously. My son has a heart condition, and these vaccinations, they have a higher level of myocarditis and pericarditis reported from the vaccine. So you would think that I could go to his pediatric cardiologist and he would give a medical exemption and everything would be honky-dory. But in actuality, they've pretty much bought and purchased most doctors. And so unless you have like a severe allergic reaction, you're not going to get that medical exemption. And so while there's a risk of my son getting myocarditis on top of his actual heart condition that he already has, which could potentially kill him, his cardiologist is bought and paid for by the government and therefore feels it necessary to force vaccinations on even children who probably shouldn't be receiving the vaccine because of health issues.
Yeah. So I have a personal experience that I can talk about. So my dad served in the United States Air Force for 21 years. And he died from his Agent Orange exposure. I was born with 8 of the 16 known birth defects caused by Agent Orange. So I've lived my whole life in pain, in a wheelchair, out of a wheelchair, back in the wheelchair, all because of a chemical that the government decided to use during a wartime. And now you want me to go take some jab that you've just developed over the last year and say, oh yeah, it's going to be safe, no problem. Well, I'm sorry. I have a clear example of what happens when you don't properly test a freaking chemical that the government is going to use. So, hate to say it, I'm not going to take it.
Yeah, well, and what people don't understand is that there are no true studies of long-term side effects of these vaccinations, and there's been no public disclosure of a lot of the studies that have gone into the vaccines. So normally what happens with a vaccine, and this is part of informed consent, is they will release all of their data from all of their trials, and you'll be able to review it, see what different side effects are, and make an informed decision. We're seeing right now with Pfizer, they went to court to try to make it so that they couldn't release the information wasn't going to be released for 55 years. Now, there was a judge that said, no, you need to release 55,000 pages a month, which will take them approximately 18 months to get all of the data out to us. But the problem is now they're appealing that, and it depends on what judge they appeal to, whether that judge is going to uphold that. Moderna isn't releasing all of their information. Johnson & Johnson's not releasing all of their information. So how is it that you expect us to have informed consent, especially when you're talking about children as young as 5 years old, to go get a vaccination that we really don't know much about?
Yeah. And I always find it funny. Every day you hear, "Hey, guess what? Oh my gosh, my brain just froze as soon as I typed something." They're saying, "Yeah, record breaking, right?" Well, we've only had this for 2 years, so of course every day is going to be record breaking numbers because you keep adding to it. I mean, give me a freaking break, people. They just want—it's all these scare tactics that they're trying to scare the hell out of us with. Don't fall for it, folks.
Right. Well, and then you see the CDC come out and say things like, well, the deaths that are reported are reported, but some of them were people with COVID and some of them are people who died from COVID. Okay, so if I die with COVID, even though I die from something completely unrelated, I'm somehow going to be counted as a COVID death. It's everything is so strange how they're going about reporting the numbers, cycling the PCR test. And, you know, Elon Musk just showed that he took 4 tests in one day at the same laboratory by the same nurse, and 2 of them came back positive and 2 of them came back negative. So how good are these tests? How valid is it, really? How valid are the numbers?
They're back?
Something I don't think any of us will really ever know. But they're back up, so...
Oh, it is? How come it's not back up on my stream yet? That's weird. We got to refresh again. There we go. I guess they are. Okay. All righty. They're back, folks. They are back.
All right. Well, we'll check in here soon.
Sure. Thank you, Kate. Thank you for helping us out.
Of course.
Board of Health meeting in 1 minute. Thank you.
1 minute. We got 1 minute. All right. Well, we can talk for a minute. Oh my gosh, and I'm glad they finally turned off their cell phone. The whole first part of the meeting, all you hear was ding, ding, ding. You would think these people, if they're intelligent enough to be controlling our state and voting on what's going to happen, you would think they'd be smart enough to turn off their frickin' ringer. Jeez.
Yeah, put it on silent or something.
Right? Oh my, you know, one time is okay here and there, but it was going off like every 10 seconds, and I'm just like, shut the hell up. I don't know. I'm picky, I guess.
I get it. All right. Well, we'll talk here soon.
All right. Thank you for the information, Kate. We appreciate it.
Yeah, my pleasure.
All right. Well, then I guess I'll speak for a few minutes so they come back. So how the heck is everybody doing? I hope you're having a good day.
We are going to bring the Washington State Board of Health meeting back to order. It is now 11:20. We are moving to agenda item number 6, which is public comment. We do have 50 minutes scheduled for public comment, and we will honor that 50-minute period. The board listens very carefully to everyone who comes before us, but this is not the time where we engage in a back and forth dialogue. This is where we just listen to the public. We may follow up with questions to make sure we understand your comments, but typically we don't engage in the back and forth dialogue at this time. The board may ask a staff member to follow up, to conduct any necessary research, and to report back to the board about possible actions at a future meeting. We would like to note that public testimony specific to agenda item number 9 regarding the rule for communicable and other certain diseases, that will begin at 1:30. Additionally, please note that the rules hearing on chapter 246-100 WAC is scoped only to the implementation of engrossed substitute House Bill 1551, which updates the language and changes referenced in the state law that we need to update in the WAC. Again, due to the amount of interest and the large number of people that are wishing to give public testimony today, we're going to need to limit time to 1 minute so that we can get through as many people as possible, hopefully 50. When we call your name, please unmute yourself. You'll have 1 minute. At the 1 minute mark, staff will mute you again, and we will announce the name of the next person and move through as many people as we can.
How many people do you think they're going to kick off?
We will be calling people based on those who have pre-registered prior to the meeting. If you do not get called on today and you wish to submit a written comment, if you have not done so already, you can submit written comment to wsboh@sboh.wa.gov. For individuals who have dialed in and are listening by phone, public comment will only be available to you by submitting written comments today. You need to be on the Zoom webinar to be able to make verbal public comments today. So with that, we're going to go ahead and get started. Each person will have 1 minute, so please be brief and concise.
Kate speak.
If appropriate, please state your name and affiliation. And otherwise, at the 1 minute mark, we will remute you and move on to the next person. So Kate and Nathan, could we have person number 1, please?
Is that you, Kate? Are you first? Oh, wow.
Yeah.
Oh, no, never
Looks
mind.
like the first person that we have here is
Never mind.
Deborah Hibbs. I'm going to allow you to unmute yourself in just a second here.
There's probably like 100,000 Kates in freaking Washington.
And Nathan, would you tell who's going to fall, Deborah, so we don't lose a lot of time?
Yes, absolutely. Okay. I'm actually having issues with Deborah Hibbs at the moment. Looks like she's using an older version of Zoom. I'll go on to the next person, which will be Deborah Barrel. Give me 1 second, Deborah. Okay, Deborah, you should be able to unmute yourself.
Hi. Yeah, can you hear me?
Yes, absolutely.
Okay, good. My question is, or my comment would be, the talk that the vaccination protects you from symptoms from COVID, but what about the symptoms from the vaccination? If you look at the VAERS reporting, there are so many symptoms from the COVID vaccine that we should not mandate that. And also I wanted to find out how to get on that non-elected members board. Has that been determined yet?
Thank you, Deborah. Is that the extent of your comments for today?
Well, if I have a little bit more time, I was just wondering if you read about the 145 countries that found that the jab causes 38% more COVID cases per million and 31% increased deaths per million. And it...
Oh,
okay, thank you, Deborah.
they cut her
Apologies,
off.
we're out of time.
Yes.
We are going to move on to the next person.
How many times do you think that's going to happen?
And then after Todd, it will be Lori Lane. So give me 1 second, Todd.
That's going to happen a lot.
Navigate to your 1 second here.
I have a feeling that's going to happen a lot. They're going to cut people off all the time, folks.
Okay, Todd, you should be able to unmute yourself now.
I'm sorry. I messed up, guys. I'm trying to do something here. Go back here. I don't know why it always does this to me nowadays. It used to never do
Are you there with us, Todd? You should be able to unmute yourself. Okay, it looks like Todd Albert is not here. We'll move on to Lori Lane, and then after Lori Lane, it should be Dan Wood. Give me 1 second, Lori, and then I'll let you know when. Okay, Lori, you should be able to unmute yourself, and Dan Wood will be next.
Okay, do you hear me? I unmuted myself, or did I unmute myself? Let me see.
We can hear you.
Okay, gotcha. Hi, my name's Laura Lane, and I am a concerned citizen from Buckley. I have one question. What happened to choice with all this? With not just children, but adults too, with these mandates. I think that really needs to be given due consideration by you as a board. I think it's really important that people don't feel like that people have those choices, and we feel as a public that they're being taken away from us. I mean, there's something to be said also for natural immunity, and I find it curious that nobody has mentioned that at all in all that we do, and that's got to count for something, in my opinion. I really...
Yeah, just dropping them. That's bullshit.
Thank you, Lori. We've ran out of time there. I'll move on to Todd now. My apologies. On to Dan. And then after Dan Wood, it will be Beth Rohr. Hold on 1 second, Dan. I'm going to go ahead and try to unmute you here, and I'll let you know when. It actually looks like Dan Wood has disconnected from Zoom. I will move on to Beth Rohr. After Beth Rohr, it will be Lauren Guler. Give me 1 second, Beth.
I'm going to try something out real quick, guys, since they're not talking. I'm trying to find a sound. Nope, that's
okay, Beth. You should be able to unmute yourself here.
Hi, I'm Beth Rohr, and I am a concerned grandparent, also a retired public school teacher. You are meeting with this tag team partly to enact having school children add vaccinations to the schedule. I'm concerned about the WAC 246-105-060, which allows health officers to exempt the unvaccinated kids from school regardless of any exemption because there could be an outbreak in the school. And so I feel there are you or whoever, any SBOH people, employees, unelected officials having the power to enact policies that have the power of laws that have not gone before the legislature. I'm concerned.
Okay, and thank you, Beth.
I want to try this and see if it works.
And next up, we will have Lauren Guler, and after Lauren Guler, it will be Amy Holzel. Give me 1 second, Lauren.
I'm trying to find a mic drop sound for you guys. Sorry.
Okay, Lauren, you should be able to unmute yourself here. Lauren Guler, are you here with us at the moment? You should be able to unmute. Okay, we'll move on to Amy Holzel. Amy, give me 1 second here, and I'll be able to let you know when you can unmute yourself. All right, Amy Holzel, you should be able to unmute yourself here.
Hi, thank you. So my questions are a few. I understand in the beginning you stated that today you won't be discussing the quote detainment camps, and today you won't be discussing the mandate that's likely coming down the pike from Inslee regarding this jab mandate for kids 5 through 12. So I'm wondering, if not today, when is that going to happen? We've seen the camps, we know they exist, and I don't think it's a good idea to not answer and not discuss and to just put it under the carpet. I think that if it's there, you should talk about it, because not talking about it is going to create an uprising of which you will probably not even believe.
There we go. We'll have to use that for right now.
Thank you, Amy. We are now going to move on to Erica Griffith, and then after Erica, it will be Jessica Sawyer. Erica, give me 1 second, please.
See, you know what he's doing? He's wasting everybody's
All right,
time.
Erica, and you should be able to unmute yourself at the moment. Erica Griffith.
Just waste more time, guys.
Erica Griffith, are you here with us? You should be able to unmute your microphone. Okay, it looks like Erica Griffith is not here at the moment. I will go on and move on to Jessica Sawyer. Jessica, give me 1 second here, please. Okay, Jessica Sawyer, you should be able to unmute yourself. Jessica Sawyer, are you here with us? You should be able to unmute. Okay, looks like Jessica is not with us at the moment. I'll go on to the next individual, Matthew A. Bumer. And after Matthew, I'll move on to Charles Kinsey. Matthew, please hold on 1 second here.
Jack asked where the camps are. They're looking at some prisons that are not opened right now, and they're going to turn those into places.
Okay, Matthew, you should be able to unmute yourself here. Yeah.
Yes, David Potter. Detainee camps if you don't get the jab. They are talking about this. That's exactly what they're talking about doing right now.
Matthew A. Bumer, are you here with us at the moment? You should be able to unmute yourself.
You think so, Victor? You think they're just they're like, oh, I know this person's going to say something we don't want to hear.
Matthew A. Bumer is not here at the moment. I will move on to...
Thank you, Beach Life, for sharing my stream.
Charles Kinsey. Charles, give me one moment here, and I'll let you know when you should be able to unmute yourself.
David Potts.
After Charles Kinsey, I'll try to move on to Tyrone Martinez.
Good afternoon. This is Charles. What I'd like to say is that I truly believe that this country, this state, all of our communities were founded upon the ability to choose for ourselves. And if we can't choose for ourselves and choose as a family what is right for our own children and our grandchildren and our children's children's children, then we have no right calling ourselves a free democracy or a free republic. And what I believe in is a civil magistrate that works to restrain crime, but never under any circumstances controls our conscience. We have that right written in the Bill of Rights to choose for ourselves. That's why we broke away from England in 1776, is because King George decided that it was his responsibility to choose for the people what was best for them. And so if we can't choose for ourselves, then there is no responsibility at the people, and we should stop calling ourselves a free democracy. So I hope that the council takes into account.
Oh, they cut him off right in the middle. Bunch of BS.
Thank you, Charles. I'm sorry we ran out of time. I will move on to the next individual here. It should be Tyrone Martinez, and then after Tyrone Martinez, I will move on to Megan Ruck. Tyrone, give me 1 second, and I'll let you know when you can unmute yourself.
Hey, Kate, they're going to
Tyrone
announce your last
Martinez,
name.
you should be able to unmute yourself now. Oh, yeah, there we go. Yeah, I think it's unmuting then unmuting. You look like you're unmuted at the moment.
You're right. This is just taking away from time of other people that could be speaking.
My apologies. It looks like you're still muted, Tyrone Martinez.
Wasting our time.
Okay, Tyrone, it looks like it's having issues with your microphone here. I will move on to Megan Reck. After Megan Reck, I will call on
Hey, Kate, we need to do a video to where we show people how to use Zoom.
Megan, give me 1 second.
So they know how to test their microphone.
Let you know when you should be able to unmute yourself.
Hold on, let me turn it. We need to teach people how to use microphones so that way they know how to unmute themselves and test their speaker before they go live.
Okay, Megan, you should be able to unmute yourself. Megan Reck.
Yes, I just wanted to make a statement as a parent, as an employee that does not accept this mandate, that is not a law, that this is not acceptable. You are infringing on our rights as a United States citizen that was given to us in 1776 to have a choice of freedom. You are enforcing something that is against everybody's law. You are ruining people's lives, and you are trying to put this on our children. I am not just saying for myself that I am angry, but for the rest of Spokane and the Washington and the United States, that you should be ashamed of yourselves for sitting in that seat and not giving people honest answers. How dare you sit in your high chair and think you're better than us? We are all people of this United States. We should be treated equal, not belittled and be stepped upon like you are doing so freely and so, you are disgusting humans.
I need a better applause. Sorry. Yeah, I'm trying to find a mic drop. I can't find one.
Okay. Thank you, Megan. I will move on to the next individual here. Let me take a look on my list 1 second here.
See, I can't find a good mic drop.
Oh, yes. Bernadette Pager. After Bernadette Pager, it will be Ernest Quinn. Bernadette, give me 1 second here, and I'll let you know when you can unmute yourself. All right, Bernadette Pager, you should be able to unmute yourself right now.
Can you hear me?
Yes, absolutely. Thank you.
Thank you. I'm Bernadette Pager, Public Policy Director for Informed Choice Washington. Informed Choice Washington's rulemaking petition is your agenda item number 11, and we are asking you to adopt it. Our petition will create a new rule that will prevent you and any future board members from mandating emergency use products on children. The new rule will prevent you and future boards from mandating products on children that have not been properly tested, that have not been through completed phase 3 trial studies. We are asking you to look within yourself and find your humanity and your courage. We know you are feeling the forces of captured federal agencies and the forces of the money flooding to the state from federal agencies that will be threatened if you do the right thing and adopt our new rule. You have likely been contacted by large medical and professional associations that have a vested interest in vaccine programs, asking you to decline our petition. But you must do the right thing, if not for the children, then for your own soul. You do not want to face God having made a decision you knew was wrong and that put children's lives at risk. We are at a crossroads in America now. This fight against COVID measures and tyranny are happening in every...
Amen. Amen.
Okay, thank you, Bernadette. We'll move on to Ernest Quinn. After Ernest Quinn, it should be Damian Hare. Ernest, give me one moment, please, and I'll let you know when you should be able to unmute yourself.
You know what? I got a timer. I think we should start timing these to see if they're cutting people on.
Okay, Ernest, you should be able to unmute yourself now.
Yes, can you hear me?
Yes, thank you.
Sorry. So basically, I got a question. As far as, no one knows the long-term risk of this vaccine. You remember that the member of FDA advisory committee famously said that we're never going to learn about how safe the vaccine is until we start getting it. So nobody, and we've already started hearing of people just having heart attacks, dying on soccer fields, football fields, what have you, plus the over 900,000 different side effects to this vaccine. Now, you folks don't even mention any of that, but you want to say how wonderful this vaccine is for the people, but you don't cover the whole bases. I feel that our whole government, health department is lying about all kinds of things, and the people deserve to know.
All right, thank you, Ernest. I'm sorry we ran out of time. Next individual will be Damian Hare. After Damian Hare, it will be Tammy Thomas. So Damian, give me one moment, please, and I'll let you know when you can unmute yourself.
Let's see if we can work this time.
Okay, Damian, you should be able to unmute yourself. Damian Hare.
Hello, can you hear me?
Yes, thank you.
Okay. My name is Damian. I am a concerned citizen from Port Angeles, Washington in Clallam County, and I am currently being discriminated against by our county commissioners and health officer, as I and the rest of my family cannot currently go and dine at a local restaurant. My comment here is in regards to the efficacy of what has clearly become no more than something similar to the seasonal flu shot. It is clear in your numbers shown earlier that the efficacy of reducing infection and transmission with the current vaccine in terms of the current variant Omicron has been a failure. At this point, it is obvious that for those under the age of 50, it is pointless to receive an initial vaccine or booster. And for those that are at risk, either immunocompromised or of older age, the vaccine should certainly be made available, but not mandated. Unfortunately, the data coming out does not indicate that the vaccine is improving symptoms and...
Okay, and thank you, Damian. I'm sorry we ran out of time. Tammy Thomas, you will be up next here, and after Tammy, it should be Michelle Van der Morer. Tammy, give me one moment here, and I will let you know when you can unmute yourself. So, one moment here.
Let's see if they start the time when they say you can unmute yourself or when they start speaking.
Okay, it looks like actually that Tammy Thomas was here earlier, but is no longer showing up in the attendee list, unfortunately. So with that said, I will move on to Michelle.
They're not allowed to reply during public comment.
And then after Michelle, Michelle, it would be Kelly Palomino. So Michelle, give me 1 second here.
Just letting you know, there during public comment, boards are not allowed to respond to public comment. All it is
Okay, Michelle Van der Meer, you should be able to unmute yourself.
Yes, I did. Can you hear me?
Yes, thank you.
Thank you. I'm a citizen of Quincy and of Washington State, obviously, and I'm just concerned. We're not in public school, we homeschool, but I would just like to say your policies are creating some of the shortage problems. And it would be nice if you just actually showed people who died with, people who died of, and people who died in the state of Washington of any cause. Because you keep using percentages, but we don't get to see the percentages, and most people are just scared. So we don't get to see that it's actually a very low number of people who die of coronavirus, and then people are dying of other things in the state of Washington. So I'm not for a vaccine mandate, but I am for people getting to choose. If you're high risk, get the vaccine. If you don't want to, don't force people. And all the other mandates kind of need to go as well. And somebody else, you can move on to somebody else now.
Okay. Thank you, Michelle. The next individual, it should be Kelly Palomino. And then after Kelly, looks like it will be Terry Larson. Kelly, give me 1 moment here, and I will let you know when you can unmute yourself. Okay, Kelly Palomino, you should be able to unmute yourself.
Can you hear me?
Yep. Yes, absolutely.
Companies over the country now are coming out with stats that non-COVID deaths have gone up 40% as compared to pre-COVID average deaths from 2018 and before. Does Washington State have a total death rate from pre-2018 compared to current deaths in general? Has the health department contacted the insurance companies and funeral homes in Washington to come up with numbers? Is anyone concerned with over 1 million injuries reported to the VAERS report so far? The insurance companies are also reporting a huge uptick in long-term injury starting the very same time the vaccine rollout came out. The increase in death and injury seems to correlate to vaccine injury, increasing in unexplainable deaths, spikes in cancer, or heart and stroke deaths. Why are we pushing something so injurious when the deaths from COVID have dropped to the pre-COVID normal flu deaths in levels?
So if they cut her off, that means the minute he says, Kelly, you can talk, they start the timer.
1 moment. I will let Terry Larson know when you can unmute yourself. And after Terry Larson, it should be Deborah Cummings. Terry, give me 1 moment, please.
I just want to see how responsible and how honest these people are. I think they say,
all right, Terry Larson, you should be able to unmute yourself.
Hi, I'm Terry Larson from Roselia. And what I want to say, I'm a concerned parent, citizen. What I want to say is these government mandates have completely destroyed our economy. They've created division within our communities, within our counties, within our state. And it's stolen parts of our kids' lives that they will never get back. Those kids that graduated last year, there's parts of it that they will never get back that we were afforded. When we were in high school, we got those memories. They didn't. You created this mess. You created the shortages and staffing. You created the fear. And now you need to do the right thing to fix this now. And that is all I have to say.
Okay, thank you, Terry. I'll move on to the next individual. 1 moment, please. Okay, so next person is Deborah Cummings, and then after Deborah, it should be Pietra Gabo. Deborah, give me 1 moment, please, and I'll let you know when you can unmute. All right, Deborah Cummings, you should be able to unmute yourself here.
Okay. My name's Deborah Cummings. I am a mother
grandmother, have lived most of my adult life in Washington State. My late husband was a teacher, and several of my children are now teachers. I am concerned about several things. One, at any other time in history, this vaccine would have been considered a vaccine failure and would have stopped in January of last year because of the severe number of deaths and injuries that had been reported to VAERS in January of last year. My children, many of them were vaccine injured as children, and group health refused to vaccinate them anymore, yet those children now have no medical exemptions for these mandates to keep their jobs. This is wrong. Definitions are changing, and they're not based on science. The definitions seem to be erasing every kind of...
I think they have an automatic
sorry, we ran out of time. Next individual is Pietra Gable. After Pietra, it should be Stacy Milligan. Pietra, give me one moment, and I will let you know when you can unmute yourself.
You know, what do you guys think? Do you think they're doing this on Zoom so they can automatically shut people off after 60 seconds? Because when you're there in public,
looks like
you can still
Pietra
keep
Gable
talking.
was with us earlier, but she's now no longer in our attendee list, unfortunately. I'm going to move on to Stacy Milligan. Stacy, give me one moment here, and I'll let you know when you can unmute. Then after Stacy Milligan, I will move on to Francis Mounts. One moment here.
Like I was saying, I think they're doing Zoom on purpose because then they can automatically shut their mic off and you can't hear them. In public
Okay,
form,
Stacy Milligan, you should be able to unmute yourself. Stacy Milligan, are you here with us to provide your comment? You should be able to unmute your microphone.
Okay, folks, you need to test your microphone out before you get into Zoom, folks.
Looks like Stacy Milligan's not at the microphone at the moment.
Maybe they went to the
I will
bathroom.
move on to Francis Mounts. And then after Francis Mounts, I will move on to Twyla Emig. Francis, give me one moment, please, and I'll let you know when you can unmute yourself.
One. See, you're a liar. You said 1 moment. That was one moment.
Okay, Francis Mounts, you should be able to unmute your microphone.
That's a pain in the butt trying to keep this number straight. But I want to show you guys, make sure
Francis
I want to hold them
Mounts,
accountable.
are you able to unmute your microphone to provide your comment?
Can you hear me now?
Yes, thank you.
It kept asking me questions. Sorry. So I have been listening to everybody's complaint. I think they're pretty much all the same. And this country was founded on godly principles. And the incarnate rights that we inherited came from God, didn't come from any country or anybody else. It came from God. And what we're experiencing right now is ridiculous. And it's against the law, but nobody seems to care about that anymore. The governor, I could say a lot about him, but there's no point. It's worthless. The whole point of this is that you've got 400 and some people of athletes, professional athletes that have gotten sick. 137 of them have died. And these are professional athletes that are very healthy. What are you doing to the real people? It's sad. Can't wait till the crimes for humanities come out and you all go to jail. Thank you.
All right. Thank you, Francis. I'm going to move on to the next individual here. Give me one moment to take a look. And that will be Twyla Emig. After Twyla Emig, I'm going to try to circle back to Dan Wood. I think his name was displayed differently. So after Twyla, I'll try to move on to Dan Wood. Twyla, give me one moment, please. Twyla Ewig. Okay, Twyla Emig, my apologies for mispronouncing that. You should be able to unmute yourself, Twyla Emig.
All right, folks, if you're going to be signed up for this, please stay by your microphone or have your mic ready to go.
Twyla Emig, are you here with us? You should be able to unmute your microphone and provide your public comment. I'm not hearing Twyla Emig, unfortunately.
If I were to call in, I'd say, let's go, Brandon.
Individual. I'm going to try to call back on Dan Wood. I see it displayed as D Wood. Dan Wood, you should be able to unmute yourself.
He probably got mad and left because you didn't.
Dan Wood, are you able to mute your microphone for public comment? It doesn't look like Dan Wood is here at the moment, unfortunately. I'm now going to move on to Catherine Austin. After Catherine Austin, I'll go on to Jeremy Hines.
All right,
Catherine, give me one moment here, and I'll let you know when. Okay, Catherine Austin, you should be able to unmute your microphone.
All right, how many people do you think left because they said, F this, I'm not going to wait here because you have 7,500
Catherine
people
Austin,
signed up?
are you able to unmute your microphone for public comment?
How many people left because they're mad because they know they're 1 in 7,500 and only get 100 people
I'm
get
not
to
hearing
speak?
anything from Catherine Austin at the moment.
Sure they left.
I will now move on to Jeremy Hines, and then after Jeremy Hines, I will go on to Zaina Carver. Jeremy, give me one moment here, and I'll let you know when.
I like this one better.
All right, Jeremy Hines, are you able to unmute your microphone?
I believe so.
Yeah, we can hear you, Jeremy. Thank you.
Excellent. Thank you. I just wanted to comment on the vaccine for children. The audacity of the CAG group to diminish my contribution from the rare disease community was rather abhorrent. I don't think that by saying it should be that my concern should be ignored and talked about with my doctor, and then I can use the regular process for getting an exemption.
Thank you, Jeremy. I'm sorry we ran out of time. I'll move on to the next individual here. And it should be Xana Carver. After Xana Carver, it should be Cindy Tucker. Xana, give me one moment, please. Okay, Xana Carver, you should be able to unmute your microphone.
Hello, this is Xana Carver. Can you hear me?
Yes, thank you.
Yes, I support Informed Choice Washington's petition that limits what you can mandate to only treatments that are not under emergency use and those who have undergone phase 3 clinical trials. Now, the lack of testing with these vaccines is appalling. They have not undergone any genotoxicity, teratogenicity, reproductive toxicity, cardiac toxicity, neurological toxicity, renal toxicity, hepatic toxicity. We cannot even consider mandating these for children. We do not know the long-term effects. When it usually takes 10 to 15 years for a vaccine to be developed, and these vaccines hit the market in 6 to 8 months, we should all have a huge red flag. And I also support what others have said about the VAERS database. It is extremely concerning. So please be cautious. Our children are precious. It should be a choice between families and their physician, and in no way mandated to attend public school. Thank you.
Well, they're doing a good job at keep giving them their full time.
Thank you, Xana. We're going to move on to the next individual. Give me one moment to take a look. And it will be Cindy Tucker. Then after Cindy Tucker, it will be Terry Hodges. Cindy, give me one moment, please.
What happened? Your balls drop off?
Okay, Cindy Tucker, you should be able to unmute your microphone.
All right. So I was wondering if the board is concerned with the increase in COVID cases in states and countries that are more highly vaxxed. As you can see from the comments from all the other people, we are aware of what's going on. We're not under a rock. We know what's happening. And I believe you've woken up a sleeping giant. So I would encourage you to highly look at what we're saying and take it to task. Thank you.
Yield your time to somebody else, please.
Move on to the next individual now. Looks like that will be Terry Hodges, and then after Terry Hodges, we have Beth Kirk. Terry, give me one moment, please.
I'm surprised the guy's not saying, bear with me.
All right, Terry Hodges, you should be able to unmute your microphone.
Yes. Couple of questions for you to consider. One is, whatever happened to my body, my choice, or does that only apply to killing kids? The other is that under emergency use authorization statutes and Nuremberg Code, everyone is entitled to informed consent. I have never seen an instance in my family or friends where fully informed was administered, and then this whole mandate thing, and losing jobs and so on, certainly disqualifies the uncoerced consent aspect of that law.
Oh, his internet cut out or something. Darn it. Gotta give it to him. I gotta give it to him. What happened to my body, my choice? Or does it only count with killing people?
Okay, Terry, I think we've ran out of time here. And I'll move on to the next individual here. One moment. And it looks like we have Beth Kirk. Then after Beth Kirk, I'll move on to Lesko Brandon. 1 second, Beth, and I'll let you know when you're ready.
Oh my gosh! Oh my
right,
gosh! I love
Beth
it.
Kirk,
Sorry.
you should be able to unmute your microphone.
Sorry, I need to turn
Yes,
my
can you
mic
hear
off.
me?
I need to
yes,
turn my mic
thank you.
off. Sorry, guys.
So I have issue with the mandate, piggybacking on what the gentleman before me was saying about consent and taking that away from the American people. And in the state of Washington, I teach first grade, and we don't have any instances of problems, and nor should these children be made to have a vaccine that has not been proven and has more than that had countless side effects, death, complete full injury, and it's just unconstitutional and unacceptable for people to tell parents that they have to vaccinate their children that potentially harm them for life or kill them. Thank you.
All right, thank you, Beth. We will move on to the next individual here. Let me take a look. Let's see who that is.
It's Let's Go Brandon. You better let him talk. You better let them talk.
And we will have Lesko Brandon. I will let you know, Lesko, when you are ready. And then we will also have Don Olmsted after Lesko. So Lesko, give me 1 second.
Oh my gosh, that was hilarious. Let's go, Brandon.
All right, we have Lesko Brandon. You should be able to unmute your microphone now.
I wanted to hear him speak. No, they muted him on purpose.
Brandon, are you here? You should be able to unmute your microphone.
How much you want to bet they muted this guy on purpose? I'd put money on that one. I'd put money on it. I guarantee you they're not letting.
I'm not hearing Lesko, unfortunately, at the moment. I will move on to the next individual here. Up. Give me 1 moment to take a look. And that will be Don Olmsted. And after Don Olmsted, I'll let Kevin Miller. Don Olmsted, give me 1 moment.
Sorry, if you guys want me to shut up, say, Eddie, shut the F up, please.
Okay, Don Olmsted, you should be able to unmute your microphone.
Thank you. I'm Dawn Olmsted from Medical Lake, Washington. I just want to say no one on the board today has discussed that there are other viable treatments and preventative measures that can be taken to prevent or lessen the symptoms of the virus, such as ivermectin, HCQ, vitamin D, vitamin C. And no one is speaking to the VAERS system and the incredible amounts of vaccine injuries and deaths that have happened. It appears there's only one avenue that this board is discussing. And I just appeal to the board to legitimize other scientifically proven therapies and other than vaccines, and stop moving forward with this misinformation that vaccination, masking, and testing is the only way to navigate this virus. I appreciate your time.
Thank you, Dawn. I will now move on to the next individual. Give me one moment to take a look at that.
Oh, I still love the "Let's Go, Brandon."
And then we will now have Kevin Miller. Then after Kevin Miller, it will be Peter/Rosemary Dorn. Kevin Miller, give me one moment and I will let you know when you can unmute yourself.
I can't believe they had a teacher on here, anti-vax.
Okay, Kevin Miller, you should be able to unmute your microphone.
Hey, Kate, like you know a lot of these people.
Kevin Miller, are you available to unmute your microphone?
Do you think they know who they are so they can block them before they even come in?
Yes, can you hear me now?
Yes, we can hear you, Kevin. Thank you.
Okay, great. So yes, my name is Kevin Miller. I was born in Toppenish, Washington. I now reside closer to the gorge these days, a little closer towards the Oregon side. So I get to see both sides of this whole thing. And I agree and would like to reiterate with what has been said as far as these mandates are atrocious to the max. And an uprising, as the one lady mentioned before, I mean, that's not far out of scope when you start to trample on individuals.
His internet's messing up.
He's going to mandate anything close to type of draconian policies that are being presented. Definitely.
Thank you. That sucks. That sucks. Sorry, guy.
Thank you, Kevin.
Too bad we don't live in the European countries where internet is super fast.
Look at the list here.
In other countries, we have one of the worst internet services out of all the
Peters / Rosemary Dorn, and then after Peter and Rosemary Dorn, it will be Jason Miller. Give me one moment for Peter and Rosemary. And just to clarify, Peter and Rosemary it's in their display name, so it should be one individual, I believe. Peter and Rosemary Dorn, you should now be able to unmute your microphone here.
Of course. All these breaks they could have added.
Peter and Rosemary Dorn, are you available to unmute your microphone and provide your public comment?
Oh, I have a feeling that if they start doing this,
and it sounds like Peter and Rosemary Dorn are not
jail for not being vaxxed, there's going to be a civil war.
Move on to the next individual here, and let me take a look here, and that should be Jason Miller. After Jason Miller, it will be Maureen Kircher. Jason, give me one moment here.
No, Kate hasn't gone yet, Mr. Bill. Not yet, buddy.
Okay, Jason Miller, you should be able to unmute your microphone.
Hey, can you hear me?
Yes, Jason, thank you.
Hey, great. Hey, I want to thank you guys for putting on this and taking a couple public comments. Father of two, been in the education system for several years, worked with kids, and I just know that their immune systems can handle this virus without the mandate. I think it's terrible without knowing the long-term effects. I don't plan on getting my kids vaccinated if it's a mandate in order for them to attend public schools. I just think it's a terrible idea. I think there needs to be more research and what the long-term effects are. Thank you.
All right. Thank you, Jason. I will now move on to the next individual on our list.
Thanks for sharing, Mr. Bill. Thanks for raiding us or whatever, or sharing it, I guess. What are you doing?
Give
Hosting.
me one moment. My computer's a bit slow here. My apologies.
Yeah, I thought he was going to go the other way for a second. I thought maybe this was a liberal calling in, but no. It sounds like so far it's all people that are against what they're trying to do here. God bless America, where you can speak
my
your
list
own
was
mind.
actually still loading. I apologize for the next individual.
Nathan, this is Christy. You had said Maureen Kircher is next.
Oh yes, Maureen Kircher. Thank you, Christy.
Maureen, you should be able to unmute yourself. All right, Nathan, it doesn't look like Maureen is there to unmute herself. I'm not sure who's next on your list.
Yeah, I definitely wanted to hear Let's
thank
Go
you, Christy.
Brandon.
I will go ahead and take a look here. Okay, so I'm going to go ahead and move on to Jennifer Olson. And then after Jennifer Olson, it should be Guru Desiree. Give me one moment, Jennifer, and I will let you know when you can unmute your microphone. Okay, Jennifer Olson, you should be able to unmute your microphone.
Yeah, do me a favor, guys. Just hit the like button, share button, whatever you can do, just so we can build this up as
Jennifer Olson, are you available to unmute your microphone and provide your public comment?
as people with similar opinions, we get shut down by YouTube, all the news media. Our voices are never heard. But you want to mess with that algorithm at YouTube? Just hit the like button.
I'm not hearing anything from Jennifer
comment,
at the moment,
comment.
unfortunately.
That'll get more people to see this. They hide my videos.
Giroux Desiree, and then after Giroux Desiree, it should be Alan Hoffer. So give me 1 second, Giroux.
I searched in the exact title with the exact
My apologies
name
if I'm
of my
pronouncing that
video.
wrong. We have Giroux Desiree. You should be able to unmute your microphone.
And I can't find my own
Hello.
videos.
Can you hear me?
Yes, we can hear you, Giroux. Thank you.
Hi, my name's actually Desiree Giroux. I'm a Washington State resident, mother, business manager, and taxpayer. I am calling in regarding the discussion regarding the revisions to Act 246-100 and -105. The fact that we have WAC code 246-100 is appalling to me in so many ways. We as Washington residents are a part of America. We are free residents, and to give local health authorities the ability to literally haul people away like they're part of the Gestapo is disgusting to me. Furthermore, the revision to WAC code 246-105, also appalling. We are taxpayers in Washington. Schools are public and paid for by tax dollars. There should be no way that you can deny a child entrance into a school simply because their parents choose what to do with their bodies. People should have bodily autonomy.
Thank you, Desiree Giroux. So we have to move on to the next individual here. Give me one moment. And it looks like the next individual will be Alan Hoffer. And then after Alan Hoffer, it will be Crystal Henderson. Alan, give me one moment here and I will let you know when you can unmute yourself. Okay, Alan Hoffer, you should be able to unmute your microphone.
Can you hear me, sir?
Yes, thank you, Alan.
Thank you. I've posted some of my stuff, and I sent an email to you guys, and I also posted in the question and answers. There's some really disturbing information in there that just came available 2 days ago. It looks like the government has known that this vaccine is a poor vaccine. It doesn't really work whatsoever. And one of the reasons why, it's an animal reservoir virus. We currently have no cures for animal reservoir viruses. I yield back the rest of my time. Thank you, sir.
We need to teach people not to waste their time when they're talking on these things. You know what I mean?
I will now move on to the next individual. And that will be, Crystal Henderson. And then after Crystal Henderson, I will move on to Dr. Agnes first. Crystal, give me one moment here, and I'll let you know when you are ready to unmute your microphone.
Folks, don't use words that don't help your benefit. When you go on
Okay,
stuff like
Crystal
this,
Henderson,
get right to the point.
you should be able to unmute your microphone.
Yeah, she's not going to be there. Like I'm saying, folks, get right to the point. You have 1 minute. You need the Micro Machines guy to come in here and talk like, you know what I mean?
Crystal Henderson, are you available to unmute your microphone and provide your public comment?
You know what I would do if I only had a minute? I would record it
Crystal Henderson is available
and play it at 2 times speed. That way I got 2
Go ahead
minutes.
and move on to the next individual.
That's what I would do.
Give me 1 moment to take a look here.
Record.
And that will be Dr. Agnes first. And then after Dr. Agnes first, I see Margaret Nartia. Dr. Agnes first. Let me go ahead and give you the ability, and I'll let you know when you're ready. 1 moment.
You're not a real doctor. You're just a dentist.
Okay, Dr. Agnes first. You should be able to unmute your microphone.
Oh, man. All these people are not speaking. Right, Jack? I totally think they're still muted.
Dr. Agnes first, are you available to unmute your microphone and provide your public comment? I'm not hearing anything from Dr. Agnes first at the moment. I will move on to our next individual. Let me take a look at this momentarily here. And that will be Margaret Nartia. And then after Margaret Nartia, I see Steechin Joanne. I think it might be Joanne Steechin. Margaret, I'll let you know when you're ready. Give me 1 moment. Okay, Margaret Nartia, you should be able to unmute your microphone.
You know, I never thought about that on Mr. Bill. Mr. Bill says maybe it's Antifa type.
Margaret Nartia, are you available to unmute
others.
your microphone and provide your public comment?
I never thought about that, Mr. Bill. Good point. Good point. Oh, and since you're doing that.
Yeah, I'm not hearing Margaret Nartia. Move on to our next individual. We have Steechin Joanne. And then after Steechin Joanne, I see Carly Reed. Give me 1 second, Steechin Joanne. And my apologies, it is Joanne Steechin. Joanne Steechin, you should be able to unmute your microphone right now.
Thank you. Can you hear me?
Yes, Joanne, thank you.
Thank you. Yes, I'll try to speak very quickly. What we have learned throughout the pandemic are the many ways that we have been lied to. The models created by the Imperial College, Niall Ferguson, showing millions of U.S. deaths projected were wrong, gravely exaggerated. The PCR tests given were created extreme high amounts of false positives because of this amount of cycles that were used. The inventor said they should never be used as a diagnostic tool at all. Asymptomatic transmission is a fabrication, according to Dr. Michael Yaden, Dr. Peter McCullough, and other experts now. Safe, effective, inexpensive treatments, especially hydroxychloroquine, ivermectin, were mocked, suppressed, censored, and doctors were threatened for using them to safely save thousands of patients. Why would this be? Because the emergency.
Okay, and thank you, Joanne Steechin. I'm sorry we ran out of time. I will move on to our next individual here. Give me 1 moment.
They didn't turn off their damn phone. That's not me,
and
folks.
I
That's
see Carly Reed. After Carly Reed, I'll call on Michael Shinek. Carly, give me 1 moment here, and I'll let you know when you should be able to unmute your microphone.
Come on, I want to hear Kate Speaks. I want to hear Kate.
Okay, Carly Reed, you should be able to unmute your microphone.
Can you hear me?
Yes, Carly, thank you.
I'm astonished at what I'm seeing on the slides and what the comments and stuff that I'm hearing. There is no comment so far of what I'm hearing for people who are recovered from COVID, natural immunities. There's no discussion of that. There's no mention of that even included in the numbers. And yet we are treated as second-class citizens and have no importance at this point right now, and losing our job, losing everything that we have. And that's not just, I'm talking about lots of people in this state. And now you want to do our children and eliminate their education? You're going to have a tsunami of kids coming out of the school if you push the mandate. A tsunami. Parents will pull the kids out. And it will crush the educational system if you push the mandate for the kids.
Okay, and thank you, Carly. Sorry we ran out of time. I'll move on to our next individual here. I'll take a look at our list here. Give me one moment. And I see Michael Schenk. My apologies, Michael Schenk. And then after Michael, I see Lesko Brandon. Michael Schenk, give me one moment, and I'll let you know when you are
let's
ready.
go, Brandon.
Okay, Michael Schenk, you should be able to unmute your microphone.
Test?
Yes, we can hear you, Michael. Thank you.
All right. Hi, Keith and the board. Definitions in wax provide context for all infectious diseases, not just HIV and AIDS.
Shit, that's my
Unfortunately, code tends to be applied across the board. Removing local control is something I will never support. In WAC 246.100, the new number 17 strikes a term for the period of communicability or contamination, excuse me, leaving incarceration, isolation, quarantine open indefinitely, inclusive of any disease du jour. As an aside, regarding new definition number 20, COVID and HIV are not curable. They are survivable. The quote, vaccine does not make a carrier unable to transmit the disease either. As a challenge to Dr. Umair, as of this morning, 80% of Confluence Health patients, COVID patients in Wenatchee are, quote, fully vaccinated. Item 11, adopt it. I'm not asking, I'm insisting. Will you go on the record that you will not be forcibly trying to make a law to forcibly administer any vaccine, and you will that the non-compliant.
God damn it!
Thank you, Michael. I'm sorry we ran out of time. I will move on to our next individual here. Give me one moment to take a look, and I see that is Lesko Brandon. After Lesko Brandon, I will call on Russell Rivoli. Lesko, give me one moment, and I'll let you know when you can unmute your microphone.
I can't wait for this one.
Okay, let's go, Brandon. You should be able to unmute your microphone.
Hi, yes. I wanted to say that part of the problem that we're seeing is that these vaccines don't work. They don't meet the minimum requirement of a vaccine by the state's guidelines. And also, it doesn't seem that anyone is looking at the fact that the absolute risk reduction is not the same as the relative risk reduction. Absolute risk reduction makes it look like these vaccines work at about 90%. They've waned by efficacy down to 30%. And the relative risk reduction is only about 1%. So if you take a vaccine, you're only 1% better from someone that didn't take the vaccine. And with kids, they have negligible risk for this COVID. So by installing this, you're going to lose a lot of kids at school. Parents will drop their kids not only out of school, but most likely leave the state. So that's something that the state and the medical doctors really need to look at. Actual data, not a sales slogan of safe and effective. They're not the same thing.
Can I just say, if you're going to use Let's Go Brandon, you need to be really rude and obnoxious. Can I just say that?
Move on to our next individual here.
Call my
give me one moment to take a look at that.
Can you guys hear this? No. I'll be right back, guys.
Okay, and I see Russell Rivoli, and then after Russell Rivoli, it's Diane Swingler. Russell, give me one moment, and I'll let you know when you can unmute your microphone.
You should be able to hear me. Can you hear me?
All right, Russell Rivoli, you should be able to unmute your microphone.
Yes, hello. Thank you for taking my call. My complaint is simply the paradigm that we've moved away from the political and the rights of the citizens, but the science really sucks that you guys are playing this playbook by. And I really would ask you to kind of step back and look at some real science and try to make the decision informedly, and even pick up a nice copy of The Real Anthony Fauci by Robert F. Kennedy Jr. It might open your eyes a little bit. Thank you.
Thank you, Russell. I will now move on to our next individual. Let me take a look at that really quickly. And I see that is Diane Swinkler. After Diane Swinkler, I will call on Lori Cook. Diane, give me one moment here, and I'll let you know when you can unmute your microphone. Okay, Diane Swinkler, my apologies. You should be able to unmute your microphone.
Hi, thank you for taking me. I'm sorry, I wasn't prepared because I didn't think that I was signed up, but I do want to reiterate, I am concerned about the vaccine mandate for the kids. For some of the points that have been already expressed, these have not been tried. The trials have not been done. They're still for long-term effects on the kids. They are healthy. They have a low transmission, and the vaccinated people have shown that they also transmit. So I do not see any reason that we should be mandating vaccines for our kids. And furthermore, the parents need to be the ones to decide on medical issues for their kids and not the schools. Now, I understand that there are vaccines that they do have to participate. This is a vaccine that is untried, and we haven't seen the informed consent necessarily. And so parents still need to decide what's best for their own kids. And we have seen a number of issues with myocarditis with the
Thank you, Diane. Sorry, we ran out of time. I will move on to our next individual.
Nathan?
Oh, yes.
Hey, we are now at 65 minutes, so we're 15 minutes over. So we're going to take two more, and then we have to move on to other business for today, okay? Tom and Samantha, after we finish these next two, we're going to skip agenda item 7 and move to agenda item 8, and we'll move 7 to the afternoon. So here in the next 5 minutes, if you two could be ready for number 8, that would be great. All right. Thank you, Nathan. Two more, please.
Thank you, Keith. Yes, two more individuals. It will be Lori Cook. After Lori Cook, it will be Julie Britt. Lori, give me one moment and I'll let you know when you can unmute your microphone. All right, Lori Cook, you should be able to unmute your microphone here.
Hi, do you hear me?
Yes, Lori, thank you.
Okay, wonderful. First off, I'm kind of disappointed in the way this has been laid out. The fact that you guys are not answering any questions really leaves a problem for the citizens, because we're supposed to have the right to make a decision here. The idea of mandating someone else to choose whether my children get vaccinated or not is completely wrong. Not to mention, those of us who get state insurance, we don't qualify for any exemptions to the vaccines, which is not right. My doctors, I've seen 2 different doctors lose their jobs because they did not push the vaccine for every person who came through. It is not right. And you will see a mass exodus if you try to mandate that all children get a vaccine that is not even fully tested. It doesn't even make sense that this is even placed as a question before the real.
All right, thank you, Lori. I'm sorry we ran out of time. I'll move on to our next last individual here for public comment. That will be Julie Britt. Julie, give me one moment here. Okay, Julie Britt, you should be able to unmute your microphone.
Can you hear me?
Yes, Julie, thank you.
I think what you're doing sounds like what happened in Nazi Germany, and you know what happened to those folks. I think this is wrong. My physician told me I should not have the vaccine, and I don't think the government should mandate that I should. What happened to my body, my choice? if the Democrats want this as far as abortions, it should also be for any other medical procedure or medication. And I think what you're doing is wrong, it's unconstitutional, and it's immoral.
All right. Well, we are going to bring public comment to a close. And again, we're now sitting at about 12:30, so we did go about 20 minutes over to try and fit more people in. Thank you, everyone, for your public comments. We appreciate it. Next, we're going to move to agenda item number 8, which is a briefing on the Immunization Technical Advisory Group. Dr. Pendergrass and Samantha, you're up.
So thanks, Keith. I guess I need to start with the background and summary. We have had, you hearing me?
You're going in and out a little bit, Tom. Yeah, Tom, we're not hearing anything from you now. Still muted. Maybe turn off your camera.
The challenge is that it immediately dumped me as we started in. So as folks who are calling in, there are problems along the way. So let me see if I can't get you to understand where we are with the technical advisory group. Every time we add a new requirement of any kind or new law, we have to go back through the background. RCW 28A.210.060 establishes an immunization program as necessary to protect the health of the public and individuals by providing a means for the achievement of full immunization of school-age children against certain vaccine-preventable diseases. The board created in 2006, a set of vaccine requirements that must be met before any mandate would be made for, or requirement would be made for school entry. That was read again in 2017 by another committee, another technical advisory committee. Those recommendations were adopted in November of 2017. The board has specific criteria that determine how we look at a antigen, a vaccine, and it begins by saying there are 2 qualifying assumptions. A process exists for opting out, want that heard well, and that the vaccine is accessible, meaning that there is not a cost barrier to receiving it. If those things are not been met, then a technical advisory committee is not either. Well, we believe those are now met. In October 2021, the board received a briefing on the criteria and voted to direct staff to begin the process of convening a technical advisory group to consider whether COVID-19 belongs in the required vaccines for school entry. Sam Paskowski is going to be sharing with you, as is Hannah Firmbach, on feedback on how and where we are in this process. Let me begin by saying that it takes a long time for us to move through this process, and they will share with you some of the issues with the people who've been accepted. I just want to let everyone on who has spoken and who's online to hear, I did in fact read 3,597 different written submissions to the board on their opinions about both the technical advisory group and on the vaccine credential. Sam, would you take us from there?
Thank you, Dr. Pendergrass, and good afternoon, board members. Again, my name is Sam Piskowski. I'm a policy advisor for the board, and I'm joined by my colleague from the Department of Health, Hannah. We are here today to provide board members an update on the work that has been done toward convening a technical advisory group to consider the COVID-19 vaccine in WAC 246-105-030. And as Dr. Pendergrass mentioned, in October, you all directed staff to begin this work. So this is just an update on what we've been doing since October on this work. And thanks, Lynn, for advancing my slides. So before I dive into that update, I do just want to briefly go through an overview of the board's authority, the current rules, and the TAG process for this work, and then I can talk about where we are in that process. So the Washington State Board of Health has the duty and authority to adopt rules establishing procedural and substantive requirements for full immunization for child care and school entry in the state of Washington. The board's rule extends to both public and private schools in the state, and the Department of Health and our school partners are the implementers of this rule. And this authority sits in RCW 28A.210.140, the chapter that's referenced on the slide you see now. The statute states that attendance of every child at every public and private school in the state and licensed daycare center is conditioned upon the presentation of proof of either full immunization, the initiation of and compliance with the immunization schedule, or a certificate of exemption. Next slide, please. So as noted, to fulfill the requirement, a student may present a certificate of exemption. The statute provides for 3 exemptions you see here on the screen: a medical, religious, or religious membership, and philosophical or personal exemption. I will note there is one exception to that, which that the philosophical or personal exemption is not available for the measles, mumps, and rubella, or MMR vaccine. The legislature took action, and that is referenced in the small citation at the bottom of the screen, RCW 28A.210.090, subsection 1 sub C. And that was an action of the legislature. Next slide, please. So the board has adopted rules under its statutory duty and authority for immunization requirements in Chapter 246.105 of the Washington Administrative Code. And these rules establish the documentation of immunization status required for child care and school entry. As Dr. Pendergrass noted, during a 2004 rule review, the board identified an opportunity to develop a systematic evidence-based approach to assessing immunizations for possible inclusion in the rule, similar to the existing process that the board has for updating its newborn screening rule. The board convened at that time a multidisciplinary immunizations advisory committee with the goal of developing a set of criteria to consider possible antigens against. That group met and developed recommendations, which following revision were adopted for use by the board in 2006. And since that time, the board has used those criteria to consider 2 immunizations, the pneumococcal vaccine in 2007 and the meningococcal vaccine in 2015, sorry. Following that 2015 group, the board did direct staff to convene a separate technical advisory group to review and update as necessary the criteria. This group met in 2017 and provided recommended updates to the board. The board accepted those recommendations, and the criteria being used for the current technical advisory group to consider COVID-19 vaccine are using the updated criteria. Next slide, please. So on this slide, you can see a flow chart of how the board's process works. So as part of the criteria development, the board also established a process for moving through this work. You'll see that here are the steps that the process will move through. And we are kind of in that orange box right now. Board and Department of Health convene a technical advisory group to consider the evidence. The TAG will meet to consider the COVID-19 vaccine against the 9 criteria, which for reference are available in the appendix of tab 8B under the meeting materials. And the technical advisory group will hear that information and develop a recommendation to provide to the board about whether or not that immunization should be added to the current rule. The last step in the process, as you can see in the last box, is that the board will receive a briefing on the TAG's recommendation and make a determination about how to move forward. As a reminder, the technical advisory group is only advisory and the board is the decision maker. here. Next slide, please. So this is kind of where I want to spend some time talking about what we have done so far and where we're going. Currently, as I noted in the orange box on the prior slide, this work sits kind of in the convening of the technical advisory group stage. To date, the staff have worked with our co-chairs, the board representative, Dr. Pendergrass, and Department of Health co-chair, Dr. Quanget, to finalize the membership positions and fill those seats. For board members, tab 8C provides a list of those membership positions. The TAG held an initial orientation meeting on December 29th, 2021, and this served as an opportunity for TAG members to meet one another and for staff to provide an overview of the process and criteria, and an opportunity for folks to ask questions. The board has also contracted with a independent facilitator to help guide these technical advisory group meetings. So the orientation meeting also provided an opportunity for folks to meet our facilitator. Staff are now working with TAG members to identify availability for future meetings. As I noted, the membership positions document is available in tab 8C. So we do have 18 members, and we are working to coordinate various schedules to identify opportunities for future meetings to begin the assessment against the criteria. Staff also continue to work to compile information that the TAG will need in order to review against those criteria and identify presenters for that information. We do anticipate having multiple meetings of the technical advisory group kind of between this month and March of 2022, where members will review information related to each of those 9 criteria. And we anticipate that the final recommendation will be brought to the board at a future regularly scheduled meeting after that time. And at this time, that's kind of the update that we have for you all, and I'm happy to answer any questions that board members may have.
Board members, questions for Samantha or Dr. Pendergrass? Dr. Quanget.
Thank you, Chair Grellner. And I just wanted to take a moment to thank the Board of Health for starting this process, and a huge thanks to the Board of Health staff for the incredible support that they're giving this process. This is such an important question to consider, especially as the pandemic is entering its 3rd year. And as Sam mentioned and Dr. Pendergrass mentioned, I just want to emphasize to our viewers that this is just a single step in a multi-step process. The technical advisory group is just that. It's technical, focusing on the science and the data, and it's advisory, meaning that we will only make recommendations to advise the Board of Health. So I just wanted to say those words of thanks, say that it's an honor to co-chair this committee with Dr. Pendergrass, and just give my appreciation to the people who will be contributing their time as part of their time and expertise and experiences as part of the technical advisory group. Thank you.
Board members, other questions?
I wanted to give others a chance to speak, Keith, before I comment further. A recommendation for addition to the required entry criteria for immunization to schools involves not only the vaccine and whether it works and how it works and what it's good about and what it's not good about, but it also involves how do we in fact think that would be implemented. So we have representatives from the Office of the Superintendent of Public Instruction, from school nurses, from 5 different groups of consumers and parents, people from the Department of Children, Youth, and Families, the Healthcare Authority, tribal representatives, professional associations for family physicians, school administrators, the Academy of Pediatrics, local health officers. All of those folks are very important to us as we put together a look at how would we move such a thing along. The other reassurance I want to give to the public is that there have been recommendations for vaccines in the near past that were turned down. For instance, we do not require meningococcal vaccine for every student who enters K-12. So this is an open process in that we're really looking at the science and how that leads us to say what is the protection. So many of the points that have been made about who is the population at risk, what does that risk involve, are there good and bad effects from the vaccine, are all in the conversation before a recommendation is voted on by all members of the technical advisory group. And then we bring that back to the board for a final decision.
Question. Through the evaluation process with the tag, we've heard lots of public comments today that the difference between an approved vaccine versus an emergency use authorized vaccine, is that discussed by the tag? And is that one of the criteria that's evaluated?
One of the things that came up in October was that since this is a long process and since generally our ability to look at changes into school entry requirements takes a fairly long lead time, so that school nurses, school administrators, public health can look at what it requires to do that. That is, how do I get the data? And is the child immunized or not? Do they have an exemption? All of that stuff takes work. So the answer to your question is that the board wanted to get a start moving the process along while awaiting more mature data for the use of the COVID-19 vaccines in the K-12, pre-K-12 age group. The reality is that literally thousands of kids are being tracked and followed by those from those parents who've chosen to go ahead and vaccinate their children. That emergency youth authorization is still totally voluntary. It is not a requirement. However, it is a requirement for both our technical advisory committee and the Food and Drug Administration to approve the vaccines. So FDA right now has done serial approvals by age group for the 3 vaccines. It is correct that there is still an emergency youth authorization for certain age groups. We definitely will be considering that. That will be a topic of conversation and will be part of the recommendation back to the board, depending upon what happens by the time that recommendation is made.
Board members, any last questions for Dr. Pendergrass, Dr. Quanget, or Samantha? Okay, hearing none, we will move on. That was agenda item number 8. We're going to move agenda item number 7 to the afternoon. We are going to recess for lunch right now. We will resume the meeting a little before 1:30. And at 1:30, we'll pick up with agenda item number 9, which is the rules hearing for WAC 246-100 updates. So with that, board members, please be back at about 1:25 to get us ready for our 1:30 rules hearing. And with that, we are recessed for lunch.
Okay, I am just testing to see if you guys can hear me on the live stream before I start talking, just rambling on. Can you guys hear me at all? Mommy. Okay, so I was supposed to be speaking under item number 7 is what the agenda item for me was. They moved that to this afternoon. And because of that, I am going to have to sit around and wait for a few more hours. They've now moved it to after the second public comment section. So the second public comment section is going to deal with WAC code 100-296 -045 through 050, which do talk about quarantine and isolation and camps for those who are not following the codes. So I'm going to deal with my kids really fast, and then I'll come back and kind of explain a little bit about what just happened. I apologize. Sorry about that. Kids fight. That's all I have to say about that. So what happened was, they started the board meeting late. The over 7,000 people in Washington State decided to tune in to this Zoom meeting and try to participate in the public comment section. This is something that is unprecedented, and I'm actually extremely proud of Washingtonians for calling in. There have been so many times where I've called in for public comment, and it's literally like me and 3 other people. And the hour long that they put aside for public comment doesn't even get used up because there's not enough of us to talk. And they only give you 3 to 5 minutes to talk. So Washingtonians, I am very proud of you. I'm just throwing that out there because 7,000 people. As of right now, we have 4,200 emails that have been submitted to the Washington Board of Health. So I am extremely excited about the fact that we are finally showing that we're not going to just give in to the dictatorship of Inslee and his cronies. You know, all of these people on the Board of Health, for the most part, are appointed positions from Inslee, and it's time for us to kind of stand up against them and to say, hey, enough is enough. You're not going to tell us how to run our lives. You're not going to tell us what to put in our bodies. And you're sure as heck not going to tell us what to do with our children. And so I'm really proud of Washingtonians for finally stepping it up. I wish it was 70,000 or 170,000, but I will take 7,000 and I will take 5,000 emails because that is more than what you normally see in combination of meetings throughout an entire year. Sorry. Does anybody have any questions while we're waiting for them to come back from lunch? Because I would happily answer any questions that you guys may have about what is happening with the Board of Health meeting, or if you'd like to talk about things that are happening on a federal level, or even about the 3 gun laws that Washington is currently discussing in their legislature today, right now, as we speak. They're actually talking about 3 different gun laws in Washington State. So if you guys have any questions about any of the things that are going on in our country or specifically Washington State, feel free to throw some questions out at me and I'll happily answer them. If not, I'm just going to jump into talking about some of the bills that are coming up in the House of Representatives, specifically a bill that deals with the jurisdiction of who prosecutes military personnel. That is coming up in the House of Representatives, and they are trying to change it so that they are prosecuted through a civilian court. The problem with that is that in a civilian court, sometimes there's classified information that cannot be dictated to civilians. So that's kind of an interesting bill that they are throwing out there right now. What are the 3 gun laws in Washington State? Okay, so the first gun law right now that is being discussed in Washington State is HB 1618. And HB 1618 deals specifically with expanding the prohibition of weapons at certain areas, which would include at elected officials or appointed officials, offices, facilities, subject to limited exemptions for the law enforcement officers and security personnel, and for further purposes. And then if you read into the further purposes, it also will make it so that you cannot carry a weapon within 200 feet of elected officials' homes, which basically would make it so that about 27% of all Washington land, you would not be able to carry or have a weapon on you, including even if you had a concealed permit. So that's HB 1618. HB 1630 is the establishment of restrictions on the possession of weapons in certain locations, to include outside of any public land. Now, what does that mean by public land? Well, public land includes things like your parks. Okay, so what they're saying is you can't carry a weapon on parks. Well, the reason that this law is so shady is because the way that they have it written, it just says public lands and it doesn't specify what the public lands are. And so does that mean that we're not going to be able to hunt? That's a question that a lot of hunters are asking right now. And then the third law, which is HB or House Bill 1705-2021-2022, is the concerning ghost guns and completely banning ghost guns, which we've heard about in the federal Senate and federal House of Representatives, what they believe ghost guns are. Ghost guns are essentially guns that are printed on a 3D printer. They don't have a serial number to track them. And they're really also guns that can be cut out by laser printers to build yourself. And they're trying to completely ban them in Washington State. The funny thing about this is that 90% of the ghost guns that we see actually out on, like, being confiscated are by criminals.
Sorry.
Do we really think that criminals are just going to stop
folks
bringing weapons?
Oh, sorry.
Hi, Eddie.
Hey,
how are
sorry.
you? I was just filling in time and talking while we had them at lunch.
Thank you very much. Sorry, folks.
How about everything with your stepdad?
Oh, he's good. He's good. He's 87, and, he just wants to talk a million miles at a time.
I know that feeling.
But he's a 100% disabled veteran. And so that's why I'm up here. This is my mom's property. And so it's basically my property too. And he tells me, he's like, look, you know what, you're gonna own this house when I'm gone, so you do whatever you want up here. So I moved up here just so he's not alone, because we're in the middle of nowhere in the mountains, and we get snowed in for 3 weeks at a time. So it's better for me to be up here with him than for him to be alone. Whew. Sorry.
Yeah, I would say that's probably true, so that he's not having to deal with all that snow on his own.
Yeah, so I've been shoveling snow for him. I've been we live in Yosemite, like right on the border of it. So we have trouble with the bark beetle. They've been killing all our trees. So we probably have like 500-600 trees at least on our 5 or 4 acres, and I'd say about 50% of them have died, and they're all just falling over. So right now I've been going through the property, taking the trees that are falling over, chopping them up, putting them into a pile, and burning them up. So, because otherwise, during the summer here in California, we have wildfires. And I don't want our nice property being burnt to the ground. So,
yeah, that is it's probably a good idea.
Right?
So, We were just talking about the gun laws that they're trying to pass here in Washington State and how nondescript the gun laws are and how it could potentially restrict people from carrying guns on any public land. How do you feel about that?
I mean, it's public land. It's our land. I think if I have a gun permit, I should be able to carry that gun wherever the heck I want. You know, except, I mean, you don't want to go into a court or, I mean, a jail or a courthouse, you know, I mean, within reason, but yeah, no, I think that's wrong.
Yeah. Well, one of the bills that they have, HB 1680, specifically says public land, but it's nondescript.
Mm-hmm.
And part of the issue that people are having with this is, will it restrict Washington's hunting land? And will we still be able to hunt and therefore provide for our family?
Uh-oh. Did I cut out or did your internet cut out? Uh-oh. Can you guys hear me? Just curious if it's me or if that is, unfortunately, the lovely Miss Kate. Is it me or Kate, guys? Let me know. Let me know. Ah, that's the way down there. I was going to show you guys what it looks like outside my house right now. I guess I can take a picture. Actually, I took a video the other day. Well, anyways, I think it's Kate, right? Can you guys still hear me? You hear me? Cool. Then it's Kate. Well, not cool, but you know what I mean. So let me see. See, this is what our property looks like. Oh, wait, never mind. So here, you guys can kind of see what my property looks like. This is what I'm dealing with. I'm trying to burn some of the wood in the wood piles. There's my St. Bernard, Donnie J. Trump.
Hello.
There she is.
Sorry, I'm not sure what happened. I just got disconnected somehow.
It happens. It happens. So yeah.
Probably had too many screens opened on my.
Don't we all?
iPad all at once.
Don't we all? Oh my gosh. Only Mr. Blow's blaming it on your kids.
Well, I mean, it could be them. No, they could be all on the internet at the same time. Who knows?
Oh yeah, that's what I missed. So right before I sold my house, so I was getting gig internet service, right? And then I move up here in the mountains, and my stepdad's internet is like it's 5 megabits per second, right? So going from gigabit speed internet to 5 gigabits per second is awful. So luckily, so you have a live view, right?
Yes.
You know how they tell you that the live view will not work for incoming, it can only go outwards on their modems?
Yes.
So don't tell anybody, but my AT&T one goes both ways. So I'm using my AT&T modem from my live view to do this.
Weird.
Yeah, because I have Verizon, and I bought a modem for Verizon, and they said it's unlimited data, right? And I'm like, great. So I paid extra money for this modem. I paid extra monthly fee. And within 1 week of watching TV and doing my show, they dropped me down from 5G to 3G. And on 3G, you can't even get any kind of video. So, I mean, because they regulate it. They don't tell you that it's once you hit a certain level, then they drop you down. So thank God for the live view.
Yeah, I would say that's kind of some BS written in that, fine print.
Yeah, it's that real fine print, But,
Yeah. I mean, we want to talk about fine print. We could look at a lot of the stuff going on in this country and you're, looking, where's the asterisk,
Right. Because this is you know what it is, but folks, this is a live view modem. So what it is, I have two modems. This one's Verizon, and the modem I have hooked up to my MacBook. And that's the other thing. So I tried hooking it up to like a router, but they don't make one that works with it well. But if you have an iMac, you can turn your iMac into a wireless router. So my iMac is also my wireless router, which is really cool. But yeah, you just put the two modems in there, and it's, connect it to your RMTP server, and turn it on, and there you go. And I just bought this new toy. This is a yellow box. So what I can do with this is I can plug in three different video sources and send out whatever signal I want to my live view. So I can't wait to play with this at the Trump rally.
I'm excited for you to go to the Trump rally, but I think I'm more excited actually to go see what's going on at the border because I used to live in Texas. And I would go down to the border all the time and actually be able to like witness what was really happening, which was pretty critical when they were trying to say we were locking children in cages and stuff. And I found out that was a whole load of bull. But I'm excited to see what the border looks like now, just even, you know, a year and a half after moving from Texas to Washington.
Yes. So from what I understand, BCP is definitely considering meeting me down there because he asked about my hotel room. So I think he might be staying with me if he does. But for sure, Tara from Polish American Brotherhood, she's going to go with me. Who else? My buddy Ty. We're going to have a whole bunch of people going. So it's going to be very interesting. And like I've been to the border. Do you know who Ben Bergquam is?
Yeah.
All right, so Ben is who got me started doing this. I used to edit all of his videos. So one day we're going down to San Diego for an event for the Angel Moms. And then Paloma for Trump was like, hey, let's go to the border. I hear there's some action going on. So we went out to the beach and we got there. And Paloma for Trump, she's this short little Hispanic lady. And she always wears like 6-inch heels. And she's pushing me in my wheelchair, you know, over the sand. And then finally Ben's like, I'll take over. So Ben drugged me a mile in the sand to get me to the border. And it was great because we're filming there and there's people just lifting up the chain link fence and going right underneath it, you know, right on the beach.
Well, when we used to live in Texas, there was a manhole that if you went to at about 10 o'clock at night, you could literally just see people pouring out of the manhole. Like any given time between 10 and like 3:30, 4 o'clock in the morning, you could stand there and just like take pictures, and it would be by the end of the day, by the end of the evening, you'd have, you know, 250 to 350 people who had came through that manhole. And it was because the sewer line pipe was disconnected because it was like they implemented a new sewer line. So it was just like an empty pipe that went underground, and they dug into the pipe from Mexico into the U.S. and then use that to get across the border. And I was like, why hasn't this been filled or taken care of? And you go to the city meetings and they tell you, oh, because of like health concerns, we can't actually fill it. We have to keep it like free flowing. I'm like, well, it's free flowing, that's for sure. It's free flowing a bunch of illegal immigrants across the border.
Was it like Arachnophobia? Have you seen that movie where all the spiders are just like coming out of a hole?
It was more like a slow trickle of people. So like, you know, it would go like 25, 30 minutes, and then you'd see like a little family of like 3 or 4 people come out, and then it'd be like, you know, an hour and a half later or something. But there were some nights where it was just like one after another, after another, after another. Wow. And there was a guy by the name of Daniel Frentinknick. I can't ever say his last name right, so I just call him Danny F. But he used to go down and stream at the manhole, and it would just, and you'd have police officers driving by, but they'd say, well, that's for Border Patrol. Well, why isn't a Border Patrol agent out here? We don't have enough Border Patrol to come out to the city center. So Border Patrol's over at the border dealing with what's going on at the border. And this is, you know, basically being just used.
Right. Now, I used to listen to this guy named Michael Savage. You know, I know he's a little way out there sometimes. But one point that he always made about California is he says, you know, all of our illegal immigrants, you know, they don't have health insurance. So what do? They go to the hospital in the ERs and they abuse the ER money, and then they don't pay their bills. And that's why when you go to the ER, you're paying 3 times what you should because you're paying for all these people that never pay for the ER. He said, how about this? Why don't you go stick a officer in or a Border Patrol agent inside the ER and check everybody's citizenship at the ER.
Oh yeah.
He said, you save billions of dollars a year. Take that money to get new Border Patrol officers and put them at the gate and keep these people out.
So in El Paso, they had one private hospital and then they had one public hospital. So it was run by the state.
Mm-hmm.
And the state-run hospital, if you went to the emergency room at any time, I don't care if it's like 7 o'clock in the morning, 4 in the afternoon, 2 in the morning, it didn't matter what time you went. It was always packed. Like there was a line out the door. You would wait 4 or 5 hours. And then you'd go to the private hospital, and the private hospital actually like turned people away.
Mm-hmm.
I don't know if they're allowed to really do that, but they did. And so you could get in and get seen really quickly. Well, then they also had these things called emergency pop-up rooms, which were basically like these little tiny tents that they would just pop up for, things that were emergency, but you didn't need an MRI or an X-ray or something. Like you needed stitches or, you needed fluids for vomiting or whatever, that you could go to those emergency pop-up rooms. And then if you needed to go to an actual hospital, they would transport you.
Mm-hmm.
Well, the illegal immigrants found out that if you go to an emergency pop-up room with certain ailments, they'll put you in an ambulance and transport you to the emergency room, and you get priority at the emergency room. And so then when they started to learn that, it was like, you can't go anywhere to get any health care at all. Like, because it's so overwhelmed.
Oh yeah, it's just disgusting, And I mean, like Gavin Newsom right now, his new budget, he added in, so every illegal alien in California will now have free healthcare. But yet, somebody who's going through college trying to work their ass off to get an education that can no longer be under their parents' help is sitting there working at McDonald's and they can't afford health insurance. But yet these illegal aliens can come in and just get it right away. It's disgusting.
Yeah, well, and this was something that I actually talked with a couple of people down in El Paso about. So, I'm military, my husband's military, so we have military health coverage, which is horrific. Everybody says, oh, it's great, it's wonderful. No, it's not. You have to wait 6 to 8 weeks for approval for a referral. Sometimes it's 3 months out for any appointments. When I had to go to see a gastroenterologist, I had to wait 9 months to get in to see a gastro, and then they ended up sending me off post to a different gastro, which was another 2.5 months of waiting. But the insurance that these illegal immigrants get, they literally can go into an emergency room, not pay anything, and be seen for everything. They don't have to have referrals. They don't have to live by the same standards. And so they're getting treated faster than people who pay for their insurance or people who receive their insurance, through their employees. It's crazy.
Right. It's disgusting, And I mean, I could just go on and on. Real quick, though, before I forget. So in El Paso, did you ever go to Chico's Tacos?
Yes.
I've never had them. I hear they're the best. Are they the best tacos?
They're pretty good, but the street tacos are probably better. So we have a lot of taco trucks, and there's one section off of Zaragoza in El Paso that had 9 taco trucks every single night would come to, and those taco trucks were definitely,
oh yeah,
they were really good.
I'm very picky about my taco trucks. I live in California, so we have, we're not I don't like Tex-Mex, all that corn, all that, extra vegetables in your tacos. I don't want vegetables in my tacos. I want meat. I want chicken. You know what I mean? So
yeah,
I'm very picky about my tacos and stuff like that. But
they had some street tacos from some of the taco trucks that were the homemade tortilla shell. I'm not talking about store-bought. I'm talking about you see them making it right there with the dough. Mm-hmm. And then it was beef, cilantro, and onion, and then this drizzle of this spicy kind of salsa. I don't know what it was called. It was topa pica or something like that. But oh my goodness, I could eat 300 of those in one sitting.
Oh yeah. When I do move to Texas, that's the one thing I'm gonna miss is my taco trucks. I used to do live shows, and I'm like, hey, I'm gonna go to my taco truck, and I did it one time, right? Next thing you know, every night people are like, Eddie, can we go to the taco truck with you? Because they make me a quesadilla, but my plate, it would be bigger than this plate, right? I mean, a huge quesadilla with chicken and the right salt, the perfect salsa and sour cream, and just, oh my goodness.
You won't miss it in Texas if you live closer to the border because they have a gazillion taco trucks there. And you'll find some good ones. Some of them a little shady, but typically you can tell the shady ones when you go up to it, and so you're like, probably gonna get food poisoning or diphtheria from that. So I don't think I'm gonna pass.
Yeah, right. Oh yeah. We have some of those in Madera too. You know, some bad ones. But I don't know. I'm just, you can tell I'm fat. I love food, so I like trying stuff out.
Deep fried corn was another thing that was really popular in El Paso that you could get at like a little truck as well.
Really?
And that is some interesting stuff. It basically makes like popcorn on the cob, but it's battered. So when you bite into it, it's like you have the breaded outside that's like made with cornmeal. And then you have like popcorn on the inside, and they sprinkle cinnamon and sugar over it. Oh my goodness. It's like a heart attack on a stick of deliciousness.
That sounds good. Actually, you know, we so as I'm getting older, more and more foods are because of my disability, I can't have anymore. And corn is one of those. And I loved it when I was younger. You know, I lived in a neighborhood where you'd have a guy walking around with a shopping cart and a little horn, and you hear him coming, you knew he was bringing you elote locos. I don't know if you know what that is, but basically it's corn on the cob, and they put, don't judge, but they put mayonnaise on there. You don't taste the mayonnaise, so don't judge. And they put chili powder and some cheese on there, and it's delicious. I can't have it anymore.
I've actually had it, and I would say that it's not my favorite thing, but it's not terrible. It's not my favorite.
Well, of course, you know, every food is, you know, to each their own, but
yeah.
You know, like, I'm not a big fan of tamales. Tamales are bland to me, you know?
It depends on who cooks them.
Well, that's true.
Because you get a good real tamale, and I'm talking about like, you know, it melts in your mouth kind of tamale.
See, I'm more of a fan of Salvadorian food, like bistec salvadoreño. What that is, it's steak, right? But they're cut really thin, and they come in like a tomato sauce. You know, not like an Italian. You know, I'm not talking pizza sauce. It's just got some tomatoes in there, bell peppers. You know, all the good stuff. Oh yeah, that's good. And then you get your beans. You always got to get queso fresco. If you don't know what queso fresco is, you got to put queso fresco in your beans. Good stuff. Now I'm hungry again. I just had a burger too.
I'm always hungry. I'm one of those people who's like a bottomless pit.
I used to. You're young. Just a heads up. It will come back to get you. It will come back to get you. Unless you have really good metabolism, which I don't anymore. Yeah, each food is acquired taste. Yeah, exactly, Eric. Exactly. But I love wherever I go. I always try and like when I went to Austin when it was the first day where you didn't have to wear a mask. I'm like, I gotta go to Texas, and Austin's the best place because those damn liberals are gonna be bitching. I went to Franklin's Barbecue. Oh, that was really good. I got a beef rib. It's like this big. Only problem is for a beef rib, brisket, and one other meat, it was like $50. It was expensive. That's like a one.
You know what's also really awesome about Texas is that you can go straight to the cow farms and order your meat from the farm.
I didn't know that.
And
you can do that?
Oh, yeah, you can. You can order what's called like a quarter or a half or a full cow. And so it'll give you like the ground beef, the ribs, you name it, like every type of steak cut that you can imagine in this box. And it's enough to feed like my family for like 6 months. Half or a quarter of the price of what you get at the grocery store.
Oh yeah, because I have property. I was talking to my sister about it because my sister's an ag teacher, and she told me, she's like, honestly, she's like, it's cheaper just to buy from the butcher because by the time you pay all the food to feed it, you go out and you have to slaughter it and pay somebody to cut it up and render it, and she said it wasn't worth it. And I was all excited. I'm like, I'm gonna get this cow. I'm gonna name it Dinner. Get a pig and call her Bacon. Although, yeah. I have one of my subscribers, Willow. She actually raises her own pigs, and they slaughter their own pigs. And
I have a friend. She owns Gypsy Farms in North Carolina. If you're from North Carolina, go check out Gypsy Farms.
I'll have to
I
tell
can send
Trump's
you a,
uncle. He's from North Carolina, and he
yeah.
loves bacon and meat.
Well, she does all of that stuff. So she raises pigs, chickens, and I want to say like sheep or something like that. Maybe it's goats.
Yeah. Oh,
For
yeah.
goat milk.
So Trade for Trump, Willow and Trade, they're the ones that do it. They said all you got to do is stop by, and they'll hook you up some. Or no, they'll sell it to you. What farm is he talking about? Trade, what farm are you talking about? He says they do it in Washington too. But he's near Portland side of Washington, so. And you're way over there. You're all the way up there in closer to Seattle area. So.
Yeah, I mean, there's some farms that are close by that I can go to get meat, but it's not the same as in Texas. In Texas, it's way cheaper than it is here in Washington. And I think part of that, if you guys didn't know this or not, but in Washington State, they implemented a law last year, which will be going into effect in July of this year. So it was passed last year. It's going into effect in July of this year. And what it will do is it's going to start taxing per cow head a methane tax, basically. And it comes out to like $2.50 a month per cow head that a farm has for methane gas. And that includes dairy farms as well as beef cattle farms.
Can we put a tax on AOC and Nancy Pelosi for all the hot air that comes out of their mouth?
I would love to. You know? Could we just tell AOC and Nancy Pelosi that they're no longer allowed to speak on behalf of the United States of America and the people of the United States of America? Right. We the people demand that you step down and stop talking. We're censoring you.
Oh my gosh, yeah. That or the other thing that this is going to affect you and I. So apparently in 2022, you're going to have to start reporting your Cash App. Anytime somebody sends you a Cash App, anytime somebody sends you a Venmo. Is that BS? Because think about it. Let's say your roommates. The whole point of Cash App is like, or if we go to dinner and we want to split the bill, I can Cash App you the $20, right? But if we go to dinner every single night, then I'm gonna have to start paying taxes because you just wanted to pay me by Cash App. I think that's BS.
Well, it's not exactly. So that's kind of a misdemeanor about how the law is implemented. It is anything over $600 that they have to report. So. If you receive a $49.99 payment, Cash App isn't going to pay that, put that towards like the tax forms that they are going to be required to report to the IRS. It's if you're making larger payments. So like, let's say you collect your rent through Cash App and it's a $700 payment that you receive. Well, then Cash App is going to have to report that $700 payment.
I gotcha. Because the research I did said that even if you do 600 $1 transactions, it's still going to go on there. That's what they said. But I could have got a wrong website too.
If you actually look at the text of the bill, and this is where a lot of misinformation comes from, and I always warn people, I'm like, even if it's a source that you trust that's Republican, you need to go to the text of the bill, not what people are spewing out of their mouths or writing in a meme. Because the actual text of the bill is anything above $599.99, so essentially $600, right?
I got you.
And the reason they're doing that is because they found that people who are, getting their money from Cash App, PayPal, that kind of stuff, they're not reporting those or claiming those. Now, there is a caveat within the bill for that, and that's if you receive more than $10,000 in one of those given things. So let's say Cash App, you receive a whole bunch of $50 payments. It allots to $10,000. Then at that point, the total amount would be reported. And that's why people are saying, well, okay, I'm going to just, step away if I'm doing business transactions with Cash App, Venmo, PayPal, and all of these different things. Now, why do you think this is? There's two parts to why they're doing this. First off, they want to tax you, and they want to make sure they're taxing any income, even if it's under the table babysitting income. The second part is that it's a competitor. Cash App, Venmo, and PayPal have become a competitor against the federal banks.
Okay.
And So they're trying to eliminate transactions through these, applications, because if you're not doing it through the federal banks, then the federal banks aren't receiving the transaction funds, and it's going to make banks obsolete. And you're already kind of seeing that as well. And so, it's a double-edged sword. But why do you think people want to back the federal banks when the federal banks have done nothing for us? It's because the federal banks are the ones that loan the money to all of these major corporations. And not only do they loan the money to all the major corporations, but they are scummy as all get out.
Oh, yeah. Just so you know, Trey was asking for how to follow you, so I just put in your Discord link, and I also put in your twitch.tv Kate Speaks. That's how you can hear Kate for all your information on Washington. Yeah. And you don't just do Washington, though, right? You do, like, national, you're like the C-SPAN of Twitch, right, basically?
Yeah, so I cover a lot of the federal Senate and House hearings, debates on the House and Senate floor, court hearings within the Supreme Court, and then some of the more, well-known court hearings. I sometimes cover those as well. I focus a lot on the Pacific Northwest, so bills and laws that are going through the Pacific Northwest. I pretty much know everything that's going on in California, Oregon, Washington, Idaho, and Nevada. I'm trying to reach out and it sounds like they're going back.
Are they going back? Oh, by the way, real quick. Hey, did I miss any good speeches? Like, was there any more Let's Go Brandons or any of those?
There was 3 Let's Go Brandons total, which cracked me up.
Yeah, I loved it. Right on. All right, well, then I'm going to go back to it, folks. Are they starting or no?
Yes, it looks like they are, at least on my Zoom end. So.
All right, and you're 2 minutes ahead of me, so let me hit refresh. Yeah. All right, guys, well, we're going to get back to this, and you know what the next break we're going to do? Dawn Break always loves me showing my video from Portland in August when Mr. Bill and I and Preacher and Villain, everybody was there, so I'll show that video later on. Whole bunch of bombs exploding. Antifa getting chased. We like seeing that stuff, right? Let's see. Who's doing a roundtable discussion tonight? Ethan Allen? All right, guys. Well, thank you, Kate. I appreciate you getting on here and telling the truth and explaining everything to everybody. Yeah, she's muted already. All right, guys. She's probably in her Zoom meeting already, so let's see what happens. So I'm glad we're back. Sorry I was gone when it went to break, but thank you to Kate for doing an amazing job of keeping you guys going. Yeah, I keep hitting refresh and it's not doing it. All right, you know what? How about this? Until I see them on, how about this? You guys want to watch this video with me? Here we go.
Okay, sorry. The Zoom isn't starting for another 5 minutes for you guys, but my end is a little bit faster than your guys' end. So you have about 6 to 7 minutes to kill. Just wanted to let you know.
I got a 5-minute video from Portland I'll play then.
Okay.
Right on.
But I have to go because they're going to do a roll call and discuss when I'll be talking. So.
All right. I can't wait to hear you talk. Thank you, Kate. Thank you for helping us out.
Yep.
All right, guys. Here we go. We're going to show you this video. For those of you that aren't normally on my channel all the time, you guys probably haven't seen this video. So I'm going to show it to you right now. Let me get me the heck out of here. All right. Let's hit play.
We're willing to take the heat. You fucked around and you found out today, baby. That's our message.
Just so you know, all this footage is footage that I took from my scooter. This is my footage. Nobody else can get you this.
Days from now, I might be
arrested. In fact, there's Portland Andy.
I'll tell you this.
Villain is in here. I think this is Villain right here, isn't it?
To defend ourselves, our families, and our fucking freedom in America, we're going to do it. We're going to lay our lives down. For what is right, for what is
true. If you guys want to see this video, I'll include the link right here.
We'll be out here if the cops won't do it.
If you want to watch this on your own.
We are. Hey, we're willing to take the heat. You fucked around and you found out today, baby. That's our message to you, Antifa. The Americans are coming out, and we're sick and tired of this shit. And if we have to fight fire with fire, we're gonna fucking do it. Fuck Antifa.
And this song, my good friend Mr. Nice Guy made this song for us. So you're gonna like the song. Hey Janet. Look how close this stuff's going off to. So I couldn't see his face.
Nowadays everybody got some problems. Seems like the whole world has stopped revolving. Look, nice guy here, I'm a problem solver. Come sit next to me, we can chat it all up. But if you got some personal,
I would have never imagined in my lifetime that this would be happening on American streets.
because I'm getting sicker. All of you hypocrite, it's FAFO, and go down and find out. No, this ain't no change, I'll catch a different time now. Get you with a left and the right hook, lights out. Should've stayed inside and kept your eyes down. Instead, you came outside with your signs out. Screaming,
no, we'll do it tonight, God. There you go, we'll do it tonight, bud.
I won't cover my mouth, that just come in my house. Take some pictures with a Bible and his doctors lying down. You're in my house now, and no Biden is a clown. 100% of the reason our lives are upside down. Wake them up, shake them up, come on, let it all out. Lock them all up for treason, put Trump back in the house. You got a problem, yo, I'll solve it. Check out that hook, yo. If you got a problem, yo, I'll solve it. Hey, check out that hook. If you got a problem, yo, I'll solve it. Hey, check out that hook. If you got a problem, yo, I'll solve it. Hey, check out that hook. What? Stand back, stand by, but be ready. Because the problems are getting heavy, it's getting messy. The Lord is watching, the end is coming, the temple's building. That building's burning, Jews persecuted, the kids ain't learning. We cover their faces in places with no trace of contamination. We're facing the George Soros occupation. We're ouchies waiting for Fauci patience, solving all the problems with a shot of Satan. There's no debating what this crisis was created by the same evil people that want to take our nation. The Lord is our Savior. Do yourself a favor, help a stranger out, and don't forget to love thy neighbor. I love the haters and the agitators. Antifa and BLM, you are all in danger. A whole nother species, they give me heebie-jeebies. A gang of Hishis, getting sheep to chop off their pee-pee. You got a problem, yo, I'll solve it. FAFO, hey, check out that hook, yo. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. What?
Everything I see is from the left wing, not from the right wing. What are you saying? I'm willing to do anything I want to see. Let's do it, sir. Say it. Do it. Say it. You want to call it? What do you want to do? Give me white supremacist and I'd like me to get that.
This is what Chuck Schumer and Nancy Pelosi say never happens. Well, I was there. I know it happens. Right, David? That tow truck almost hit me, too.
If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook, yo. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. If you got a problem, yo, I'll solve it. FAFO, hey, check out that hook. What?
Stand back and stand by.
Let's see. Oh, looks like they're back, guys. Oh, no, they're still waiting.
I don't know if you know this.
The sound's on. I haven't heard him yet, so, all right. Here, one last one. I'm going to show you. You guys want to know who Eddie is? Here's Eddie. I was, if you don't know, for those of you that are new here, I was the very last person on Capitol grounds on January 6th. I guess I should say private citizen. I was the very last private citizen. Dude, they don't even freaking show my... Look, I type in the exact name of my video and I can't even find it. Is that a bunch of BS? That tells you how much YouTube censors my videos. I gotta go over here to my YouTube studio. I gotta search my own comment and type in cops are here. What the heck? Did they delete my video? Did they delete my video? Don't tell me they deleted it. No. It was a live video. Dashboard. Don't tell me they deleted my video. There we are. Here we go. So if you don't believe me, this is my video, folks. The cops just...
We need to move, bro.
Okay.
Yeah. Just go ahead and roll up to there. We're gonna help you get down.
All right. Here we go. Wait, hold on. Let's see. Guys, I'm not going to go in tomorrow, hopefully home. I got a plane ticket waiting for me.
Hey, can you walk down the stairs?
Very little.
We need to move, bro.
Okay.
Yeah. Just go ahead and roll up to there. We're gonna
Look at all the freaking, look at the line of just cops all the way along there, right? They don't have an elevator around the Capitol? Oh, it's downloaded it. I have it downloaded. About 5 guys carried me up. I got backups. Huh? I stayed behind. They didn't leave me behind. Your guys are the ones that based me like 3 or 4 times. Or whatever the hell that shit was.
Nothing I can do? Nothing I can do for you?
No, I got it. Oh shit.
You alright?
Yeah.
You alright?
Yeah. So instead of letting me go down an elevator, they forced me to go down a set of stairs. Okay? Okay? Yeah? It's not shit. It's my scooter.
Listen, man. I got shit thrown at me today.
Yeah, I've been maced and or whatever the fuck you guys are spraying me too, so. Well, yeah, you guys don't fuck with Black Lives Matter and Antifa. Well, that doesn't have to give me an attitude, you know? Still talking shit to the cops. Yeah, I did.
Right there. Let's just drop right over there.
I did have to come up here because I'm an American. You're not acting like it right now. Dude, if you could read the comments, they're saying, Eddie, don't talk back to the cops. Eddie, just shut up. Like, no, it's my right to talk shit to them. Anyways, all right, let's check on it. Let's see. Are they done yet? They're still on the same thing. Nobody's talking yet. Oh, wait. Oh, sorry. My bad. I guess I had to hit. Why did they make you play? I've had the thing going the whole time. Why are you making me hit play again? You guys suck. Sorry.
Of this rulemaking was to implement ESHB 1551 and was limited to such, with the exception of editorial changes as needed. 1551 expressly outlines the board's authority to adopt rules on several topics. However, it's important to note that many of these rulemaking authorities had already existed. Some were expanded, changed, or moved to a new section of statute. Specifically, 1551 outlined the board's authority and duty to adopt rules and establish or define the items listed on the current slide. So for example, the board's authority includes specifying reporting requirements and procedures for STI investigations or contact tracing. STI case investigations are a public health function which aims to prevent reinfection of a person and reduce the population prevalence of STIs in the community. These services also connect those who test positive or may have been exposed to a condition to healthcare services. There are certainly opportunities for future discussion around how this broad chapter rule could be revised. However, the proposed rule we are presenting today was narrowly scoped to implement 1551. Next slide. Thank you. So this flowchart outlines the rulemaking process and timeline for this work. Board staff filed the CR 101 and began work in July 2020 and worked throughout the fall and spring into 2021 developing draft revisions. In June 2021, an informal draft was distributed for informal comment. Staff also held a listen and learn session, offering an opportunity for folks to hear more about the rule and provide feedback in real time. A second informal draft was distributed in August 2021, incorporating revisions from feedback heard during the June comment period. Following that comment period, staff made additional revisions, and the CR 102 was filed on October 6th, with the formal written comment period running through October 28th. The board held a public hearing on this rule in November 2021, and based on comments received at that hearing, The board directed staff to continue engagement with interested parties in December 2021. So today we're on the orange square with a continuance of the formal rules hearing. Thanks so much, Sam. Back to you. Thanks, Kate. Next slide, please.
Yes, hello. You guys called me, but
So just as a review, the proposed rule includes revisions to a number of sections of Chapter 246-100 WAC. Generally, throughout the rule, editorial revisions were made for clarification and to improve the usability of this rule. This includes updating definitions to be consistent with recently adopted updates to the notifiable conditions chapter and changes in the statute. The proposed rule also removes gendered language and uses people first language where appropriate, for example, using the terminology person living with HIV. The proposed rule also includes updating references to WAC and RCW as necessary. Throughout the process, staff identified a number of outdated references that needed to be amended. The proposed rule also replaces specific references of HIV with bloodborne pathogen where appropriate and where is required by statute. Additionally, references to pre and post-test counseling and training for HIV testing were removed. The statute ES HB 1551 removed these requirements. The proposed rule also includes clarifying provisions related to the use of identifying information for persons living with HIV. More specifically, changes to WAC 246-100-036 were made to clarify revisions related to, I just said that, sorry, in order to align with the statute. We also proposed changes to WAC 246-100-070, which requires orders issued by a local health officer to be enforced, to clarify that refusing to obey a health order related to a sexually transmitted infection is a gross misdemeanor. This aligns with the statute that Kate described earlier. Next slide, please. The proposed rule also proposes revising the effective length of written health orders related to sexually transmitted infections from a maximum of 3 months to 12 months as required by 1551. It also includes establishing and clarifying the criteria for what constitutes a substantial exposure and possible risk of transmission of a bloodborne pathogen in the following settings: occupational settings as identified in rule, local jail facilities, and Washington State Department of Corrections facilities. The proposed rule also utilizes tables to increase the usability of the rule. Throughout this process, we heard from a lot of members of the community that parts of the rule were quite confusing to follow. So we've incorporated tables to make it more clear when certain provisions apply and when they do not.
No problem.
I also want to note that there is a new section in the proposed rule, WAC 246-100-2031, and staff recommend including this to improve the usability of the rule. However, the content and process described in that section are not new and currently exist under WAC 246-100-203. That section of the chapter is quite lengthy and caused a lot of confusion among our partners. So splitting that in two makes it more clear which provisions apply to which particular situations.
I just asked it.
The proposed rule also updates as required by statute WAC 246-100-204, which defines significant risk as it relates to HIV infectious status for employment purposes. The statute also includes hepatitis C there. So the proposed rule includes amending to also include hepatitis C.
Sure.
Next slide, please.
Oh, that's no problem. I can walk a little bit, so I don't need an issue.
So as Kate mentioned, the board held a formal rules hearing on this work in November, and we heard from many of our community partners that there was a need to continue dialogue and possibly consider additional revisions to the proposed rule. So over that time, next slide, please. Sorry.
Okay, thank you so much.
So since that time, staff have held 2 additional listening sessions in early December of 2021 for an opportunity to receive additional comment and identify themes of feedback that we're hearing throughout the community. We then circulated a new informal draft for review and comment in mid-December. An additional comment was received. So now I'm going to talk through some additional recommended revisions to the proposed rule that staff are recommending for the board's consideration.
Do you know who the sheriff Mark?
Next slide, please.
I don't know if he's your sheriff, but in Pinal, do you know the sheriff Mark Lamb of
So based on the additional feedback received
I have to interview him, so I'm probably going to be getting there a little bit
at the November rules hearing and feedback we heard during the formal comment period, staff are recommending the following revisions to the proposed rule. Amend instances of and or to read in list form and include the phrase any combination of these. As I noted earlier, there are many instances within the rule as currently written that were confusing for our community partners to understand when certain provisions apply. So we hope that this improves clarity. The proposed rule did miss a few instances that we recommend the board amend to this format. Staff also recommend removing in the citations you see in the second bullet references to exposures resulting in fluid in the eyes. This language is repetitive as those same sections reference transmission through exposure to mucous membranes, which includes the eye. We also recommend clarifying in WAC 246-100-203 that behaviors endangering the public health related to sexually transmitted infections is not applicable in certain scenarios. When the individual is not infectious and conduct is not sufficient to transmit infection. Currently, the rule includes such language and the submission was a drafting error. When the individual is exposed is on pre-exposure prophylaxis for HIV, this would ensure that those individuals in consensual relationships where one partner is living with HIV and the other is taking pre-exposure prophylaxis, where there is minimal risk of transmission, that those folks are not subject to health orders as such behaviors do not present a risk to the public's health. Next slide, please. Additionally, staff are recommending editorial changes to existing definitions to remove stigmatizing language. During our feedback sessions in early December, we heard that there is terminology used throughout the rule and broadly in state law and rule that can be perceived as stigmatizing by the community. And if there's opportunity to amend that, to remove that stigmatizing language, we hope to do so. So staff are recommending minor editorial changes to some existing definitions where we were able to make those amendments. We also recommend including a new definition for practical means to prevent transmission to clarify for purposes of Section 203 when certain provisions are not applicable. This definition exists in statute and we are mirroring that definition and helps to clarify for folks that when an individual is taking for example, antiretrovirals and are undetectable for HIV, that they are not potentially subject to certain health officer actions as they are unlikely to transmit HIV. We also recommend clarifying under WAC 246-100, excuse me, 021, the responsibilities and duties of healthcare providers. That instruction for disease control is provided in a culturally and linguistically appropriate manner. And we heard from our community partners that it's really important to stress throughout the rule that healthcare providers and others are speaking to folks in ways that make sense for them based on their cultural and language identifiers. We also recommend, based on feedback from local health and providers, that healthcare providers communicate prevention methods when they treat patients with a diagnosed STI. And we also, as I mentioned before, are recommending including a definition for practical means to prevent transmission. And we would clarify in WAC 246-100-203 that behaviors endangering the public health does not include when practical means to prevent transmission are taken in the context of a sexually transmitted infection. Next slide, please. Lastly, we recommend clarifying that a cease and desist order for sexually transmitted infections requires a local health officer to document a pattern of behavior, not a single instance of a specific behavior as defined in rule. And we also recommend striking language in 246-100-2031 that is repetitive and changes the standard for when a detention order may be issued. Specific language is available in track changes in tab 9I. And at this time, we are happy to answer any questions that board members may have regarding the proposed rule or the recommended revisions we just walked through.
This is not.
Board members, we'll take maybe one or two questions, and then I'd like to
This is not a hippie chick. That's Kate, who was just speaking on our channel.
If there are any additional questions, we could take that afterwards. So any immediate questions for Dr. Lutz, Samantha, or Kate?
Steve Kutz with just a quick question. Those proposed changes that you had there, did you implement that in the proposed language that you went through on your slides?
So the recommended revisions was kind of second set of
maybe that's not Kate.
Changes that I just discussed are additional revisions that staff are recommending that the board discuss and adopt today. They were not included in the proposed rule as filed in the CR 102.
Thank you.
So Sam and Dr. Lutz, I just wanted to ask two questions based on themes that we heard
Oh, I'm sorry, that's
during
not Kate.
public comment earlier. There are concerns that the isolation and quarantine language in 040 that this update doesn't address was added for today. Is it true that that section has been in place in code since about 2003?
Yeah, so WAC 246-100, 040, and 045 have been, were adopted in 2003 and have not been amended since that time. And they're not open for consideration today.
Thank you, Sam. And Dr. Lutz, this one's for you as a health officer. Section 040 says that if a health officer issues an order for isolation or quarantine, that in order to take someone against their will, it actually has to go in front of a superior court judge via a hearing before, so that both the person who's positive or needs to quarantine and the health officer both get to plead their cases to a judge, and only a superior court judge can order someone into quarantine against their will or isolation. Is that correct?
Yeah, thank you, Chair. Yes, you're absolutely correct. I mean, it follows due process. And so I think any concerns that this would not follow due process is laid out very clearly by statutes.
And then one more question. I've asked around, and I'm sure you have too, but are you aware of any instance that Section 040 has been used other than for a disease like tuberculosis?
You know, Chair, I mean, to the best of my knowledge, no.
All right, thank you. Yeah, I'm not aware of any either. So with that, we are going to next go to public hearing. Oh, Dr. Kwong-Get, go ahead.
I just wanted to make a quick comment. First, to thank Dr. Lutz and Board of Health staff for their work on this important issue. And it just struck me that it's so ironic that the intent of House Bill 1551, which was to remove stigma of people with HIV/AIDS, removing stigma is such an important part of healing past inequities, and the misinformation that was spread that DOH was informed about really spread division, and so I feel bad for that. Well, I feel bad that the misinformation, distracted from the intent of this House Bill 1551, and also feel bad for the people who were so unnecessarily suffered stress from the misinformation they received on this bill. So. I'm really proud that the Board of Health was so responsive to community input, and I hope that we can see less of the divisive misinformation that we saw today. Thanks.
Thank you. I believe we have a list of pre-registered people who would like to testify today, so we'll get to that in just a moment. Any other individuals who would like to testify, if we have time, you certainly can put your request in the Q&A box. We will give everybody, again, this is a continuation of a hearing that we started in November, where we took public testimony, and we have included on our website written testimony that we've received during this. And due to our time constraints today, we're also going to hold testimony to 1 minute. Just like before, Nathan will call people's names and unmute them. And then once you start speaking, you'll have 1 minute to make your comments. And at 1 minute, when your time is up, you'll be muted so that we can go on to the next person. We'll get as many people in as we can, as this is a public hearing. Hopefully people understand the clarifications that were just announced. And with that, I'm going to go ahead and read a brief script into the record, and then we'll begin public testimony. This is a public hearing on a proposed update to Chapter 246, 100 WAC to help prevent the spread of COVID-19 and promote social distancing measures, and to ensure the health and safety of all people attending this meeting. This hearing is being held online using the Zoom webinar.
It's being held online so you can cut their
without
comments
a
off.
physical public meeting space. We ask for your patience again as we attempt to use different resources to provide opportunity for public input. Again, the purpose of this continued hearing is to obtain additional public testimony limited to the proposed changes to Chapter 246 100 WAC, communicable and other certain diseases. The proposed rules were filed as WSR 21-20-127 on October 5th, 2021. This hearing is being held on January 12th, 2021 at approximately 12:52 p.m. or 1:52 p.m., excuse me, in accordance with the Administrative Procedures Act, Chapter 34.05 RCW. A copy of the proposed rules available on the board's website under today's meeting materials. This hearing is being recorded. Again, each person will have 1 minute after you begin speaking. Nathan will call your name and unmute you, and then you will need to unmute yourself, just as before. And again, we want to get as many people who want to testify as possible, so please be brief and concise with your comments. So with that, Nathan, will you please call our first public testimony?
Yes, thank you, Keith. All right. First individual will be Mark Garrett. Mark Garrett, please give me 1 second, and I'll give you the ability to unmute your microphone. Okay, Mark Garrett, you should be able to unmute your microphone. Mark Garrett, are you available to unmute your microphone and provide your public comment?
Yes, took a while for that button to appear over here. Hello, thank you for hearing my testimony. My name is Mark Garrett. I'm an HIV advocate, and I work part-time as a peer navigator in the HIV program at Spokane Regional Health District. This legislation and these proposed rule changes have taken over 7 years to accomplish. And I think we should all be proud of where we've come to. We're 1,000% better in language than we were before. Sorry, I'm getting some feedback. My question that I have tried to answer for over a decade,
yeah, we miss Kate,
from persons living with HIV is, do I need to disclose my HIV status even though I am virally undetectable due to adherence to HIV treatment and incapable of transmitting HIV sexually as per CDC and Washington State DOH guidelines? And I'd like you to consider that question as we move forward in.
And thank you, Mark. I'm sorry we ran out of time. I'll go on to the next individual here, and that will be Claire Brosman. Claire, give me 1 moment, and I'll let you have the ability to unmute yourself. After Claire, I'll move on to Dale Brees. 1 moment here, Claire. Okay, Claire Brosman, you should be able to unmute your microphone.
Hello.
Hi, Claire. We can hear you. Thank you.
Unfortunately, I was unable to hear all of the testimonies and everything that went on, but it seems like the outcome of the meeting has been pretty positive. And basically, that is my testimony. I hope that the Board of Health will not create strict rules or mandates around vaccine for children, having vaccines, and that is my main concern. Thank you.
Okay, thank you, Claire. I'll now move on to the next individual. That will be Dale Brees, and then after Dale, I will call on Scott Bertany. Dale, give me one moment here in just a second. Okay, Dale Brees, you should be able to unmute your microphone.
Yeah, hi, everybody. Can you hear me?
Yes, thank you, Dale.
And hi, Board of Health and all support staff that have been so integral with getting us these new written draft modernization rules regarding HIV. My name is Dale Brees, Spokane County resident, 36-year HIV advocate, and I also work as a peer navigator at Spokane Regional Health District. I will be personally and professionally representing these new potential rules within the state and moving ahead. A couple things really quickly about some challenging norms HIV is giving. About the undetectable status now. Is it considered infectious then? HIV in the language of the rules. Also realize, just FYI, that the Office of Infectious Disease has limits with budgets that is limiting HIV medications on Apple Health formulary. So does the system decision become a defense for an HIV person on a public health order? But these rules overall and HIV exceptionalization, the felonization.
Okay, thank you, Dale. Sorry, we'll move on to the next individual. Give me 1 second to see who's next, and that will be Scott Bertany. After Scott Bertany, I will call on Deborah Barrel. Scott, give me one moment here in just a second, and I'll let you know when you're ready. Okay, Scott Bertany, you should be able to unmute your microphone.
Yeah, hey, I am Scott Bertany and the Director of Advocacy for Health HIV and also a member of the Washington HIV Justice Alliance, which is a community coalition that's formed in response to implementation of the governor's End AIDS Washington strategy. And I would like to echo my colleagues' comments as well, but would also like to thank the State Board of Health for their thoughtful approach, really to incorporating community input into the administrative rules that affect individuals under ESHB 1551. So I've submitted written comments to your email in the interest of time so more community members can be heard. Thanks.
Okay, all right. Thank you, Scott. I will now move on to the next individual, and that will be Deborah Barrel. After Deborah Barrel, I will call on Beth Rohr. Deborah, give me one moment here, and I will let you know when. All right, Deborah Barrel, you should be able to unmute your microphone.
Hello there. Yeah, I actually spoke to you earlier about the COVID vaccine mandate and was not really
Hi, Eddie.
thinking about anything about HIV/AIDS.
How are
but
you?
I would like to say that I would love to get rid of this
I
executive
did my little
emergency
tiny
executive
spiel
order.
and was cut off
It
at
is
about 4
stifling
minutes
the rights
in
of
and
the
told that I had to wrap it up.
This is
Oh man,
gone
well,
a
okay,
little bit
after
too
this, can
far,
you do your 20-minute speech for
and
us?
I am sure hoping
Yeah, I can.
very
You want me?
soon. And I
Please.
also wanted to
Because they said that they're running too
that,
far behind schedule, and
in
so we all
the
had to cut down our
experimental vaccine, it
presentations.
has
Okay,
graphene
sorry,
oxide as the
I
main
had it
ingredient,
on his
which is an
website, but it didn't
industrial
start
weapon.
playing automatically, so that's what screwed us over. So we
Thank
missed
you.
you.
Oh, it's okay.
But you're coming back on again in a few minutes, right, or sometime in this portion?
Yeah, so I'll be speaking in the public comment section again because I signed up for public comment and they said that I would get a slot. So
And I believe
whenever they call
Christine
my name
already
for the
was
public comment
explaining
portion.
is,
All right,
Christine
perfect.
Reynolds.
Thank
So
you.
just a heads up.
It sounds like the majority of
Beth,
the
give me
people are
1 moment
talking
here.
about the HIV rules, and I'm like, you know that they're also editing the other rules as well, and why aren't we talking about
Beth
that? But
Rohr, you should be able to unmute your
Because
microphone.
they only care about not having to tell people that they have HIV so they can get everybody else to have HIV like them.
yeah, infectious diseases. Well, and the way that they're changing the rules is it doesn't just apply to
Beth
HIV,
Rohr, are you
it
available to unmute your
applies to
microphone
any
and provide your
bloodborne pathogen or virus. So anything that can be spread through blood,
not hearing anything from
and
Beth
you
at
all
the
know that
moment.
COVID is
I will
transmissible
move on
through
to our
blood.
next
I don't know if you
individual
knew that
here.
or not, but
I honestly didn't know.
And that
yeah,
is going to be
COVID's transmissible
Christine
through any fluids.
Reynolds.
So tears,
Christine, 1 moment here.
saliva, blood,
Okay,
all of that you
Christine
can
Reynolds,
transmit COVID
you
through.
should be able to unmute your microphone here.
Okay. How
So
long is
when
this
they
supposed to
say
be going
this,
today?
it was supposed to only go till 3 o'clock, but now it's looking like it's probably going to go closer until 5.
Okay. Okay, good to know.
So, anyways, I'm here in the background. I'll let you know if they decide that they're going to pass me or not. But I'm pretty irritated that I only got like 5 minutes when I was supposed to be able to talk for up to 20. So that was fun.
Yeah, it's BS. Well, because you're conservative.
After Ernest Quinn,
pretty much.
Nelson.
All right. Well, thank you.
All right,
I'm going to
talk
go
to you
back
soon.
to these guys then so they can hear what these people are saying then.
All right, sounds good.
Thank you.
Bye.
Okay, Ernest Quinn, you should be able to unmute your microphone.
Oh. Derek, can you hear me?
Yes, we can hear you, Ernest. Thank you.
All right. So I'd like to ask as...
Whoa. Sorry, folks. I'm turning it off until that goes away. There you go.
Have we not released any information as far as these vaccines go to the public? That everybody's being so transparent about these vaccines for adults or children, which have you. Shouldn't we be able to know what we're taking and putting into our bodies? It is a person's right to know what's going on, not being told that you're just doing it because we know what's best.
Ernest, excuse me. Do you have comment for the public hearing related to WAC 246-100, control of communicable diseases? We're not talking about vaccines right now.
Well, are we not talking about
Oh my gosh, I hate when they do that.
part of the COVID as well? Is that not correct?
Loosely. So, okay, go ahead, proceed.
That's right, bitch.
So, all of this is pertaining, from HIV.
Come on.
Granted, our government has done great strides preventing HIV for people, which is huge. But they're not being very transparent with other vaccines. I won't mention the number, but everybody knows that we're not getting the full facts. And we would love to see that from you. And why are we not getting that?
It's called full disclosure, folks.
That's all I have for you.
Okay, thank you, Ernest. We'll now move on to our next individual, and that will be Aaron Nelson. And then after Aaron Nelson, I will call on Ramon Anders, or excuse me, Yumi Colombo. Ramon Anders is no longer in the attendee list. So first Aaron Nelson and then Yumi Colombo. Give me 1 second, Aaron.
You ever watch Judge Judy and she says, you know how I know a teenager's lying?
Aaron
Because their
Nelson,
mouth
you
is
should
moving?
be able to unmute your microphone.
Same thing for politicians.
Yes. What I hear from all this testimony earlier today and just now is that there's a clear lack of trust between the Department of Health and the citizens of Washington. When HIV, hepatitis, tuberculosis, meningitis, whatever, COVID, it doesn't matter what the issue is. It's how we treat those people. We should learn from our mistakes when we came with from the HIV scenarios back in the 80s, 90s. We need to prevent that from happening again in the future. I think that if we were to spend some time, develop some trust with the public so that when these meetings do happen, stuff can actually get done effectively instead of preventing people from having their opinions heard and or the information that comes from the board, whether it's believed or not. Lack of transparency equals a lack of trust. Lack of trust, nothing will get done. I'll yield the rest of my time.
Okay, thank you, Aaron. I'll move on to our next individual, and that will be Yumi Colombo. After Yumi Colombo, I will call on David Hall. Give me 1 second here, Yumi, and I'll let you know when you are ready.
One. See, he just lied.
Okay, Yumi Colombo, you should be able to unmute your microphone. Yumi Colombo, are you with us to be able to unmute your microphone? Okay, I'm not hearing from Yumi. I'll now move on to David Hall. Following David Hall, I will call on Pat Knight. Give me 1 second here, David, and I will let you know when you are ready. Okay, David Hall, you should be able to unmute your microphone.
Yeah, thank you. I'm not sure how I got on this one. I wanted to speak regarding item 11. Will I be allowed to? Can you hear me?
Yes, I can hear you, David. I initially say that we had you signed up for our rules testimony for communicable disease.
Yeah, I just wanted to say adding immunizations to childcare and school entry is required to be FDA approved. Pfizer has 2 of them. One is emergency use authorized only. The other, Comirnaty, is fully approved under the FDA. However, Comirnaty is not being manufactured. That's per the CDC. So my question is, why is the board discussing adding a COVID-19 vax as a requirement to enter school and daycare when there is no FDA approved one available? That doesn't make sense. This is serious business. These children have a 99.99% chance, even though we're not statistics, of being just fine fighting off COVID themselves, and we're going to give them something that barely has any history. So just think about it, please, even though I know you guys have already made up your minds, probably.
Okay, thank you, David. I will now move on to our next individual. It should be Pat Knight. After Pat Knight, I see Jody Wilk. Give me just 1 second, Pat Knight. And I believe your display name is under P. Knighton. Okay, Pat Knight, you should be able to unmute your microphone. Pat Knight, are you able to unmute your microphone? Again, your display name is P. Knighton. Okay, I'm not hearing from Pat Knight, so I'll move on to our next individual, and that will be Jody Wilk. After Jody Wilk, I will call on Terry Cooper. Give me 1 moment here, Jody, and I'll let you know when you are ready. Okay, Jody Wilk, you should be able to unmute your microphone.
Okay, I'm unmuted. Can you hear me?
Yes, Jody, thank you.
Okay. I do want to express my support for the HIV community, and I appreciate the Department of Health doing everything they can to destigmatize those who are living with AIDS. I wish you would take the same approach to those who have COVID and the way that COVID is being dealt with in the community. I think it's extremely harmful, the stigmatization of whether people are vaccinated or unvaccinated. That should be a private health situation.
Thank
There
you.
should not be a mandate demanding that people get vaccinated. And just as there is laws against people who have AIDS to be tested in order to be able to work a job, there should be no testing of this required for people in regard to COVID either. You should not have any of your promotions or employment under risk. I mean, both hepatitis C and HIV there.
Okay, and thank you, Jody. I'm sorry, we'll be moving on to our next individual here, and that will be Terry Cooper. After Terry Cooper, we'll call on Leah Ford. Give me one moment here, Terry, and I'll let you know when you're ready. Okay, Terry Cooper, you should be able to unmute your microphone.
Yes, so this is Terry Cooper. I signed on to testify today because when this notice came out, and I think where this information came from that you're talking about earlier, is because it just listed all of the WACs that you would be discussing today. And of course, it's clear now you're talking about this House bill that affected the HIV language, and I appreciate the work that's been done there. I agree with the prior person speaking that, you know, while we're trying to destigmatize in some areas, we're stigmatizing here, and I think that's what people are upset about. The thing that was concerning about O4O, since you did open the door about that, even though it's been around since 2003, it was alarming to me that one single health official has the authority to actually take control. And Dr. Lutz, you might remember that there was a man in Spokane who was arrested under your authority and taken to jail and did see a Superior Court judge, and it caused quite an outcry. So you might remember that that actually did happen. I think that legislation needs to take a look at O4O.
Thank you, Terry. I will now move on to our next individual, and that will be Leah Ford. Following Leah Ford, I will move on to Crystal Henderson. Give me 1 second here, Leah. Okay, Leah Ford, you should be able to unmute your microphone. And Leah Ford, are you available to unmute your microphone and provide your testimony?
Donald Trump don't trust China. China is asshole.
Not hearing Leah Ford come through. I will now move on to our next individual. That will be Crystal Henderson. And then following Crystal Henderson, I will call on Philip Chapman. Give me one moment here, Crystal, and I'll let you know when you're ready. Okay, Crystal Henderson, you should be able to unmute your microphone. Crystal Henderson, are you available to provide your public testimony? I think you should be able to unmute your microphone.
This is not Crystal Henderson. I think you asked the wrong person to unmute.
Oh, my apologies. I think I might have a little glitch here. I'm not heard from Crystal. I'll move on to our next individual. My apologies for that. And it looks like we will have Philip Chapman. After Philip Chapman, I'll call on Price Paramore. One moment here. Okay, Philip Chapman, you should be able to unmute your microphone. Philip Chapman, you should be able to unmute your microphone. I think your display name shows your email. I'm not sure if you're here. And not hearing anything from Philip Chapman. I'll move on to our next individual, and that will be Price Paramore. And then after Price Paramore, I will call on Megan Reck. Give me one moment here, Price. Okay. Price Paramore, you should be able to unmute your microphone.
All right, can you hear me?
Yes, Price, thank you.
All right, well, thank you for this opportunity. Price Paramore, I'm a professional in the medical industry and a parent of 5. What I wanted to speak today was about the risk versus the reward. Obviously, COVID is a risk, but for our young children, it's not a risk as it is for older demographics. From 0 to 17, there's only been 1,000 deaths, and per the studies, most of those had pre-existing conditions, and that is for a population of 73 million for 0 to 17. However, the reward is not satisfactory. According to the VAERS of the October 21 report from the CDC, there was 611,000. Yes.
Price, excuse me, we're doing a formal rules hearing for the HIV exceptionalization updates.
Mm-hmm.
It sounds like you're talking COVID vaccine again, and this isn't a COVID vaccine hearing.
Yeah, and I was thought I was supposed to be for the other one, but in regards to the rules, that I have significant issues with providing authorities to public health officials for detainments and things like that nature. And this would go along the lines with the COVID incidences. We need to let the police do the policing and let the public health officials do the policing of the public health. If I can finish my statement on the vaccine, if you permit me to. So of those instances, 590,000 were COVID vaccines reports. And out of those, there was over 5,000 deaths. So there's not a real reward for us to vaccinate our young people. And I hope that you would consider both of these measures, both the vaccinations and the public health. And please just consider the other angles. That's all I have. Thank you for your time.
Okay.
Thank you, Price. Again, for our audience, this is a formal hearing. We're taking testimony on an update to Chapter 246-100 regarding the updating of that rule pursuant to House Bill 1551, which is specific to HIV exceptionalization. This is not a rules hearing or open public comment regarding other topics. So if our audience could please, if you want to provide formal public comment, it should be related to this rule update and the rule update only. Thank you.
Okay, thank you, Keith. Move on to Megan Reck. After Megan Reck, I will call on Kathleen Fitzpatrick. 1 second, Megan, I'll let you know when you are ready. Okay, Megan Reck, you should be able to unmute your microphone.
Yep, thank you. Okay, I got my emotions in check this time. So on the stigmatism on HIV, yes, I agree. It should be less. People shouldn't be so prone to hate towards HIV. Yes, there should be more studies to it. Yes, I agree with that. On the note, if you're going to be bringing in the vaccines, like the stigmatism and bringing it down on HIV, same thing should be with vaccines of COVID. It should be a choice of matter. Yes, it is your personal right to choose who you choose, to tell what you have and what you don't have on both sides. It is a matter of choice, and our choice as the United States people has been taken away and given to the authority of health advisors of yourself, and our voices are muted, obviously over Zoom, because we can't come to you face to face like normal people should and tell you our own voice without you telling us to be shut down and everything's canceled over one person not wearing a mask because you're so scared of a man-made thing. So sorry, not sorry.
Thank you, Megan.
I love her.
Move on to our next individual, and that will be Kathleen Fitzpatrick. And then after Kathleen, we will have Eric Pratt. Give me 1 second here, Kathleen. Okay. Kathleen Fitzpatrick, You should be able to unmute your microphone here.
Yes, you hear me okay?
Yes, thank you, Kathleen.
You're cutting out a little, but okay, basically I had signed up to comment on earlier issues. And I think part of the problem you're having with comments at this time is because that's what most people are prepared to talk about. But people really want to see, and when you see a word like internment coming up on the screen, people panic, understandably. So I think ahead of these meetings, you should always post that this does not, to the effect that statements for this or any other meeting is not covering action toward a requirement of vaccines for children to be able to enter school, and is not covering quarantine camps, quarantine internments, because people need to know that. But my concern is we never find out how many people have survived who had COVID. We never find out how many people who are hospitalized.
Okay, thank you, Kathleen. I will now move on to our next individual, and that should be Eric Pratt. After Eric Pratt, my list, the rest of the people are not currently in the attendee list, Chrissy, so I'll just let you know. I will now, Eric, give me just 1 second.
Brian Truman, you'll be next on the list.
And it looks like actually Eric Pratt is actually no longer on the attendee list. He was earlier, but I do not see Eric Pratt. I think we can continue with your list that you have, Christy.
Yeah, Nathan, can you allow Brian Truman to speak? And then after that, it'll be Jennifer Adriatica.
Yes, absolutely. Give me 1 second here, Brian. Okay, Brian Truman, you should be able to unmute your microphone.
Thanks. So I would like to say the stigmatizing of anybody, be they HIV, COVID, or otherwise, vaxxed, unvaxxed, is none of your business. You should have nothing to say about it. Your business is to govern some of the general health rules, and that is it. Taking people away, whether they have some sort of STD or COVID, putting them in a camp, not your place. And you will have to deal with the consequences if you continue to do stuff like this. Those whack codes should not even be on the books. That's it.
Thank you, Brian. Nathan, can you unmute Jennifer Adriatica? And the next on the list will be J.E. Calderon.
Yes, 1 moment here, Jennifer. Okay, Jennifer Adriatica, you should be able to unmute your microphone.
Thank you very much. I'm a doctor of psychology living in Pierce County, and my testimony relates to the overarching issues that are on everyone's mind here, which is that Operation Adam and its directed evolution call into question the agenda contained here in this proposal. The fundamental underpinning of any reputable scientific experiment is informed consent. Without this foundation stone, the ability to call it science is negated and is rather called medical tyranny. The epidemiological data thus far presented by the Department of Health has been patently false, hence voiding any basis for this proposal. There's overwhelming evidence-based, peer-reviewed studies supporting the gene-altering nature of what is being touted as a vaccine, post-changing the definition. It is at a minimum legal and medical malfeasance.
Okay, thank you, Jennifer. I will now, Christy, could you remind me?
Yes, it's J.E. Calderon is up next. After that, it is Laura Gabriel.
And for Calderon, is that C-A-L?
C-A-L-D-E-R.
Okay, thank you. My apologies. J.E. Calderon, you should be able to unmute your microphone now.
Hi, HIV and SARS-CoV-2 have at least one thing in common: Anthony Fauci. Why is that important? Only man-made material can be patented. SARS-CoV-2 has a HIV glycoprotein patented by Anthony Fauci. Material made from nature is not allowed to have a patent. My point is, Anthony Fauci cannot be trusted. The CDC is a private entity and not a lawmaking organization. Thank you.
Thank you.
All right, Laura Gabriel, you should be allowed to unmute yourself now. And Gordon Haggerty is up next.
Hello, can you hear me?
Yes.
I'm a registered nurse with 16 years of experience. I believe the health department should never have the authority under any circumstance to enforce involuntary treatment or medication for any communicable disease. This is unconstitutional abuse of power by unelected health officials, and the authority over children under 18 for any medical treatment belongs to parents. I support Agenda Item 11, the petition to keep EQA products off the school schedule. And as a nurse, I oppose COVID shots being added to the school schedule because they do not meet your 9 criteria for approval. There are 4 issues that board members and parents need to understand about these shots for kids. 1, do they work for more than a few months? No. 2, are they necessary for kids? No.
Okay, thank you. We can move on to our next individual. I think that was Gordon Haggerty. Is that correct, Christy?
Yes, that's correct.
Okay, Gordon, you should be able to unmute your microphone.
I'll just say Teresa Huffer is next.
Gordon Haggerty, you should be able to unmute your microphone.
Can you hear me now?
Yes, Gordon, thank you.
All right. Thank you for this opportunity. My name is Gordon Haggerty, and I previously submitted written testimony, but I want to follow up on your remarks about Section 040 regarding enforced detention and quarantining. And I'm wondering if and why this section is needed and if it should be deleted from the WAC. I think that would eliminate a lot of concerns. And in light of the recent use of the health emergency to implement draconian and abusive shutdowns and mandates, it's not only unreasonable to assume that such provisions would be used, but also that, and with the due process provisions, they might not also be suspended for the sake of emergency circumstances. History itself has not proved to be a good precedent for laws like this, and I strongly urge that this.
Okay, thank you, Gordon.
Teresa Huffer is next, Huffer. After that, it's Dana Nelson.
Hi there, thank you. So what I would like to say is what I've heard from before, the stigmatization, whether it be a COVID or HIV, there is a stigma with the unvaccinated people, and unvaxxed lives matter, okay? Unvaxxed lives matter. People are losing their jobs over this. We talk about our healthcare industry being exhausted and overwhelmed. Well, we've fired half of our healthcare people, nurses, doctors, respiratory therapists, firefighters, policemen, all have lost their jobs, and we wonder why we're in the state that we're in. This is my body, not your choice. Insurance companies are no longer paying for people's testing.
Okay, next up is Dana Nelson.
Okay, Dana, you should be able to unmute your microphone now.
And Linda Redmond is next.
Hi, yes, can you hear me?
Yes,
thank you.
My name is Dana Nelson. I'm calling because I do not agree with the fact that you guys have something that you're ruling on that would give health authorities the ability to come and take somebody from their home because you felt like they were not quarantining on their own. And my biggest question is that you guys didn't really mention if you're adding COVID-19 to this list of communicable diseases. And if that is something you guys will be doing, is coming and taking people because you don't feel like they're quarantining or whatnot. And I would also like to comment on the fact that the schools are causing great division among our children. I don't think you guys even understand the effect it's having. My kids are scared in school for people to know that they're.
Okay, thank you.
Nathan?
Yeah.
Christy? we're just going to take 2 more comments because none of the comments are about the hearing and about the revisions to
Stop being a fucking dictator and let the people speak.
So we'll take 2 more comments. Hope that one of them is actually on subject.
Stupid dictator.
And then we'll close this part of the meeting for today so that we can get to the other rule petition and some of our other business. Thank you.
Thank you, Chair Grellner. The next up is Linda Redman. After that, Kelsey Quinlan.
Okay, Linda Redman, you should be able to unmute your microphone now.
Hello, can you hear me?
Yes, Linda, thank you.
Okay, I will start my comment related to the HIV concern. I want to point out that our state constitution, the preamble, has God in there, supreme. We are thankful to the supreme ruler of the universe, and that relates to winning the revolution. We don't have rule of English and the Church of England. So I want to say that I think we should say birth gender and not bring other terms in there, because that would be more in alignment with God, and so it would be constitutional. So for that language, that wording. And then I want to say there's powerful forces, economic forces related to the hospital, pharmaceutical industries in our state. And I want you guys to stand up and create a holistic health department that's completely separate from the Department of Health that we have, so that they can do their own research, they can educate.
And they cut her off.
And the last person is Kelsey Quinlan.
And Christy is Quinlan.
I don't see her on the list anymore.
Okay. And neither do I.
Chair Grellner?
All right, thank you. So this will conclude the public testimony section of today's continued hearing.
I thought they were going to let
communicable and other certain disease specific to HIV exceptionalism. Those who testified on this proposal will receive a summary of the comments. Thank you for participating in today's hearing. So with that, board members, any additional questions for Dr. Lutz or Samantha?
Again, Chair Grellner, I'm not able to open my video. I'm having intermittent issues there, re-signing on. I apologize. This is Tom Pendergrass. I actually am speaking in support of our adopting the rules as they were promoted regarding the clarification of language regarding HIV and destigmatizing it. I believe we've done a really good job at this and would urge that we proceed to approval.
Further comments from board members or a motion?
It's called kickbacks, Victory. Kickbacks.
Yeah, Steve Pitts here. There were some recommended changes that the staff were making, and I think we need to address those before we take any kind of action. Is that not correct, Keith?
I think Samantha went over those additional comments. Samantha, is that correct?
Yep. So we provided the overview of those recommended revisions, and the board has the option to include those, to direct us to include those when we file a final rule, if you all move into the direction of adopting the rule today.
Right. So I would like to make a motion to adopt those changes that were recommended by staff. Steve Pitts.
Can I expand that motion, please, to adopt the proposed revisions to Chapter 246-100 WAC, communicable and certain other diseases, as published in WSR 21-20-127, along with the revisions talked about today Furthermore, the board directs the staff to file a CR 103 order of adoption and establish the effective date. Is that okay with you, Steve?
Yeah, I was just trying to do it in a two-step process. That's all. That's fine.
We're not
Thanks.
doing the freaking
Steve, would
slide
you like
here,
to second
guys.
Tom's motion?
I will second that, yes.
All right, thank you. We have a motion and a second. Any further discussion? Hearing none. All members in favor of the motion on the table, please say aye.
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 Aye. Aye. Members opposed, please say nay. Members abstaining. Okay, that motion is passed. Thank you. I'd like to take a brief moment. We have another board member who's able to join us this afternoon. Temple, would you like to introduce yourself, please?
Sure. Hi, I'm Temple Lentz. I serve on the Clark County Council and on our local Board of Health, and I represent counties on the state board.
Thank you, Temple. Welcome. Happy to have you today. Next, we're going to skip number 10, and we're going to move right along to number 11, which is the rulemaking petition. And for that, Dr. Pendergrass, you and Samantha are up again.
It's because we're both so popular. The Administrative Procedures Act, RCW 34.05.330, allows any person to petition a state agency to request adoption, amendment, or repeal of any rule. Upon receipt of a petition, the agency has 60 days to either 1, deny the petition in writing, stating the reasons, and as appropriate, offer other means for addressing the concerns raised by the petitioner, or 2, accepting the petition and initiate rulemaking. On December 28th, 2021, the board received a petition from Xavier Figueroa, and Javier is a PhD. He filed on behalf of Informed Choice Washington, requesting new rules prohibiting the board from including certain products in Chapter 246-105 WAC, immunization of child care and school children for vaccine preventable diseases. The petition specifically requests that the board adopt rules that would prohibit any product with an emergency use authorization or any licensed product formulation which has not completed phase 3 clinical trials from inclusion in the rule. The petition states the board has convened a technical advisory group, which we've heard about, that he's concerned that the Food and Drug Administration is not licensed any of the COVID vaccines for 5 to 12-year-olds, and he believes that convening this tag without clarity of any risks is not a good thing. He has the petition has been presented. I hope everyone has read it. And at this point, I'm going to say we need to bring to the board this petition and a discussion of whether or not to initiate rulemaking.
Thank you, Tom. Board members, questions or comments? Well, Tom, I have one question for you or Samantha or maybe other board staff. Has the board ever adopted for inclusion on the school mandatory vaccine schedule a vaccine that is not fully approved, where it only has an EUA? Is there any history of the board ever having done that before? Do we know?
I'm pausing to let others respond. Sam?
Chair Krellner, to my knowledge, no, the board has not done that.
Chair Gellner, I actually think that's probably not totally correct, but it was a long time ago. Remember that the State Board of Health is the only board that was created by the Constitution of the state of Washington. That means we've been around since the late 1800s. We know that with the Salk and Sabin vaccines, that they were implemented for first voluntary, then required admission to schools in the 1950s. So the answer to the question strictly has to be, yes, it's been done in the past. One of the challenges, I think, is that we are no longer in that same era that we were in the 1950s, where a number of vaccine preventable diseases were taking lives of children of school age each year. I can remember, because I'm got those nice gray hairs, that when I grew up, every summer, parents were totally afraid to let their children go to swimming pools or any other gatherings in the summer for the fear of polio. I'm a little concerned, and so I'm going to say I do not support adopting this proposal, because I do not want to be in the setting where I am preventing some future event from occurring. I've been on the board long enough to know that the board cannot commit to future rules on management of water systems or of shellfish or other things for future boards. That is something we do on a regular basis. And in the episode, or in the instance of requirements for school entry, we have to, on an annual basis, update what are the recommendations from the Advisory Committee on Immunization Practice and the Center for Disease Control and Prevention, and we can only go to the current time in that regard. While I share the concern that we should be very much thoughtful, studious, and strict in our engagement in looking at any requirement for school entry. I think that this is one where they're asking for, or the petitioners are asking for us to make decisions for future boards that I don't support. So with that, since I really would love to hear more from other members to see whether or not they agree with this premise or not.
Members, comments?
Dr. Pendergrass, I do agree with your comments. I think the future is something we would be discussing as a board whenever it comes up, and cannot logically support something that is the unknown.
Thanks, Fran.
Yeah, this is Steve Kutz. You know, I don't know what process was run through back when I was in grade school, but I come from the time where I had to live through measles, and I still have nightmares and memories of that hard time that I had when I suffered through that disease. And when the vaccines became available, I'm not really sure after that, because I was in first grade. But I do know that this advisory board will be taking into consideration that this is not a fully recommended and licensed vaccine as part of their due diligence. So knowing that, I am not in favor of accepting this request either. So I'd like to make a motion that the board decline the petition to initiate rulemaking to prohibit certain products from inclusion in Chapter 246-105 WAC for the reasons articulated by board members, and direct staff to notify the requester of the board's decision.
Second.
Motion and a second on the table. Further discussion from board members.
I am very heartened and actually persuaded by many of the comments that were written and that we've heard today. I do agree that trust of government is an important component of what we do. I'm sorry to hear that so many believe that having a technical advisory committee that includes public members, professional members, members from schools, members from the school nurses organization is not a thoughtful body. I have worked with these
Can
before.
I go off?
I can tell you
Is
the
that
group
okay?
of people who are on this technical advisory committee
You want to go off
are
on people?
committed
Yeah,
to
you want to go
doing
off
the
on
best
people?
Can I
job
lose my shit
possible
for a minute with
by
you
looking
guys?
at what's available at the time.
Yeah, hold on. Let me turn it down
And
a little
I
bit.
can assure you that we're not going to bring a recommendation back to this board without having
Go
done
for it, Kate.
very careful
All right,
review.
so section 11, which is the one that they're discussing right now, we collected 250,000 signatures in 30 days for them to amend the rule for child age vaccinations. And this guy just basically said, we don't give a fuck about your 250,000 signatures that you guys collected. I collected signatures. Many other people in Washington State collected signatures. We did it in 30 days. We kicked ass. We got them all to them. They're like, okay, we're going to put you on the agenda. And then you want to close public comment for it and not allow for a single person to actually talk about what we are requesting. What we're asking is that you don't force homeschool students to get vaccinated, because that doesn't do anything. That you don't force children to receive an emergency use authorization vaccination. You don't force children to receive a vaccination that we don't have all of the information for and have informed consent for. And instead of opening up the freaking floodgates and allowing for people to express their concerns, what are they doing? They're tabling this shit and basically saying, fuck you, Washingtonians. We don't care what you have to say about your public health board, because we're going to make the rules and we're going to tell you what rules we're going to allow in, even though you collected 250,000 freaking signatures, even though we followed every single one of your steps, even though we took the time and the energy to write up the petition, to get the petition approved, to even collect the signatures. And all you're going to do is give us 5 minutes where 1 or 2 people get to talk about it from your freaking board that are all liberal pieces of shit. And then you're going to fucking turn around and be like, but we're going to close down public comment for this section so nobody can actually come and talk. Even though I'm a part of that fucking advisory board that he himself mentioned, even though I sat there through hours upon hours of freaking committee hearings with these people, and I made it very abundantly clear that this was a priority of the citizens of Washington State. And what does he do? He gets on his little soapbox for 2.5 fucking minutes and then says, okay, we're done. Motherfucker.
Can I just say one thing to that? Now do you know why they only did this on Zoom? Because if they close down that public comment right now, everybody would be screaming in that hall.
Sorry for going off.
No, you're fine. Hey, you have every right to. This is bullshit.
I have put
I
well
thought it's against
over
the law to close down public comment. I thought they have to allow it.
They allowed public comment in other sections during this hearing, and so therefore they don't have to allow for public comment on this particular section, even though I don't know if you heard, but over and over again they said, oh, I thought I was supposed to be signed up for section 11. I thought I was supposed to be signed up for section 11. They hear the heat and the passion and the power behind the people, and they don't want to hear it. They don't want to listen to it. They want to put ear mufflers on. And so what they do is they say, okay, well, actually, we're not going to accept any more public comments and close this shit down. I can't tell you how infuriating it is to me, because I spent over 100 hours and I volunteered for this public committee hearing, to be a part of this board advisory. And the guy keeps bringing up the advisory board. We listen to our community members. Do you know how many members of the community are on that advisory board who have said time and time again that this particular petition should be pushed through, that there should be allowed to be a discussion about it openly with the Board of Health? And guess what? They just told us to go fuck off.
Pretty much, yeah. I guess we know what all the rest of the comments on the other sections of this meeting are going to be about now.
Thank you.
We need to get people down there, Kate. You need to just get all of your people, get them down there, and even though they say it's a Zoom meeting, well, everybody be on your phones in front of that fucking building, and just when they won't let you comment, just start pounding on the fucking doors. Just be like, let us in, assholes, right? Sorry, Sugar.
You know, I tried my hardest. I did everything that I could friggin' do. You guys have no idea how much I've done for this flippin' hearing. I sat and I did a closed hearing on Monday and informed them of what I was going to be speaking about. I sat here, I signed up for the public comment section. I did all of the parts that I could do. I volunteered my time and my energy and have been through so many freaking Zoom meetings with these people. And for them to just basically give me the finger, it feels as if all of that time was wasted. And I know so many other people who are feeling that right now. I'm getting text messages on my phone. Are you fucking kidding me? I'm like, yeah, apparently this is how they're gonna rule on this shit. Like, I don't even normally cuss, but I'm so angry right now that like it's bubbling out of me.
Right. Welcome to communism. This is how it starts. That's why we got to stop them from doing this stuff. I hate to say it.
But also at the same time,
I'm not even a Washingtonian and I'm getting pissed right now.
The question that the petition raises and that have been raised by folks in the community.
Yeah, well, I'm a Washingtonian who advocates and stands up to our government every opportunity that I freaking have. And honestly, at this point in time, through all of them.
And I believe that the board has not made
and I gotta say one thing about Kate, guys. So Kate, I think Kate has double right to speak this way because number one, not only does she do all this work, not only is she an American, but her husband is in the military and serving for this country. And as a son of a veteran, it's not just a veteran that suffers, it's also their family members. So I consider family members as serving their country too because of what they give up for their family, their loved ones to go out there. Right?
Well, I have 6 reasons to be angry.
Yeah.
I have 6 beautiful children who are going to be impacted by these rules and these laws and what they pass in these hearings. And for them to come out and blatantly say and lie time and time again, you know, they push that whole HIV thing, but if you actually read it, it's about any communicable disease or bloodborne pathogen or virus. Guess what? COVID-19 is underneath that umbrella. Okay, so any rule that they write for the HIV, it goes and applies to communicable diseases and bloodborne pathogens and viruses. But they want to sit here and say, oh, it doesn't have to do with COVID. That's a load of bullshit, and you and I both know that. It's just that because COVID's not in the name, they can somehow skirt around that it doesn't have to do with COVID. This hearing, if it taught you guys anything, these motherfuckers are shady as shit. You know they're being paid out by somebody somewhere. And if we don't start standing up and we don't start getting good people elected, and I'm talking about regular, everyday people. I'm not talking about lifetime politicians. I'm not talking about politics, like people who are in politics right now. I'm talking about people like you and me. If we don't start getting people like you and me elected, you and me are going to be the ones that are suffering.
Right?
So if you guys, anybody who's listening right now, if you have the ability to run for office and represent the true people of the United States, not the super mega millionaires, not the corporations, not the politicians, not the people who have self-interest, but represent everyday Americans. Because sadly, as you can see time and time again with our government, federal-wise and state-wise and local-wise, they don't give a crap about everyday Americans. You're not even on their radar or their blimp.
I do know that there are sites being set up for people to quarantine. So for example,
oh my goodness, this is disparaging. I got to tell you, it's very disparaging to see this going on.
Sorry, I didn't mean to like completely go off on you. I was directing my
Hey,
comments toward others.
This is the perfect place, you know, because this shows how much you care about this, and this shows the people that are watching in other states that they need to watch out for this to come to their state, because it's going to happen in your state too, folks.
These other places.
And just because you live in a right-wing state doesn't mean that it's not happening through the snakes. You guys don't understand. This is on both sides of the political spectrum that we get this crap. And people think that they can hold on to the fact that they're in a conservative red state. Yeah, you may not get as much crap, but they still slide things in. And they still push things through that are going to impact you negatively. Please get involved, people. Like, it's time to stand up. It's time to wake up to what's really going on. Don't be woke, but wake the fuck up.
Right. Oh, and DC Services, I also got to thank you for your service, bud. I know you're a veteran, and I know you've gone through a lot, and thank you, too. Oh, man. I got a lot of editing to do on this one little freaking clip. This one little video here is going to take a lot of editing tonight.
Yeah.
Cutting out all these stupid idiot comments that these guys are doing.
I can tell you right now that our next hearing of our advisory board is going to be a fiery one. And I know I'm not supposed to stream it, but I might just stream it anyways and then tell them to all go F off afterwards.
Well, how about this? Why don't you just stream it to Discord, and then I can like erase your name on there, you know, or I'll blur your name out, and then I will stream it. And since I'm a journalist, I've worked for a radio station. I'll say, you know what? I don't have to give up my goddamn sources. Take me to jail. I'll stream it for you. That way you don't.
Please do. Because you guys, you don't understand what is even said behind closed doors. What's said behind closed doors, you think this stuff's bad. You should hear some of the stuff that was said behind the closed doors. I'm just saying.
Heck yeah, I'll make a private room where only you and I can go, and nobody can see who's in the room with me. And yeah, I'll stream it for you. I'll blur out. And don't worry, I'm gonna erase. I'm gonna hush this little speech out here in this part of the show because I can do that later on, still too on YouTube. So.
Anyways, well, I want to jump off and go and try to decompress for a few minutes because I feel like my blood pressure is really high.
Didn't they tell you could? They were like, oh yeah, you're going to speak. We put you on the list. A few minutes ago, you told me, Eddie, I'm going to speak on this motion, right?
Yes,
and then they're closing.
And then they decided to close down public comment because there were so many people who were wanting to speak on Section 11 and people were getting heated about Section 11. And so they just closed it down. They're like, we think it'd be a good idea to just close down public comment and have people email us instead. And they all agreed in their little chat bubble that I could see. And I was like, no, you have to leave public comment open and allow people to speak their minds or they're going to get pissed off. And what did they do? They closed it down.
Wow. I wish I could see your Zoom right now. I'd stream that thing. I don't care. I'm not shameless. I mean, I'm shameless. Whatever you want to say.
Yeah, you know, I did everything I could to get it out there. You know, I told everybody I knew, like, this hearing's happening. This is what's going on. I'm going to be talking. I'm signed up for the public comment section. Like, I pushed it as far as I could. You know, I'm only one person. But thank you, by the way, for streaming this and being there and, you know, supporting what's going on over here. I know it's not even your state, but thank you.
It's all our states, though. I mean, it's everywhere. That's all right. You can send some of your kids over to help me cut up some firewood later on. How about that? That's what I'm supposed to be doing
That
today.
sounds like a plan. It sounds like a plan. Solid one. I'll send my 14-year-old. He's been kind of moody lately, so maybe getting out in the backwoods would be good for him.
Heck yeah, send him on over.
Anyways, I appreciate you. I've got a baby crying, and my blood pressure right now, I think, is like through the roof. So I'm going to go try to decompress and breathe deeply.
All right, I understand. Thank you. Thank you for being here, Kate. Thank you.
Yeah, my pleasure.
See you tonight. Come into our show tonight because we'll be talking about this tonight, too.
Oh, I most certainly will.
Right on. All right, thank you, Kate.
Bye.
Bye.
Session started on Monday, and so having you all approve the changes to the legislative statement would be very helpful to the team here.
Why don't we go to that? And then we'll probably wrap up with board comments today, and we'll have to tackle those other two.
Oh, thank you for following us.
All right.
So Keith, can I say something real quick again? So they just popped something up here and I read it. And the state does have an isolation quarantine facility created for individuals who are not Washington State residents, but are traveling in our state and test positive for COVID-19 or have been exposed to someone who tests positive and do not have a residence or other location in which to spend their 10 to 14-day isolation quarantine period. So it's providing a place for them. Nobody says they're forcing them to go to it.
I wonder if they're talking to Arcade.
Thank you for that clarification. Okay, Michelle, go ahead.
That had to have been Arcade.
Board members, so each year or before each legislative session, we reach out to you all to ask you about the issues that we anticipate will be in front of the legislature. The board has a long-standing tradition of developing a statement of legislative issues, and that statement is a document that staff use to guide us as bills are introduced each legislative session. And I sent last year's legislative statement to you in November and asked for edits, and the one that is in the packet includes the edits. Also, I just wanted to give you a brief description of how the team uses this direction that is in the legislative statement. So each day during legislative session, new bills are introduced by legislators, and the staff will review those bills to see how they align with the legislative statement. We track those bills that may impact the board's statutory authority or that may require the board to take on new work. Or may otherwise impact our operations. And we review it against the statement that we have in front of you today, see how that fits with the priorities, and we make recommendations for potential action. That action may include things such as reaching out to legislative staff or legislators to identify potential concerns with the bill and how it's written. If there is a statement where the board clearly supports something, the staff will sign in support. If there's a place where the statement clearly indicates that we would oppose something, the staff would then convey that position to the legislature. From time to time, we do offer testimony to committees, and we coordinate that testimony and vet it with the chair for his approval before we deliver it. So that's generally our process. I just wanted to remind folks that this is a short legislative session, that it's a 60-day legislative session. There have been a large number of bills that were pre-filed in advance. And since we're in the second year of the biennium, any legislation that failed to pass during the 2021 legislative session is resurrected and is alive again and may proceed through the process. So we will be watching those bills that didn't pass last year and have been resurrected this first part of legislative session, as well as the bills that have been introduced on a daily basis. So I can just briefly describe some of the changes that we made to the statement. So under Local Board of Health Governance, we updated the statement to reflect last year's legislation that added non-elected official to local boards of health. And under Health Impact Reviews, we revised the statement to reflect our current Health Impact Review staffing. And we expanded the statement about the value of health impact reviews, clarifying the evidence and information used to complete health impact reviews. We updated the statement regarding preventing smoking and vaping to acknowledge the emergence of additives and compounds that may adversely impact health. We also updated the section on equity in state government to reflect funding for the Office of Equity and made editorial changes to the section regarding data disaggregation. With regard to school environmental health and safety, we recognized how the pandemic has further demonstrated the critical need for ongoing regular environmental public health and safety inspections. We added a statement for the need of adequate funding for inspections, assessment, and updates for ventilation systems. We think that's critically important in the time of a pandemic. Regarding the lead directive, we updated the statement to reflect recently passed legislation and made some minor clarifying statements. We also updated the section on opioids to reflect changes to the state's updated opioid overdose and response plan. We refined the section on food safety to reflect some anticipated legislation. We updated the access to healthcare section to reflect recent legislation and to retain the board's focus on maintaining affordable healthcare coverage. We added the section on shellfish sanitation in anticipation on legislation that was introduced last year related to crab that will require the board to adopt rules. And we also, based on board member request, added a section related to mental health services with a focus on diversifying workforce and assuring access to services for youth. So that's a quick summary of the changes. It's not a dramatic change to what we reviewed last year, but it does reflect the requests that you all made in terms of the legislative statement. Are there questions?
They wouldn't let her speak, only Mr. Bill. They closed down discussion for it.
I like this statement. It's in line with what we've had over the last couple of years, and it has served us well in the past, so it gives us a little flexibility, so I'm definitely supportive.
I also am supportive and would point out to the board a couple of things that we were prescient about. One, the whole issue around vaping has now developed a new wrinkle. The rules at the federal and state level talk about tobacco-related products going into vaping machines, vaping apparatus. We're now learning that our colleagues in the vaping world have said, well, okay, we can move right around that. We'll just go ahead and use chemically made nicotine and maintain the addiction by using nicotine malts or nicotine fluids in the vaping device. The way the words are written, we're asking that the consumer be made known what is in their vaping equipment and the vaping modules so that they know what they're getting into. And finally, I really am enthusiastic that this is a clearer statement than we've made in the past about the school health rules. As Michelle pointed out, we've learned that airflow, air exchanges in schools are important to health, not just from infectious disease, but for other reasons. And I'm really excited that we're once again going to the legislature and saying school health is an important part of our environmental commitment. Thank you.
Board member comments, or do we have a motion for Michelle?
I would make a motion. I would move that the board adopts the statement of policy on possible 2022 legislative issues as submitted on January 12th, 2022.
Second, Mrs. Temple.
Thank you. We have a motion and a second. Further discussion from board members? All right, hearing none, we'll call the question. All those in favor of adopting and approving the statement of the board on possible legislative issues for the 21-22 biennium, please say aye.
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 Aye. Opposed, please say nay. Members abstaining. All right, thank you. There you go, Michelle. So we'll work with you and staff and watch legislative happenings and respond as needed. So thank you for that.
Thank you, board members. The materials in your packet do include the policy related to the legislative statement. for your review. And just as a reminder, any time that the staff or a board member goes to address the legislature and speaks on behalf of the board, we need to report that as lobbying activity. And if ever there is a question of board members about those activities, please reach out to us and we'll provide any guidance you may need. Thank you.
And I'll just piggyback on that to state that board members, unless you're testifying and you notify Michelle and we're staying within that legislative statement, if you're testifying on anything else, you shouldn't be identifying yourself as a board member because we haven't, as a board, approved any other statements on other topics. So if you have questions, please check in with Michelle first. Okay, so with that.
Quick question, Keith.
Yes, Steve.
So I and wearing some of my other hats go into on a whole lot of things, supporting things, and I don't identify myself as a state board of health member. I identify myself on why I'm representing what I'm speaking on.
That's okay.
Okay.
So most of us have, yeah, most of us have multiple roles. So yeah, it's just when this only comes into play when we're going to identify ourselves as a state board of health member. All right, well, with that, I think, again, we are going to move item 7 and item 11 regarding 1, keeping of animals, and 2, oh, no, not 11, sorry. 10, sanitary control shellfish. We'll move that to our March meeting. And with that, we're at the agenda item number 13, which is board member comments before we go to adjournment. Board members, any comments? Tom.
I again want to say how indebted I am to our board staff in the hard work that they've done in a multitude of areas, from looking at how we create local health boards to what are we doing with getting together the technical advisory group to, oh my goodness, so many other things. I do.
All right, guys, you know what it sounds like? It sounds like they're just going into now to where they're just going to toot their own horn. It sounds like this thing is over. I hope you enjoyed watching this. You know, this is not my state. This is Kate's state. But on the same moment, it's if it happens in Washington, then it can happen where we are, right? We got to remember stuff like that, guys. You know what? And I'm not going to, you know, these guys aren't going to say anything that's going to get us going. They're just going to kiss their own ass, you know, like tout their freaking, you know, selves up. So I'm not going to show that. You will be at the flag wave in 5 minutes outside. Okay. Darn. Because I took off the whole day. I have I'm trying to pack and I got to wash clothes and get ready for my trip to Arizona tomorrow. Mr. Bill, as soon as it's live, I will I'll host you, okay? And then I can go up. I gotta go get the mail, stuff like that. So we'll show you know what? I'll keep it up. Why not? I'll keep it up for you, Mr. Bill. Anyways, I did love it when people came in and their name was Let's Go Brandon. That was enjoyable, right? That was definitely enjoyable. Yep, that's Raggy. That's exactly what it is. It's the pat on the back time. Oh, we did such a good job. We closed down comment because we know that Kate was going to come in here and just talk bad about us and tell us how stupid we are, because we know we're stupid, but we're getting paid. We're getting kickbacks, right? Oh, my goodness. You know what? I gotta hold on. I was showing Robert earlier. Is Robert back on? Common Sense Conservative. Is he back out there? Is there even anybody still there, Mr. Bill? Because Common Sense Conservative he live? Yeah, he's not live anymore. And he deleted the video from earlier, so I don't know what's going on with that. But yeah. Ugh. All right, well, since I'm waiting, I can show you guys this. I was actually going to talk about it later. I still might talk about it later on tonight. I don't know. Who knows? I'll grab the link real quick. So you know how I was talking about my mouth was itching because of the lettuce that I was eating? So I was looking it up. Well, you know, I can only stand hearing these people so much, so I try and do other things at the time. So it says, if raw fruits or veggies give you a tingly mouth, it's a real syndrome. Like, my mouth is still all tingling and stuff right now. If you've ever noticed an itchy or tingly sensation in your mouth after biting into a raw apple, carrot, banana, yeah, and I love bananas, and it happens with bananas, or any fruits and veggies listed here, read on. People who are, let's look at this list real quick. I want to see this list. Because my doctors have told me. So I have spinal bifida. One of the issues with spinal bifida, the biggest thing they say you're allergic to, like I'm allergic to latex and I'm allergic to avocados. They say you're allergic to avocados and avocados. The stuff in avocados are related to are what goes into latex. So that's why I'm allergic to latex. I've had over 60 operations, so I really love that because, you know, you got to starve before an operation, right? But because I was latex... Am I too low for you guys? You guys can't hear me, Digglewort? But anyway, so with my latex allergy, I have to be the very first one in the operating room every single day because they're afraid that maybe some latex gloves might get in there. So that was a great thing. But so they're saying trees, grasses. Yeah, I'm allergic to grass, and I'm allergic to certain weeds. Apple, I can't eat apple, I get sick. Carrot, celery, I get sick. Peaches, I get sick. Hazelnut, which sucks. I'm lost. You're going to talk to me again? What are you going to sit me down and have a talking with me? Am I going to get put in the corner, Kate? Kate's going to put Eddie in the corner. Her motherly instincts are coming out. Cantaloupe, yeah, I got the same problem with cantaloupe, honeydew. Oranges do the same thing. Watermelon doesn't do it to me, though, I don't think. Anyways. So I guess this is a real thing. And they say, and watch, so I was reading, you can't get tested for this. Thank you, Vinny Wynn. It says people who are allergic to pollen are accustomed to runny eyes, sniffles this time of year, but some seasonal allergy sufferers have it worse. They can develop allergic reactions to common fruits and vegetables. That's what I'm going through right now. These reactions are usually mild, can come on suddenly, and people can react to foods they have been eating with no problem for most of their lives. Here we go. This is me. It's called oral allergy syndrome. I do think that this is one of the most underreported and under-recognized conditions, says this doctor. People who have it are allergic to plant pollens. Oh yeah, whenever the trees are blooming here in California, it sucks for me. So the immune system can mistake the fruit and vegetable proteins for the plant pollens that are causing the allergies. Wow, that's crazy. It's called cross-reactivity. Just add another fucking problem to my list. Bananas were the trigger for Jessica. Yeah, I get that. And I love bananas. Shut up. I already know what you guys are saying. Yeah, so there you go, folks. Real quick. I don't know, are you there yet, Mr. Bill? Are you going to be on YouTube and, Twitch? Let's look up only Mr. Bill. By the way, if you guys like, watching, if you guys like Connect 4, check this out. Only Mr. Bill likes to play Connect 4. So you can go in his chat room and you can play him at Connect 4. He kicked my ass. Thank you, Digglewarp. He kicked my ass in Connect 4. So, let's see what's good on YouTube right now. Both, yeah, only me. Oh, you're the only one there? You're the only one there? Well, that sucks. You drove all... Wait a minute. So you're telling me you drove 3 hours for nothing? That's really gotta suck. That's really gotta suck. What is there to do in Olympia? I'm trying to think. I stopped for Olympia for gas. That was about it. I stopped for gas when I went to Seattle last time, but that was about it. Let's see if there's anything interesting. Deep sea sharks. See, I like watching documentaries like this. I don't know why. Just my personality, I guess. Chingo Blink. I just found out. So I used to listen to this guy. He's like a Hispanic rapper. He actually made a Let's Go Brandon song in Spanish. Watch this. It's called Vamos Brandon. I didn't really like it, but I only heard like a few seconds of it. So let's play it.
Let's go, Brandon! Vamos, Brandon!
The battle for America today is no longer right versus left, folks. It is those who deny freedom and those who defend it. Americans of all races, religions, backgrounds, financial status are uniting.
Vamos, Brandon! Do you smell that? That's that freedom. Vamos, Brandon! No matter what, I need my freedom. Vamos, Brandon! Keep your hands off our guns.
Damn, he went country. See, I'm used to, let's see, Chingo Bling, ostrich boots, ostrich boots, right? This was the song I'm used to music like this.
Like a cumbia king, but that's alright, my diamonds chime.
This is from the 90s. This is like my kind of music back in the day.
Don't speak English, what did he say? Have you ever seen the Mexican platinum?
Oh yeah. Anyways, I don't want to get copyright hit here on YouTube because you know they like messing with me. But that's Chingo Bling. I was totally surprised though to find out that he went from being freaking straight up liberal to now he's a conservative and sings about it. I love it. Let's see if there's anything good going on here. Ooh, I love watching stuff about trains too. I don't know about you guys. She's back. Liberty Hangout. I used to watch her all the time. Not so much anymore. Nothing really going on. And if you guys go to Common Sense Conservative, he's been doing a lot of villain stuff lately. He was very good friends with Villain. World's biggest air package handling. You know what? Something I'd watch. Something I'd watch. Hey, only Mr. Bill Gra is telling you to check your messages over there, okay? Check your messages and your DMs. He's sliding into your DMs. All right, guys. So you know what then? I'll be back on here in 2.5 hours. I gotta go. I got a little bit of light left. I got to go get the mail. I got to go up the hill, get the mail, and I got to unload my truck so that way I can get my truck cleaned because we're heading to Arizona tomorrow. Arizona bound, baby. All right, guys, so we'll be back later on, and we are going to be discussing, what's that topic again? God rides a Harley? Here, let me put it, gosh darn it. I was just looking at it. So it is the 45 communist goals from 58 years ago. We're going to be talking about this tonight, along with our normal news show, you know. So, all right, guys, thank you for being here. And we will be back in 2.5 hours, guys. Not 2.5 men. 2.5 hours. Catch you all later on the flip side.